കത്തി വേറെ ഉണ്ടോ? കയറാൻ പറ്റുമോ?
கேட்கவும் தெரிய மாட்டேங்குது. உட்காந்து எல்லாம் பற்றியா அப்புறம் இருக்கட்டும். உங்களை நீங்க பார்த்து பசங்கள்லாம் இது நம்பவே முடியாது. எப்போ பார்த்தாலும் கம்ப்யூட்டர் வயசானவங்க தான் என்ன வேணும் கவனிக்கணும் தெரியல. பேசி டைம் வேஸ்ட் உட்காந்து எல்லாம் பற்றியா அப்புறம் இருக்கட்டும். உங்களை நீங்க பார்த்து பசங்கள்லாம் இது நம்பவே முடியாது. வயசானவங்க புரியாத செல்லுக்கு ரெடியா இருக்கு. வயசானவங்க என்ன வேணும் கவனிக்கணும் பார்த்தாலும்
பார்க்கணும். அதுக்கப்புறம் தான் அது அப்ப பண்ணு. ரெடியா போலாமா? ஆனா 9 மணிக்கு தான் சொல்லியிருக்கேன் நான் பெரியவாள்கிட்ட. எங்க அதுக்கப்புறம் தான் அது ரைட் வரட்டும். அதுக்கப்புறம் பாரு சொஸ்தி சொல்லணும். அவர் காதுல வேணும். அதுக்காக சொல்லிட்டு இருக்கேன். நீ முதல்ல விக்னேஸ்வர பூஜை பண்ணிட்டு விக்னேஸ்வர பூஜை ஆட்டம். அதுக்கப்புறம் சங்கல்ப திருப்பி 9 மணிக்கு சொல்லியிருக்கேன். அதுதான் எப்ப ஒரு பாதி இருக்கும் போது விட முடியாது. அதுக்காக சொன்னேன். வரட்டும். எத்தனை வந்து உட்காந்துட்டார். என்ன பாக்குறாரு பாரு. நான் தெரிவேன் பாரு. அதுதான் எப்ப ஒரு பாதி இருக்கும் போது விட முடியாது. அதுக்காக சொன்னேன். வரட்டும். வந்து உட்காந்துட்டார். என்ன பாக்குறாரு பாரு. நான் தெரிவேன் பாரு. நம்ம பேசின கால் விழுமா உங்களுக்கு?
விழுது.
கேக்குமா?
கேக்கு.
எல்லாரும் வந்துட்டே இருக்கா பெரியவா அப்படின்னு எல்லாருக்கும் வெளியில சொல்லியிருக்கோம். பப்ளிக்குலாம் 8:30 மணிக்கு ஹோமம் ஆரம்பிக்கும், 9 மணிக்கு ஆச்சாரியருடைய அனுகிரக பாஷணம் இருக்கும்.
அவசரம் இல்ல, அவ பாட்டுக்கு
சங்கல்ப சுரந்தன் வந்துட்டார்.
சுரந்தன் பண்றது பண்ணிட்டு இருக்கட்டும், ஒன்னும் அவசரம் இல்லை, நிதானமா பாட்டு பண்ணிட்டு இருக்கட்டும். நாங்க இங்க
எல்லாருக்கும் வெளியில சொல்லியிருக்கோம்.
அவசரமே இல்ல,
9 மணிக்கு ஆச்சாரியருடைய அனுகிரக பாஷணம்.
அவசரம் இல்ல, அவ பாட்டுக்கு
சங்கல்ப சுரந்தன் வந்துட்டார்.
சுரந்தன் பண்றது பண்ணிட்டு இருக்கட்டும், ஒன்னும் அவசரம் இல்லை, நிதானமா பாட்டு பண்ணிட்டு இருக்கட்டும். நாங்க இங்க
எல்லாருக்கும் வெளியில சொல்லியிருக்கோம்.
அவசரமே இல்ல,
9 மணிக்கு ஆச்சாரியருடைய அனுகிரக பாஷணம்.
அவசரம் இல்ல, அவ பாட்டுக்கு
சங்கல்ப சுரந்தன் வந்துட்டார்.
சுரந்தன் பண்றது பண்ணிட்டு இருக்கட்டும், ஒன்னும் அவசரம் இல்லை, நிதானமா பாட்டு பண்ணிட்டு இருக்கட்டும். நாங்க இங்க
எல்லாருக்கும் வெளியில சொல்லியிருக்கோம்.
அவசரமே இல்ல,
காது வேலை வா, என்ன பேசுறாங்க காது வேலை.
அவசரம் இல்ல, அவ பாட்டுக்கு சுரந்தன் வந்துட்டார். சுரந்தன் பண்றது பண்ணிட்டு இருக்கட்டும், அவசரம் இல்லை, நிதானமா பாட்டு பண்ணிட்டு இருக்கட்டும். நாங்க இங்க
எல்லாருக்கும் வெளியில சொல்லியிருக்கோம்.
அவசரமே இல்ல,
காது வேலை வா, என்ன பேசுறாங்க காது வேலை.
அவசரம் இல்ல, அவ பாட்டுக்கு சுரந்தன் வந்துட்டார். சுரந்தன் பண்றது பண்ணிட்டு இருக்கட்டும், அவசரம் இல்லை, நிதானமா பாட்டு பண்ணிட்டு இருக்கட்டும். நாங்க இங்க
எல்லாருக்கும் வெளியில சொல்லியிருக்கோம். எல்லாரும் ஒரு நிமிஷம் எழுந்து நிக்கணும். இது தெற்கு. ஒன்றும் இல்லை, பெரியவா பேசுறதுக்கு முன்னாடி நான் ஸ்வஸ்தி ஸ்ரீயும் ஸ்வாகத்தமும் சொல்லிடுறேன். பெரியவா பேசினா பப்ளிக் எல்லாம் பார்த்துட்டு இருக்கா எல்லா ஊர்ல இருந்தும், அது சரியா இருக்கும்னு தோன்றது. உத்தரவு பெரியவாட்ட நீ சிக்னல் நான் ஆரம்பிச்சிருவேன். கரெக்டாக 8:59 நான் ஆரம்பிச்சிருவேன். இன்னும் 8 நிமிஷம். தேங்க்ஸ். ராம் ராம். சொல்லு. இப்போ இப்போ இப்ப இருக்கான பாரு, இப்ப தெரியும் பாரு. சரி சரி சரி, ரைட் ரைட். ஓகே ஓகே. நான் ஸ்கிரீனை பார்த்தா என்னோட ஆப் தான் தெரியுது. நீ கேமரா பார்த்து பேசு, அப்பதான் தெளிவா பார்க்க முடியும் அப்படின்னா நான் சொல்லிட்டேன். கரெக்டா 8:59 ஆரம்பிக்கிறேன் அப்படின்ட்டேன். சுனஞ்சிஜி, நீங்க பிள்ளையார் பூஜை பண்ணிக்கோங்க. நான் ஸ்வஸ்தி சொல்லி திருவிழாவுக்கு சுவாகத்தம் சொல்லி தெளிவா பேசட்டும். 10 நிமிஷம் பேசுறதுக்கு அப்புறம் ஆரம்பிக்கலாம். சரியா? ஆனா இது வந்து சேர்த்து நம்மளால பண்ண முடியாது. ஒன்னும் காமிக்கிறது தெளிவா பார்த்துட்டு இருக்காங்க நான் இருந்து. குட்டி கூப்பிட்டுருந்தியா? ஓகே. கரெக்டா 8:59 என்ன காமிக்கணும் சொல்லிட்டு. ஸ்வஸ்தி ஸ்ரீ சொல்லும் போது எல்லாரும் எழுந்து நிக்கணும். சரியா? மொத்த பேருக்கும் இன்ஸ்ட்ரக்ஷன். அப்போ சொல்லிடுவோம். அப்போ ஒரு தடவை கேமரா ஒரு தடவை அப்படி சுத்தி காமினேன் ஒரு செகண்டுக்கு. எல்லாம் நிற்கிறாங்கிறது தெரியணும் சுவாமி. ஒரு இது ஒண்டி காமிக்காத, பாதி நேரம் இருக்கும்போது அவர் பார்க்கும்போது எவ்வளவு பேர் இருக்காங்கிறது அவருக்கு தெரியணும். இவ்வளவு பேர் வந்திருக்காங்க அப்படிங்கறது அவர் பார்க்கணும், நிற்கிறா அப்படின்றது தெரியணும். எட்டு 8:59 சொல்லுங்களேன். ஆயிடுதா? 8:50 ஆயிடுதா? 9 ஆயிடுதா? அப்ப காதல் விளம்படி பண்ணுங்க. ஸ்ரீ குருभ्यो நமः. ஸ்ருதி ஸ்மிருதி புராணானாம் ஆலயம் கருணாலயம் நமாமி பகவத்பாதம் சங்கரம் லோகசங்கரம் அபார கருணா சிந்தும் ஞானதம் சாந்த ரூபிணம் ஸ்ரீ சந்திரசேகர குரும் பிரணமாமி முதான்வகம். ஸ்ரீ குருभ्यो நமः. अद्य आश्वयुज तथा तुलामासस्य कृष्णपक्ष त्रयोदशी शुभदिनम्. अद्यैव क्षीरसागर मथन संदर्भे धन्वंतरि भगवान् अमृतकलशहस्तः क्षीराब्धेः समुत्थाय व्याधि समाकीर्णमिमं जनकुलं व्याधिभ्यः मोचयितुम् अहं हि धन्वंतरि राधिदेवः जरा रुजा मृत्यु हरोमराणां शल्याङ्ग मंगैरपरैरुपेतं प्राप्तोऽस्मि गां भूय इहोपदेष्टुम् इति सुश्रुत संहितायां यथा भगवतः मुखेनैव इयं वाग् उत्सृष्टा वर्तते तथा अद्यतन त्रयोदश्यां तिथौ धन्वंतरि भगवान् क्षीरसागरात् समुत्थितः. तदेतस्मिन् शुभे दिने वयं सर्वत्रापि धन्वंतरि जयन्ती इति सोत्सवं वैभवम् आचरामः. तदस्मिन् दिने अस्माकं श्री जयेन्द्र सरस्वती आयुर्वेद महाविद्यालयस्य प्राङ्गणे धन्वंतरि जयन्ती उत्सवं सर्वकारस्य आदेशमप्यभिलक्ष्य अस्माकम् इच्छानुसारमपि अत्र पठतां छात्राणाम् अध्यापकानां निर्वाहकानां सर्वेषामपि देहे वर्तमान वर्तिष्यमान सकल रोग निवृत्ति द्वारा क्षिप्रारोग्य सिद्ध्यर्थम अद्य धन्वंतरि होमः धन्वंतरि पूजा तदनु अनेके तत्र कार्यक्रमाः अपि निश्चिताः वर्तन्ते. तदेतस्मिन् शुभावसरे अस्मान् सर्वान् अनुगृहीतुम् अस्माकं चन्द्रशेखरेन्द्र सरस्वती विश्वमहाविद्यालयस्य प्रायोजकाः ये वर्तन्ते काञ्चीकामकोटिपीठं चैरिटेबल ट्रस्ट इति तस्यैव पुनः अनुगृहीतारः वर्तन्ते काञ्चीकामकोटिपीठस्य शंकराचार्यस्वामिनः. तैमे शंकराचार्यस्वामिनः जगद्गुरवः अस्मान् सर्वान् अनुगृहीतुम् अस्माकं पुरतः विराजमानः वर्तन्ते. तेषां स्वस्ति वाचन पूर्वकं वयं तेभ्यः हार्दं स्वागतं व्याहरामः अस्माकं जयेन्द्र सरस्वती आयुर्वेद विद्यालयस्य पक्षतः. तदस्मिन् सन्दर्भे अहं युष्मान् सर्वान् अपि कञ्चित् कालम् उत्तिष्ठन्तु इति सविनयम् अभ्यर्थये. ओम न कर्मणा न प्रजया धनेन त्यागेनैके अमृतत्वमानशुः परेण नाकं निहितं गुहायां विभ्राजते तद्यतयो विशन्ति वेदांत विज्ञान सुनिश्चितार्थाः संन्यास योगाद्यतयः शुद्ध सत्त्वाः ते ब्रह्मलोके तु परान्तकाले परामृतात् परिमुच्यन्ति सर्वे दह्रं विपापं परमेश्मभूतं यत्पुण्डरीकं पुरमध्य सग्रस्थं तत्रापि दह्रं गगनं विशोकस्तस्मिन् यदन्तः तदुपासितव्यं यो वेदादौ स्वरः प्रोक्तो वेदान्ते च प्रतिष्ठितः तस्य प्रकृतिलीनस्य यः परः स महेश्वरः। ओम स्वस्ति श्रीमदखिल भूमंडलालंकार त्रयस्त्रिंशत्कोटि देवता सेवित श्री कामाक्षी देवी सनाथ श्रीमदेकाम्रनाथ श्री महादेवी सनाथ श्रीहस्तिगिरिनाथ साक्षात्कार परमाधिष्ठान सत्यव्रत नामांकित कांची दिव्य क्षेत्रे शारदा मठ सुस्थितानां अतुलित सुधारस माधुर्य कमलासन कामिनी धम्मिल्ल संफुल्ल मल्लिका मालिका निष्यंद मकरंद झरी सौवस्तिक वांग्निकुंभ विजृंभण आनंद तुंदुरित मनीषि मंडलानां अनवरताद्वैत विद्या विनोद रसिकानां निरंतरालंकृतीकृत शांति दांति भूम्नां सकल भुवन चक्र प्रतिष्ठापक श्री चक्र प्रतिष्ठा विख्यात यशोलंकृतानां निखिल पाषंड षंड कंटकोत्पाटनेन विशदीकृत वेद वेदांत मार्ग षण्मत प्रतिष्ठापकाचार्याणां श्रीमत् परमहंस परिव्राजकाचार्य वर्य श्रीमद् जगद्गुरु शंकर भगवत पादाचार्याणां अधिष्ठाने सिंहासनाभिषिक्त श्रीमद् चंद्रशेखरेन्द्र सरस्वती संयमीन्द्राणां अंतेवासिवर्य श्रीमद् जयंत सरस्वती श्रीपादानां अंतेवासिवर्य श्रीमद् शंकर विजयंत सरस्वती श्रीपादानां चरण नलिनयोः सप्रश्रयं साञ्जलिबन्धं च नमस्कुर्मः. அப்படி ஜனங்கள் இப்படி திருப்புற மாதிரி திருப்பி எல்லாரும் நமஸ்காரம் பண்ற பாருங்க. அப்படியே நமஸ்காரம் பண்ணுங்க எல்லாரும். அப்படியே ஒரு நிமிஷம் திருப்புங்களேன். எல்லாரையும் காமிக்கும். சாஞ்சலிபந்தம் ஜ நமஸ்குர்மஹ. नारायणं पद्मभुवं वसिष्ठं शक्तिं च तत्पुत्र पराशरं च व्यासं शुकं गौडपदं महान्तं गोविन्द योगीन्द्रं श्री शंकराचार्य मथास्य पद्मपादं च हस्तामलकं च शिष्यं तोटकं वार्तिककारमन्यान् अस्मद्गुरून् सन्ततमानतोऽस्मि सदाशिवसमारम्भां शंकराचार्यमध्यमाम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम्. இங்க வந்திருக்கக்கூடிய அனைத்து பெரியவர்களுக்கும் கேந்திர சரஸ்வதி ஆயுர்வேத சார்பாக வருக வருக என்று வரவேற்பை நல்குகின்றோம். இன்று துலா மாசத்தினுடைய ஐப்பசி மாசத்து கிருஷ்ணபக்ஷ திரையோதசி திதி. இன்று தன்வந்திரி பகவான் பார்க்கடலிலிருந்து தேவர்களும் அசுரர்களும் பார்க்கடலை கடைய அவர்களுக்கு அமிர்தம் தர வேண்டி தேவர்களுக்காக அமிர்தம் என்றது தேவ குணம் உள்ள அனைத்து நல்லவர்களுக்கும் நல்ல ஆரோக்கியம் ஏற்பட வேண்டும் என்பதற்காகவே அவர் அமிர்த கலசத்தை ஏந்தி வந்தார். அந்த நிலம் இன்று அனுஷ்டிக்கப்படுகிறது என்பதனால இன்னைக்கு நம்ம ஆயுர்வேத காலேஜ் ஜெயந்திர சரஸ்வதி ஆயுர்வேத காலேஜ்ல தன்வந்திரி பூஜைகள் தன்வந்திரி ஹோமங்கள்லாம் நடக்கிறது. இதுல கலந்துக்கிறதுக்காக நிறைய பேர் வந்திருக்காங்க. இங்க வந்திருக்கிறவங்களை எல்லாமும் காலேஜில் போன வருஷம் சேர்ந்த புது பேட்ச் அட்மிஷன் ஆனவங்க யூஜி பிஜி லெவல்ல இருக்கிறவங்க எல்லாரையும் இன்னைக்கு ஆசீர்வதிக்கிறதுக்காகவும் இந்த பூஜையில நிறைய பேர் சங்கல்பம் பண்ணி இந்த மருந்து தயாரிச்சிருக்கோம், கொரோனா கிட்டுன்னு தயாரிச்சிருக்கோம், கொரோனா வராததை தடுப்பதற்காகவும் வந்த நோய் வந்து அவர்களுக்கு உடல்ல ஏதாவது பின்விளைவுகளாக இருக்கக்கூடியதான அந்த நோய்களை எல்லாமும் தீர்ப்பதற்கான மருந்துகளை எல்லாம் தயார் பண்ணி இன்னைக்கு சுவாமிக்கு முன்னாடி வச்சு அதெல்லாம் நைவேத்தியம் பண்ணி இது வெறும் மருந்தா மட்டும் கொடுக்காத மருந்தோட சேர்ந்து பிரசாதமாக ஆச்சாரிய சுவாமிகளுடைய சேர்த்து இன்று நமக்கு எல்லாம் அதை கொடுக்கும்படியாக அவருடைய உத்தரவின் பேரில் ஏற்பாடாயிருக்கு. அவரவர்கள் வீட்டுல இந்த தன்வந்திரி பூஜையையும் ஹோமத்தையும் பண்ண முடியாத சூழ்நிலையில அவர்களுக்காக நாம பண்ணணும் அப்படின்னு ஆச்சாரிய சுவாமிகள் இந்த சமாஜத்தின் மேலே இந்த சமூகத்தின் மேல இருக்கக்கூடியதான அவருடைய அபார கருணையினுடைய ஒரு விளைவாக இந்த ஹோமங்கள் இங்கு நடைபெறுகின்றது. நிறைய மக்கள் இந்த சங்கல்பத்திலும் இந்த மருந்து வாங்கிக்கிறதுலையும் ஆர்வம் காட்டி அதற்குண்டான முயற்சிகள் எல்லாம் அவங்க செஞ்சிருக்காங்க. எல்லோரையும் யூடியூபின் வழியாக இப்போ டைரக்டா பார்த்துட்டு இருப்போம். நம்மளாம் அத்தனை பேரையும் அனுகிரகித்திற்காக சங்கராச்சாரிய சுவாமி முதல்ல வந்திருக்காங்க. அவர் நம்மளெல்லாம் முதல்ல ஆசீர்வச்சனம் பண்ணி 10 நிமிஷம் பேசுவார். அதற்கப்புறம் லைவா நம்ம வந்து இந்த ஹோமத்தையும் நம்ம பார்க்கலாம். இப்பொழுது பரமாச்சாரிய சுவாமியுடைய சரணார் விந்தங்கள்ல நமஸ்காரம் பண்ணி நாங்க பிரார்த்தனை பண்ணிக்கிறோம். அவர் அனுகிரக பாஷணத்தை அருளி நம்ம எல்லாம் உயிர்விக்க வேண்டும் என்று அவரது சரணார் விந்தங்களிலே கேட்டுக்கொள்கிறோம். அரஹர சங்கர ஜெய ஜெயசங்கர.
गुरुर् ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरु साक्षात् परम ब्रह्म तस्मै श्री गुरवे नमः. கேக்குறதா கோபி? சரி, ஓகே, கேக்குறது சார். ரைட் ரைட். सर्वमंगल मांगल्ये शिवे सर्वार्थ साधिके शरण्ये त्र्यंबके गौरी नारायणी नमोस्तुते. சந்தாபக்னம் சகல ஜகதாம் ஷார்ங்க சாபாபிராமம் லக்ஷ்மி வித்யுல்லசித மதசீமுச்ச சச்சாய காயம் வைகுண்டாக்கியம் முனிஜனமன சாதகானாம் சரண்யம் காருண்யாபம் ததச பரிஷத் காலமேகம் ததர்ஷ. அந்த காலத்திலே காலை நேரத்திலே ஸ்நானம் செய்யும் பொழுது அந்த மகாவிஷ்ணுவனுடைய பிரார்த்தனையாக இந்த சந்தாபக்னம் சகல ஜெகதாம் என்பதை சொல்வதாக ஒரு ஐதீகம். காலை நேரத்திலே நாம் சொல்லக்கூடிய பிரார்த்தனா ஸ்லோகம். அதிலே முதல் வரியானது சந்தாபக்னம் சகல ஜெகதாம், சந்தாபத்தை போக்கக்கூடிய சகல ஜெகதாம் சந்தாபக்னம். அந்த பெருமாள் எப்படிப்பட்டவர் என்றால் அனைத்து ஜீவராசிகளுடைய தாபத்தையும் போக்குபவர். இன்றைய நிலையிலே இந்த தாபங்கள் 3 விதம், தாபத்ரயம் என்று சொல்வார்கள். சாங்கிய தத்துவ கௌமுதியிலே துக்கத்ரயாபிகாதாத் ஜிஜ்ஞாசா ததபகாதகே ஹேதௌ திருஷ்டே சா பார்த்தா சேன்னைகாந்தாத்யந்ததோ பாவாத். துக்கத்ரயாபிகாதாத், துக்கத்ரயம் ஆதி பௌதிக, ஆதி தெய்வீக, ஆத்தியாத்மிக என்று பலவிதமான துக்கங்கள். அந்த பலவிதமான துக்கங்கள் கஷ்டங்கள் இருந்து புயல், பூகம்பம், அனாரோக்கியம், மனசிலே நிம்மதியின்மை, மனசிலே ஸ்திரத்துவம் இன்மை, சாஞ்சல்யம், சாபல்யம், இது போன்ற பல வியாதிகளை நீக்குவதற்காக நம்முடைய தேசத்திலே 2 விதமான பிரயத்தனங்கள் நடைபெற்று வருகின்றன. ஒன்று, நல்ல பிரார்த்தனைகள், நல்ல அனுஷ்டானங்கள், நல்ல தபசு, நல்ல மௌனம், நல்ல ஆகார நியமங்கள், நல்ல சிந்தனை, இவைகள் மூலமாக மனிதர்களுக்கு தாபங்கள் இல்லாமல் செய்த. இரண்டாவது, மூலிகைகள் மூலமாக, மருந்துகள் மூலமாக, யோகாபியாசம் மூலமாக, பிராணாயாமம் மூலமாக, நல்ல பால் மூலமாக, நல்ல நெய் மூலமாக, நல்ல ஆகார பழக்க வழக்கங்கள், நல்ல தீர்த்தத்தை குடிப்பதன் மூலமாக, நன்றாக தூங்குவதன் மூலமாக, நன்றாக முழித்துக் கொண்டிருப்பதன் மூலமாக, யுக்தாஹார விஹாரஸ்ய யுக்த சேஷ்டஸ்ய கர்மசு யுக்த ஸ்வப்னாவபோதஸ்ய யோகோ பவதி துக்கஹா. துக்கத்தை போக்கக்கூடிய யோகமானது யுக்தாஹார விஹாரஸ்ய என்பது சொல்லப்பட்டிருக்கிறது. அப்படிப்பட்ட இந்த தாபத்தை போக்கக்கூடிய இந்த முயற்சி ஆயுர்வேத விஞ்ஞானத்தின் மூலமாக, ரிஷிகள் மூலமாக இந்த கண்டுபிடிக்கப்பட்ட கொடுக்கப்பட்ட இந்த விஞ்ஞானம், சயின்ஸ் ஆனது மக்களுக்கு வாத பித்த கப ஸ்லேஷ்மா என்று சொல்லக்கூடிய பல்வேறு உபதிரவங்களை நீக்கி கல்யாணத்தை, நல்லதை கொடுத்து கொண்டிருக்கிறது. அந்த ஆயுர்வேத விஞ்ஞானத்தை சரியான முறையிலே பரப்புவதற்கும், விஸ்தாரம் செய்வதற்கும், புரிந்து கொள்வதற்கும், உபயோகப்படுத்திக் கொள்வதற்கும் ஒரு வித்யா சம்ஸ்தையானது தேவை என்கிற உத்தேசத்தோடு குறிப்பாக தமிழ்நாட்டிலே இந்த அமைப்பு தேவை என்பதற்காக. அதாவது தமிழ்நாடு என்பது பிராச்சீனமான கலைகளை, விஞ்ஞானங்களை, உபனிஷத்துகளை, வேதங்களை எல்லாம் நல்ல முறையிலே காப்பாற்றி உலகத்திற்கு சேவை செய்து வந்த பூமி. இதிலே இடையிலே ஏற்பட்ட தடைகளின் காரணமாக, வசதியின்மையின் காரணமாக, தப்பாக புரிந்து கொண்டதன் காரணமாக பயனற்றது, நமக்கு பயனை அளிக்கக்கூடிய சக்தி நமக்கு நவீனத்தின் மூலமாக கிடைக்கும், பழமையின் மூலமாக கிடைக்காது என்கிற எண்ணத்தின் காரணமாகவும் பல சாஸ்திரங்களை படிப்பது நின்றுவிட்டது. பல ஸ்தாபனங்கள் தொடர்ந்து செயல்பட முடியாத அளவுக்கு இங்கே சாஸ்திரங்களுக்கும் சமுதாயத்திற்கும் இருக்க வேண்டிய தொடர்பு குறைந்துவிட்டது. அந்த சாஸ்திரங்களுக்கும் சமுதாயத்திற்கும் ஏற்பட வேண்டிய தொடர்பை புதுப்பித்து வலுப்படுத்தி நம்முடைய பெரியவர்கள் ஸ்ரீ ஜெயேந்திர சரஸ்வதி சுவாமிகள் நம்முடைய பெரியவர்களுடைய ஆசியோடு ஸ்ரீ சந்திரசேகரேந்திர சரஸ்வதி விஸ்வ மகாவித்யாலயா ஆரம்பிக்கப்பட்டு அதனுடைய அங்கமாக ஸ்ரீ ஜெயேந்திர சரஸ்வதி ஆயுர்வேத காலேஜ் மற்றும் ஹாஸ்பிட்டல், இங்கு சமஸ்கிருத எஜுகேஷன் சொசைட்டியினுடைய அனுகூல தன்மையோடு இந்த இடத்திலே பூந்தமல்லி நசரத்பேட்டையிலே சிறப்பாக நடந்து வருகிறது. தமிழ்நாட்டிலே ஆயுர்வேத விஞ்ஞானத்தை பரப்பக்கூடிய விதத்திலே பலரும் பல மாநிலங்களை சார்ந்தவர்களும் அங்கு படிக்கிறார்கள் மற்றும் ஆசிரியர்களாகவும் இருக்கிறார்கள். அது ஒரு தேசிய ஆயுர்வேத ஒரு இயக்கமாக இந்த ஸ்ரீ ஜெயேந்திர சரஸ்வதி ஆயுர்வேத காலேஜ் மற்றும் ஹாஸ்பிட்டல் திகழ்ந்து வருகிறது. பல கிராமங்களிலிருந்து முதல் முறையாக ஆயுர்வேதம் படிப்பவர்கள் மற்றும் முதல் முறையாக சமஸ்கிருதம் பயிலுபவர்கள் இதிலே பயின்று, அதாவது 16 வயதுக்கு மேற்பட்டும் புதியதாக ஒரு கல்வியை சிறப்பாக படிக்க முடியும் என்பதையும், புதியவர்களுக்கும் இந்த சமஸ்கிருதத்தையும் இந்த ஆயுர்வேதத்தையும் சிறப்பாக சொல்லித்தர முடியும் என்பதையும் இந்த கல்லூரியின் மூலமாக நிகழ்த்தி காட்டிக் கொண்டிருக்கிறார்கள். இதிலே ஈடுபட்டிருக்கக்கூடிய நிர்வாகிகள், ஆசிரியர்கள் மற்றும் மாணவர்கள் மற்றும் பெற்றோர்கள் இந்த ஆயுர்வேதத்தை வளர்க்கக்கூடிய இந்த இயக்கத்திலே மேலும் சிறப்பாக செயல்பட்டு நம்முடைய நாட்டிலே, குறிப்பாக தமிழ்நாட்டிலே இந்த ஆயுர்வேதத்தினுடைய பலன்கள், இயற்கை மருத்துவத்தினுடைய பலன்கள் சமீப காலமாக 5-6 மாதங்களாக உலகத்திலேயும் குறிப்பாக இந்தியாவிலேயும் இருக்கக்கூடிய அசாதாரண சூழ்நிலையில் மத்தியிலே இந்த இயற்கை மருத்துவத்தினுடைய முக்கியத்துவமும் அரசாங்கமும் உணர்ந்திருக்கிறது, பொதுமக்களும் உணர்ந்திருக்கிறார்கள். ஆகவே இந்த நேரத்திலே சரியான முறையிலே, சிறப்பான முறையிலே இயற்கை மருத்துவத்தை சார்ந்தவர்கள் பொதுமக்களுக்கான உதவிகளை நல்ல முறையிலே செய்து பொதுமக்களுக்கான சேவையை மேன்மேலும் செய்ய வேண்டும். அதற்காக இன்றைய தினம் தன்வந்தரி ஹோமத்தோடு சேர்ந்து இங்கு தயார் செய்யப்பட்ட சில மருந்துகளையும் பொதுமக்களுக்காக அளிக்க இருக்கிறார்கள். இன்றைய தினம் ஸ்ரீ தன்வந்தர ஜெயந்தி. இந்த சந்நிதியானது, தன்வந்தரி சுவாமியினுடைய சந்நிதியானது இங்கு தேனம்பாக்கத்திற்கு பக்கத்திலே இருக்கக்கூடிய சின்ன காஞ்சிபுரம் விஷ்ணு காஞ்சியிலே பெருமாள் கோவிலிலே தன்வந்தரி சந்நிதி அமைந்திருக்கிறது. பிராச்சீனமான சந்நிதி அமைந்திருக்கிறது. மாணவர்களும் மாணவிகளும் அந்த நேரம் கிடைக்கும் போது அந்த சந்நிதியை தரிசனம் செய்து கொள்ளலாம். நேஷனல் ஆயுர்வேதா டே சில வருஷங்களிலே ஒரு முன்னேற்றமாக யுனைடெட் நேஷன்ஸ் யோகா டே என்று கொண்டாடப்படுகிறது. சர்வதேச யோகா தினம் என்று கொண்டாடப்படுகிறது. நம்முடைய இந்திய விஞ்ஞானமான யோக சாஸ்திரம் உலக ரீதியிலே ஒரு நல்ல வரவேற்பை பெற்றிருக்கிறது. பல நாடுகளிலேயும் அந்த யோகாவை ஒரு கலையாக, ஒரு அறிவியலாக, ஒரு வழிபாட்டு முறையாக என்று சொல்லலாம். அதுபோன்று அந்த யோகாவை மேன்மேலும் உபயோகப்படுத்தி பயன்பெற்று வருகிறார்கள். அதுபோன்று ஆயுர்வேதமும் யோகாவினுடைய வரிசையிலே மேன்மேலும் மக்களுக்கு புரியும் விதத்திலேயும் உபயோகப்படும் விதத்திலேயும் குணப்படுத்தும் விதத்திலேயும் ஆயுர்வேதத்தினுடைய வளர்ச்சியும் ஏற்பட்டு இந்த நேஷனல் ஆயுர்வேதா டே என்பதானது நல்ல பலனை அளித்து விவசாய மக்கள் இந்தியாவிலே இருக்கக்கூடிய கன்னியாகுமரியிலிருந்து காஷ்மீரம் வரையிலே இருக்கக்கூடிய மக்கள் மத்தியிலே அதற்கு ஒரு விழிப்புணர்வு ஜாகிருதி என்பது ஏற்பட்டு சிறப்பான முறையிலே இந்த ஆயுர்வேத படிப்பு அரசாங்கத்தினுடைய, அதாவது மாநில அரசாங்கத்தினுடைய நோ அப்ஜெக்ஷன் சர்டிபிகேட் NOC இவையும் பெற்று மேல் படிப்பும் சில துறைகளிலே இங்கு துவக்கப்பட்டிருக்கிறது. ஸ்ரீ ஜெயேந்திர சரஸ்வதி ஆயுர்வேதா காலேஜ் மற்றும் மருத்துவமனையிலே அந்த மேல் படிப்பிலேயும் பலரும் சேர்ந்து வருகிறார்கள். இதை முழுமையாக மாணவ சமுதாயம் உபயோகப்படுத்தி கொண்டு பட்டப்படிப்பு மற்றும் மேல் படிப்பையும் சிறப்பாக படித்து ஆராய்ச்சிகளையும் செய்து இந்த ஸ்தாபனமும் சரி, இதன் மூலம் பொதுமக்களும் சரி, புதிய இளம் தலைமுறையை சார்ந்தவர்களும் சரி பயன்பெற்று நம்முடைய பெரியவர்களுடைய தொலைநோக்கு மற்றும் மனிதாபிமானத்தினுடைய மற்றும் கலாச்சார விஞ்ஞான ஒற்றுமை அதனுடைய அடையாளமாக விளங்கக்கூடிய இந்த ஸ்தாபனம் மேன்மேலும் சிறப்பான முறையிலே அனைவருடைய உழைப்பு ஒத்துழைப்பின் மூலமாக சிறந்த பலனை அளித்து இந்த குருவினுடைய அனுகிரகத்தையும் தன்வந்தரி சுவாமியினுடைய அனுகிரகத்தையும் முதல்ல சொன்ன போது தன்வந்தரி எதற்காக சுவாமி அவதாரம் பண்ணார்ல சொன்னார். அந்த அனைவருக்கும் ஆரோக்கியம், அனைவருக்கும் சுபிட்சம், அனைவருக்கும் பாதுகாப்பு என்கிற அந்த தன்வந்தரியினுடைய அனுகிரகத்தை மேன்மேலும் பெற்று சிறப்பான வாழ்வை வாழ்வதற்கு பிரார்த்தனை செய்வோம். ஹரஹர சங்கர, ஜெய ஜெய சங்கர. தற்பொழுது ஹோமம் ஆரம்பித்திருக்கிறார்கள். தொடர்ந்து இந்த சுரந்தன் நம்பூதிரி மூலமாக இங்கேயே படித்து இங்கேயே வாத்தியாரா இருந்து இங்கேயே தனியார் எல்லா ஆஸ்பத்திரியெல்லாம் பண்ணிட்டு இருக்கார். மந்திரம் மணி மந்திர ஔஷதம் என்பதை உபயோகப்படுத்தி வைத்தியமும் இருக்கிறது, மணி மந்திரங்களும் இருக்கின்றன. அது மந்திரம் இருக்கிறது, மணியும் அது சேரும் நினைக்கிறோம். அது சேர்ந்து அது ஒரு நிகழ்ச்சி நடைபெற்றது. மணிமந்திர ஔஷதம் என்று ஒரு 2-3 வருஷங்களுக்கு முன்பாக இந்த காலேஜிலே ஒரு செமினாரும் நடைபெற்றது. அது போன்று நல்ல நிகழ்ச்சியோடு, ஆன்மீக நிகழ்ச்சியோடு இந்த விழா நடைபெற இருக்கிறது. ஹரஹர சங்கர, ஜெய ஜெய சங்கர். ரைட், நல்லது. ஓகே, தொடர்ந்து பண்ணுங்க. மாத்திரம்
Please. Thank you. சுவாமிக்கு வை. பக்கத்துல பின்னாடி அவ்வளவுதான். இப்படி வைக்க மட்டுமா? எப்படி சொல்றீங்க? द्वारा श्री परमेश्वर प्रीत्यर्थम शुभे शोभने मुहूर्ते आद्य ब्रह्मणः द्वितीय परार्धे श्वेतवराह कल्पे वैवस्वत मन्वन्तरे अष्टाविंशतितमे कलियुगे प्रथमे पादे जम्बूद्वीपे भारतवर्षे भरतखण्डे मेरोः दक्षिणे पार्श्वे शकाब्दे स्मिन्वर्तमाने व्यावहारिके प्रभवादि संवत्सराणां मध्ये शार्वरी नाम संवत्सरे दक्षिणायने शरदृतौ तुलामासे चान्द्रमानरीत्या निज आश्वयुज मासे कृष्ण चित्रा नक्षत्र प्रीति योग आयुष्मान तदुपरि आयुष्मान योग गरकर्ण तदुपरि वणिजाकर्ण एवं गुणविशेषण विशिष्टायां अस्यां वर्तमानायां त्रयोदश्यां शुभतिथौ परमेश्वर प्रीत्यर्थं श्री जयंत सरस्वती आयुर्वेद महाविद्यालयस्य अधिकृतानां माणवकानाम् अध्यापकानां छात्राणां कर्मकराणां सर्वेषां एवमेव लोके आसेतु हिमाचलवर्तिनां सर्वेषां भारतीयानां चतुर्दश भुवनेषु वर्तमानानां सर्वेषाम् आकीट ब्रह्मत्वेन विराजमानानां सर्वेषामपि क्षेमस्थैर्य धैर्य वीर्य विजय आयुरारोग्य ऐश्वर्याभिवृद्ध्यर्थम अरोगदलगात्रता सिद्ध्यर्थम ज्ञान वैराग्य सिद्ध्यर्थम विशेषतः आयुर्वेद छात्राणाम् आयुर्वेद विद्यायां श्रद्धा भक्ति सिद्ध्यर्थम अध्ययने एकाग्रता बुद्धि सिद्ध्यर्थम विशेषतः लोके वर्तमान सर्वेषां महाजनानां शरीरे वर्तमान वर्तिष्यमान सकल रोग निवृत्ति द्वारा क्षिप्रारोग्य सिद्ध्यर्थम विशेषतः श्रीवत्सगोत्रस्य मनूर श्रीनिवास शर्मणः अपभरणी नक्षत्रे मेषराशौ जातस्य सत्यवती नाम्न्याः अनुराधा नक्षत्रे वृश्चिकराशौ जातायाः एवं अपराजिता गायत्री नाम्न्याः पूर्वफल्गुनी नक्षत्रे सिंहराशौ जातायाः एवं आदित्य अभिराम शर्मणः मृगशीर्ष नक्षत्रे वृषभराशौ जातस्य एवं गोपालकृष्णन रामस्वामी शर्मणः भारद्वाज गोत्रस्य पूर्वाषाढ़ा नक्षत्रे धनुराशौ जातस्य गोपालकृष्ण शर्मणः तथैव कन्या राशौ उत्तर फल्गुनी नक्षत्रे कन्या राशौ जातस्य पद्मनाभ शर्मणः कौंडिन्य गोत्रस्य तथैव सोमसुंदर शर्मण अपभरणी नक्षत्रे वादूल गोत्रस्य तथैव अश्विनी नक्षत्रे गोविंद शर्मण के ज्येष्ठा नक्षत्रे जातस्य प्रदीप शर्मणः रामस्वामी शर्मणः पूर्वाषाढ़ा नक्षत्रे जातस्य एवमेव श्रीवत्स गोत्रस्य आश्लेषा नक्षत्रे कटकराशौ जातस्य मुरलीधर शर्मणः रोहिणी नक्षत्रे ऋषभराशौ जातस्य कोमलवल्ली नाम्न्याः पूर्व भारद्वाज गोत्रस्य ज्येष्ठा नक्षत्रे वृश्चिकराशौ जातस्य जातायाः पद्मा नाम्न्याः एवं भारद्वाज गोत्रस्य उत्तर 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 प्रोष्ठपदा नक्षत्रे जातस्य कृष्णमूर्ति शर्मणः मघा नक्षत्रे जातस्य जातायाः भागीरथी नाम्न्याः श्रवण नक्षत्रे जातस्य रामसुब्रह्मण्य शर्मणः पूर्वाषाढ़ा नक्षत्रे कुंभराशौ जातस्य जातायाः वीणा नाम्न्याः पूर्वफल्गुनी नक्षत्रे जातस्य श्रवण शर्मणः एवमेव कौंडिन्य गोत्रस्य श्रीकांत मृगशिरो नक्षत्रे मिथुन राशौ जातस्य श्रीकांत शर्मणः पूर्वा फल्गुनी नक्षत्रे जातायाः शांति नाम्न्याः तिरुवादिरी नक्षत्र आर्द्रा नक्षत्रे मिथुन राशौ जातायाः सुभद्रा नाम्न्याः रोहिणी नक्षत्रे कर्कट राशौ जातायाः सुहासिनी नाम्न्याः एवं अपभरणी नक्षत्रे मेषराजौ जातस्य जानकीराम शर्मणः भारद्वाज गोत्रस्य शैवं शतभिषं नक्षत्रे कुंभराशौ जातस्य लोहित गोत्रस्य जयराम शर्मणः एवं आर्द्रा नक्षत्रे मिथुनराशौ जातस्य कौंडिन्य गोत्रस्य गोत्रायाः सौभाग्यानाम्न्याः एवं शतभिषं नक्षत्रे श्रीवत्स गोत्रायाः शतभिषं नक्षत्रे जातायाः त्रिपुरसुंदरी नाम्न्याः प्रकाश जी उंगलतु वांगो शिवगोत्रस्य श्रवण नक्षत्रे मकर राशौ जातस्य करुप्पु स्वामी वर्मणः पुनर्वसु नक्षत्रे मिथुनराशौ जातायाः गोमती नाम्न्याः पुनर्वसु नक्षत्रे मिथुनराशौ जातस्य हरीशः इत्यस्य पुनर्वसु नक्षत्रे मिथुनराशौ जातस्य चक्रवर्ती इत्यस्य अपभरणे नक्षत्रे मेषराशौ जातस्य नेल्वैलार् गोत्रस्य शेषाद्रि इत्यस्य एवं अश्विनी नक्षत्रे मेषराशौ जातस्य सेल्वी इत्यस्याः उत्तराषाढा नक्षत्रे कन्या राशौ जातायाः पल्लवी नाम्न्याः अस्याः यजमानायाः चाण्डिल्य गोत्रस्य रोहिणी नक्षत्रे राशि कटकं ताने विश्वराशौ जातायाः जातस्य कृष्णशर्मणः अश्विनी नक्षत्रे मेषराशौ जातायाः मैथिली नाम्न्याः श्रीवत्स गोत्रस्य मृगशिरो नक्षत्रे मिथुनराशौ जातस्य रामचंद्र शर्मणः पूर्वाषाढा नक्षत्रे धनुराशौ जातस्य जातायाः विजया नाम्न्याः बादूल गोत्रे जातस्य आर्द्रा नक्षत्रे शुभराशौ जातस्य रामचंद्र शर्मणः रंगनाथ शर्मणः पुष्य नक्षत्रे कटकराशौ जातस्य जातायाः शांति नाम्न्याः हरितगोत्रस्य पूर्व फल्गुनी नक्षत्रे कटकं ताने वृश्चिकमा सिंहराशौ जातस्य नारायण शर्मणः प्रश्न इल्ल एवमेव पुनर्वसु नक्षत्रे मिथुनराशौ जाता இது பிடிச்சு இது வித்யா கம்சி அப்ப இது இருக்கு என்கிட்ட வந்திருக்கு நீங்க நான் பார்த்துக்கிறேன் அது படிச்சாச்சு விஜயத்தில் வந்துருக்கலாம் நீங்க மேல பண்ணிட்டே போ அது பாட்டு பண்ணிட்டு இருக்கேன் நீ பாட்டு மேல பண்ணிட்டு சர்வேஷாம் நிறைய இருக்கு पुनर्वसु नक्षत्रे मिथुनराशौ जातस्य कौण्डिन्य गोत्रस्य वेंकट शिवरामकृष्ण शास्त्री शर्मणः माधुल गोत्रस्य आश्लेषा नक्षत्रे कटकराशौ जातस्य रघुनाथ शर्मणः श्रीवत्स गोत्रस्य केशवरामचंद्र शर्मणः अनुराधा नक्षत्रे वृषभराशौ जातस्य रामचंद्र शर्मणः अश्विनी नक्षत्रे मेषराशौ जातायाः रंजनी नाम्न्याः मृगशिरो नक्षत्रे मिथुनराशौ जातायाः वैद्यनाथ शर्मणः मृगशिरो नक्षत्रे वृषभराशौ जातायाः साध्वी नाम्न्याः वृश्चिक नक्षत्रे तुला सुंदरेश विशाखा नक्षत्रे तुला राशौ जातस्य सुंदरेश शर्मणः संकृति गोत्रस्य उत्तर 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 उत्तरप्रोष्ठपदा नक्षत्रे मीनराशौ जातस्य रामचंद्र शर्मणः पूर्व फल्गुनी नक्षत्रे सिंहराशौ जातायाः षण्मुखप्रिया नाम्न्याः उत्तरट्टादि उत्तरप्रोष्ठपदा नक्षत्रे मीनराशौ जातायाः अर्णवकृष्ण नाम्नः सवर्णगोत्रस्य शतभरिणी नक्षत्रे कुंभराशौ जातस्य मयांक शर्मणः भारद्वाज गोत्रस्य मघा नक्षत्रे मृगराशौ जातस्य लक्ष्मीनरसिंह शर्मणः श्रीवत्स गोत्रस्य श्रीधर रेवती नक्षत्रे मीनराशौ जातस्य श्रीधर शर्मणः रोहिणी नक्षत्रे ऋषभराशौ जातस्य भारद्वाज गोत्रस्य तथा उत्तर फल्गुनी नक्षत्रे कन्या राशौ जातायाः जानकी नाम्न्याः पूर्व 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 पृष्ठपदा नक्षत्रे कुंभराशौ जातस्य रामसुंदर शर्मणः अपभरणे नक्षत्रे मेषराशौ जातायाः बृंदा नाम्न्याः पूर्व पृष्ठपदा नक्षत्रे मीनराशौ जातस्य नारायण शर्मणः मृगशिरो नक्षत्रे ऋषभराशौ जातायाः गायत्री नाम्न्याः अपभरणे नक्षत्रे मेषराशौ जातायाः पवित्रा नाम्न्याः मौद्गल्य गोत्रस्य गुणशेखर शर्मणः हस्तनक्षत्रे कन्या राशौ जातस्य मघा नक्षत्रे सिंहराशौ जातस्य माधवकर्णा नामधेयस्य अस्य यजमानस्य उत्तरं नक्षत्रे कन्या राशौ जातस्य शिवगोत्रस्य शबरीश्वरन् इति नामधेयस्य कपिगोत्रस्य पूर्वफल्गुनी नक्षत्रे पूर्वफल्गुनी नक्षत्रे चंद्रशेखर शर्मणः जानकीराम भारद्वाज गोत्रस्य अपभरण नक्षत्रे मेषराशौ जातस्य जानकीराम शर्मणः लोहित गोत्रस्य जयराम शर्मणः शतभरण नक्षत्रे कुंभराशौ जातस्य जयराम शर्मणः मघा नक्षत्रे संकृति गोत्रस्य मघा नक्षत्रे सिंहराशौ जातस्य गुरुप्रसाद इत्यस्य चित्रा नक्षत्रे तुलाराशु जातायाः मालती नाम्न्याः गणेशशर्मणः च पूर्वाषाढा नक्षत्रे संकृतिगोत्रस्य रामकृष्णशर्मणः भारद्वाजगोत्रस्य हस्तनक्षत्रे कन्याराशु जातस्य राधाकृष्णशर्मणः कौशिकगोत्रस्य ज्येष्ठा नक्षत्रे वृश्चिकराशौ जातस्य बालसुब्रह्मण्यशर्मणः कौशिकगोत्रे हस्तनक्षत्रो कन्याराशौ जातायाः अभिनया नाम्न्याः कौशिकगोत्रस्य श्रवणनक्षत्रे मकरराशौ जातस्य सतीशशर्मणः शतभिषनक्षत्रे कुम्भराशौ जातस्य गिरीशशर्मणः अपभरणी नक्षत्रे हरितगोत्रस्य अपभरणी नक्षत्रे मेषराशौ जातायाः शुभश्रीनाम्न्याः आर्द्र नक्षत्रे मिथुनराशौ जातस्य कौण्डिन्यगोत्रायाः सौभाग्यानाम्न्याः अश्वती नक्षत्रे हरितगोत्रस्य जातस्य बालसुब्रह्मण्यशर्मणः उत्तरट्टादि उत्तरपृष्ठपदा नक्षत्रे मीनराशौ जातस्य रामसुब्रह्मण्यशर्मणः वादूलगोत्रस्य पूर्वाषाढा नक्षत्रे धनुराशौ जातस्य भारद्वाजगोत्रायाः पार्वती नाम्न्याः स्वाति नक्षत्रे भारद्वाजगोत्रे तुलाराशौ जातस्य राजगोपालशर्मणः काश्यप गोत्रस्य आश्लेषा नक्षत्रे कटकराशौ जातस्य रामकृष्णशर्मणः शतभिष नक्षत्रे त्रिपुरसुन्दरी श्रीवत्सगोत्रस्य नाम्न्याः परिचय चेर्कनवे आश्लेषा नक्षत्रे श्रीवत्सगोत्रस्य कटकराशौ जातायाः मुरलीधरशर्मणः श्रीवत्सगोत्रस्य रोहिणी नक्षत्रे शुभराशौ जातायाः जातस्य मुरलीधरशर्मणः ज्येष्ठा नक्षत्रे वृश्चिकराशौ जातस्य भारद्वाजगोत्रस्य पद्मा नामधेयस्य मृगशिरो नक्षत्रे आत्रेय गोत्रस्य शर्मणः कृत्तिका नक्षत्रे मेषराशौ जातायाः अनुराधास्य यशजाजी शर्मणः आर्द्रा नक्षत्रे मिथुनराशौ जातस्य शालङ्कायन गोत्रस्य मिथुन श्रीकान्त विश्वनाथ शर्मणः पूर्वाषाढा नक्षत्रे गर्ग नक्षत्रे गर्ग गोत्रे पूर्वाषाढा नक्षत्रे धनुराशौ जातस्य विश्वनाथ शर्मणः नैध्रुव काश्यप गोत्रस्य उत्तरट्टादि उत्तरपृष्ठपदा नक्षत्रे मीनराशौ जातस्य वेङ्कटराम शर्मणः नैध्रुव काश्यप गोत्रस्य कृत्तिका नक्षत्रे जातस्य सुब्रह्मण्य शर्मणः भारद्वाजगोत्रस्य कुम्भराशौ जातस्य पूलधर नाम्न्याः अपभरणी नक्षत्रे मेषराशौ जातस्य भारद्वाजगोत्रस्य गोपालशर्मणः स्वाति नक्षत्रे श्रीवत्सगोत्रस्य आश्लेषा नक्षत्रे मिथुन रोहिणी नक्षत्रे जातस्य गौतम रामशर्मणः मृगशिरो नक्षत्र गोत्रस्य मृगशिरो नक्षत्रे मिथुन राशौ जातस्य चंद्रमौळी शर्मणः पुनर्वसु नक्षत्रे जातस्य चंद्रमौळीश्वर शर्मणः अविट्टं श्रविष्ठा नक्षत्रे धनुराशौ जातस्य तारकायन गोत्रस्य मकरराशौ जातस्य श्रेष्ठ नामधेयस्य श्रीवत्सगोत्रे जातायाः रोहिणी नक्षत्रे ऋषभराशौ जातायाः जयन्ती नाम्न्याः कौण्डिन्यगोत्रस्य श्रवणनक्षत्रे जातस्य श्रीनिवासशर्मणः वादूलगोत्रे जातस्य मृगशिरो नक्षत्रे मेषराशौ जातस्य शिवसुब्रह्मण्यशर्मणः बालाम्बा नाम्न्यः शदय नक्षत्रे जातायाः बालाम्बा नाम्न्यः भारद्वाजगोत्रस्य अपभरण नक्षत्रे मेषराशौ जातस्य मोहनलता नाम्न्यः कौशिकगोत्रस्य पुनर्वसु नक्षत्रे मिथुनराशौ जातस्य वेङ्कटरामशर्मणः मघा नक्षत्रे सिंहराशौ जातायाः लक्ष्मी नाम्न्यः अनुराधा नक्षत्रे वृश्चिकराशौ जातायाः राजलक्ष्मी नाम्न्यः सुब्रह्मण्य कौशिक गोत्रस्य आद्रा नक्षत्रे मिथुनासु जातस्य सुब्रह्मण्य शर्मणः पुष्य नक्षत्रे कटकरासु जातायाः चलम्बा नाम्न्याः स्वाति नक्षत्रे मिथुनासु जातायाः शंकर नारायण नामधेयस्य पूर्व फल्गुनी नक्षत्रे मिथुनमा पूर्व फल्गुनी राशिये पोळ्ळल भुवनेश्वरी नाम्न्याः स्वाति नक्षत्रे कटकरासु जातायाः स्वागत रामनाथ शर्मणः रोहिणी नक्षत्रे रोहिणी जातस्य कृष्णशर्मणः मघा नक्षत्रे सीतालक्ष्मण नाम्न्यः चित्रा नक्षत्रे जातस्य आदित्य कृष्ण नामधेयस्य अपभरण नक्षत्रे मेषराशौ जातायाः अभिरामी कृष्णन् नामधेयस्य उन्नोडது ಒಂದು ನೀ படிக்கி நீயே படிச்சுக்கோ संकल्पितानां सर्वेषां भक्तपरायणानां धन्वन्तरिपरायणानां धन्वन्तरि प्रसादेन शरीरे वर्तमानवर्तिष्यमान सकलरोगनिवृत्तिद्वारा क्षिप्रारोग्यसिद्ध्यर्थं गृहे वर्तमान समस्त पीडापरिहारद्वारा क्षिप्रारोग्यसिद्ध्यर्थं समस्त अभीष्टसिद्ध्यर्थं धन्वन्तरि प्रसादसिद्ध्यर्थं धन्वन्तरि जयन्ती पुण्यकाले धन्वन्तरि पूजां होम पुरस्सरं यथाशक्ति ध्यानावाहनादि षोडशोपचारैः अद्य करिष्ये अपवुपस्पृश्य யாராவது விட்டு போயிருந்து சங்கல்பத்துக்கு இது பண்ணி ரிஜிஸ்டர் பண்ணி விட்டு போயிருந்தீங்கன்னா சொல்லுங்க, சேர்த்துக்கலாம். வைஜு வந்து படிச்சாச்சு வந்த வெளியில வந்திருக்காளா? சிவன் வாயில் உங்களுக்கு படிச்சாச்சு. முதல்ல சங்கல்பத்துக்காகவே வெளியிலேருந்து வந்திருக்கிறவாள்லாம் ஒத்தொத்தரா இங்க மேடையில வந்து இதுல இருக்கிறத இங்க அப்படியே பிரதட்சணமா வந்து அவர்கிட்ட கொடுத்துட்டு நீங்க போய் உங்க இடத்துல உட்காந்துக்கணும்னு பிரார்த்திச்சுக்கிறோம். கொடுப்பா இறங்கிடுங்க. நீங்க எல்லா பெரியவாளும் வாங்கோ, நேரம் அப்படியே வாங்கோ, பிரதட்சணமா மேல போயிட்டு धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय स्वाहा देवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय महाविष्णवे स्वाहा ओम भगवते धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णु स्वाहा. Yes, आयुर्वेद कॉलेज टीचर्स வாங்கோ, சாமிநாதன் வாங்க. ஸ்ரீ மகாவே ஓம் நமோ பகவதே தன்வந்தரி சர்வாமி விநாசனாய ஸ்ரீ மகாவிஷ்ணவே ஸ்வா. அது முடிச்சுட்டு இடம் இருந்தா குழந்தை வரணும். குழந்தை பர்சல் विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे ओम नमो भगवते धन्वन्तरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा. ओम नमो भगवते धन्वन्तरये महाविष्णवे स्वाहा. ओम धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा. ओम धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथ नमो भगवते धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्य नवे स्वाहा. अमृतकलश நீ வாங்கிட்டு வா. महाविष्णवे स्वाहा. புதுசா வந்து ஜெய். पुत्रस्य उत्तराषाढा नक्षत्रे मीनः जातायाः जातान्यः शिवगोत्रे मिथुनासु जात रोजामाला नामधेयस्य क्षेमस्थम् இதுல எழுதிட்டேன் ரோஜாமாலை வந்து சரி அமிச்ச பரவாயில்ல. त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा विजय निपुमा ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंत सर्वामि विनाशनाय त्रैलोक्य महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये सर्वामि त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय स्वाहा ओम नमो भगवते धन्वंतरये त्रैलोक्यनाथ धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये वासुदेवाय अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम धन्वंतरये विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा धन्वंतरये अमृतकलशहस्ताय ओम नमो भगवते वासुदेवाय अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते देवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्य श्री महाविष्णवे वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय श्री महाविष्णवे भगवते वासुदेवाय धन्वंतरये देवाय धन्वंतरये अमृतकलशहस्ताय त्रैलोक्य श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरये वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये हस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय स्वाहा ओम नमो भगवते वासुदेवाय अमृत विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये विष्णवे ओम धन्वंतरये अमृतकलशहस्ताय विनाशनाय त्रैलोक्यनाथाय श्री नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरये समृतहस्ताय सर्वाभिविनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतहस्ताय सर्वाभिविनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतहस्ताय सर्वाभिविनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतहस्ताय सर्वाभिविनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे भगवते वासुदेवाय धन्वंतरये अमृतहस्ताय सर्वाभिविनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतहस्ताय सर्वाभिविनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। नमो भगवते धन्वंतरये ओम नमो भगवते अमृतकलशहस्ताय अमृतकलशहस्ताय सर्वामि त्रैलोक्य नमो भगवते वासुदेवाय अमृतकलशहस्ताय सर्वामि श्री महाविष्णु धन्वंतरी नाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय स्वाहा। ओम नमो भगवते अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथ भगवते वासुदेवाय विनाशनाय त्रैलोक्यनाथाय विष्णवे स्वाहा। ओम देवाय त्रैलोक ओम नमो धन्वंतरी वासुदेवाय अमृतहस्ताय सर्वामि विनाशनाय महाविष्णवे स्वाहा। ओम नमो भगवते त्रैलोक्यनाथाय स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरी अमृतकलशनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय अमृत ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे त्रैलोक्यनाथाय श्री भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वा त्रैलोक्यनाथ नमो भगवते वासुदेवाय धन्वंतरये विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो वासुदेवाय धन्वंतरये विष्णवे स्वाहा। वासुदेव धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय स्वाहा। ओम नमो भगवते धन्वंतरये त्रैलोक्यनाथ सर्वामि विनाशनाय त्रैलोक्यनाथाय स्वाहा। नमो भगवते वाय धन्वंतरये विनाशनाय त्रैलोक्यनाथाय स्वाहा। ओम नमो भगवते अमृतकलशहस्ताय स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामि विनाशनाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये सर्वामि विनाशनाय महाविष्णवे स्वाहा। ஸ்டூடண்ட்ஸ் வரட்டும், குழந்தைகளா வாங்க கூட செல்லும். யார் ஏற்கனவே இல்லை, ரெண்டு பேரை மூணு பேர் கொடுக்கும், 6 வரைக்கும் வாங்க. எல்லா குழந்தைகளும் வா. ओम नमो भगवते वासुदेवाय धन्वंतरी श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरी अमृतकलशहस्ताय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते धन्वंतरी सर्वाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरी अमृतकलशहस्ताय सर्वामि त्रैलोक्यनाथाय श्री महाविष्णु। ओम नमो भगवते वासुदेवाय धन्वंतरी अमृतकलशहस्ताय सर्वामि विनाशनाय त्रैलोक्यनाथाय विष्णवे स्वाहा। ओम नमो महाविष्णवे स्वाहा ओम नमो वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा ओम भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरिये नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्य श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय त्रैलोक्यनाथाय महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा ओम नमो भगवते धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा போன வருஷம் சேர்ந்த ஃபர்ஸ்ட் இயர் குழந்தைகள் யாராவது வந்திருக்காங்களா? போன வருஷம் சேர்ந்த ஃபர்ஸ்ட் இயர் குழந்தைகள் டே ஸ்காலர்ஸ் ஹாஸ்டலர்ஸ் வந்திருந்தா வாங்க. ஓம் நமோ பகவதே வாசுதேவாய தன்வந்தரியே திரைலோக்கினா சொல்லுங்க. ओम नमो भगवते धन्वंतराय मृतकलशास्त्राय त्रैलोक्यनाथाय श्री महाविष्णवे. ओम नमो भगवते वासुदेवाय धन्वंतरि मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा. ओम नमो भगवते वासुदेवाय धन्वंतरि मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा. ओम नमो भगवते वासुदेवाय धन्वंतरि मृतकलशास्त्राय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा. ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय श्री महाविष्णवे स्वाहा. ओम नमो भगवते वासुदेवाय धन्वंतरिये विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे. ओम नमो भगवते वासुदेवाय धन्वंतरिये मृतकलशास्त्राय सर्वामय विनाश. எது படிக்க சொல்லுங்க, நான் படிக்கிறேன். ரைட் ரைட். ओम नमो भगवते वासुदेवाय இதுல இருந்து நான் எது ஆரம்பி அது வந்து தொடு எனக்கு அதுக்கு அப்புறம் பார்த்துக்கலாம். அவ்வளவுதான். ओम भारद्वाज गोत्रस्य पूर्वाषाढ़ नक्षत्रे वेंकटेश शर्मणः हरदगोत्रस्य स्वाति नक्षत्रे तुला सुजातस्य श्रीधर शर्मणः हरदगोत्रस्य सदशतम नक्षत्रे जातस्य शंकरराम शर्मणः श्रविष्ठा नक्षत्रे मकर राशौ जातायाः विजयलक्ष्मी शंकरनाम्न्याः श्रवण नक्षत्रे मकर राशौ जातस्य विशाल शंकर படிச்சாச்சுமா. ஆமாமா. भारद्वाज गोत्रस्य उत्तर प्रोष्ठपदा नक्षत्रे जाते कृष्णमूर्ति शर्मणः मघा नक्षत्रे भागीरथी नाम्न्याः रामसुब्रह्मण्य शर्मणः पूर्व प्रोष्ठपदा नक्षत्रे कुंभराशौ जातस्य सुब्रह्मण्य शर्मणः असूल गोत्रस्य सुब्रह्मण्य पूर्वाणं पूर्वाषाढ नक्षत्रे राशि पूर्वाणक्षत्रस्य जातस्य नाम्न्यः मकर राशौ उत्तराषाढ नक्षत्र जातस्य शिवसुब्रह्मण्य शर्मणः पूर्वनक्षत्रे पूर्वनक्षत्रे सिंहराशौ जातस्य वादोलगोत्रस्य मूला नक्षत्रे ललिता नाम्न्यः आश्लेष नक्षत्रे मुसरासु जाता यः नैवेद्यमा நான் சொல்லும்போது அவன்கிட்ட கேட்டுக்கோ ஆதித்யன்ட்ட கேட்டுக்கோ तद्राशौ जातस्य समस्तस्यापि जगतः क्षेमस्थैर्य धीर्य बीज आयुरारोग्य अभिवृद्धि ऐश्वर्याभिवृद्ध्यर्थम आरोग्य दृगात्रता सिद्ध्यर्थम ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये வரலாம் எப்ப டேட்டா போட படிங்க மூடி வச்சுட்டோன்னா இலையெல்லாம் இருக்கு எப்ப பண்ணுவோம்। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय भगवते सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय स्वाहा। ओम नमो भगवते सर्वामय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम वासुदेवाय धन्वन्तरये विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते त्रैलोक्यनाथाय भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे भगवते वासुदेवाय मृतकलशहस्ताय महाविष्णवे स्वाहा। भगवते मृतकलशहस्ताय देवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय ओम नमो भगवते धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय मृतकलशहस्ताय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वा वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। गायु गायत्री वांगे। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। गायत्री वंद्रिका। नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय स्वाहा। ओम मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। नमो भगवते वासुदेवाय मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। दिव्या चेची। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महा स्वाहा। ओम नमो भगवते त्रैलोक्यनाथाय श्री महाविष्णवे नमो वासुदेवाय धन्वन्तरिये नैवेद्य। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथ उर्वशी सुनंदा जल बनाए। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय तेरिச்சு விட்டுடு தெளிக்கணும் தெளிக்கணும் நைவேத்தியம் அங்கேருந்து பண்ண முடியும் இங்க கொண்டு வந்துரு இங்க வந்து இங்க தரம் தெரியும் ஜல புரோக்ஷணம் பண்ணணும் ஓம் நமோ பகவதே धन्वन्तरिये बाकी இருக்கா சொல்லு भारद्वाज गोत्रस्य रोहिणी नक्षत्रे ऋषभ राशि जातस्य नारायण शर्मणः उत्तराषाढ नक्षत्रे मीनराशौ वा मीनराशौ जातायाः श्रीविद्या नाम्न्याः अस्याः यजमान्याः क्षमस्तैर्य आयुरारोग्य ऐश्वर्याभिवृद्ध्यर्थं धन्वन्तरि होमं करिष्ये। ओम नमो भगवते धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। भगवते वासुदेवाय धन्वन्तरिये विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वन्तरिये मृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये सर्वामय विनाशनाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय ओम ओम वासुदेवाय उष्ण। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय विनाशनाय महाविष्णवे स्वाहा वौषट। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषट। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय स महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामृत विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। ओम नमो भगवते वासुदेवाय धन्वंतरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय महाविष्णवे स्वाहा वौषटे। विष्णु सहस्रनाम। ओम शुक्लांबरधरं विष्णुं शशिवर्णं चतुर्भुजं பிரசன்னவதனம் ஜாயே சர்வ விக்னோபஷ. விஷ்ணு சஹஸ்ரநாமம் சொல்ல போது மேகா அன்கோ எல்லாரும் வரணும். இங்க குழந்தை விஷ்ணு சஹஸ்ரநாமம் தெரிஞ்ச குழந்தைலாம் வந்து சொல்லணும். ஓம் சுக்லாம்பரதரம் விஷ்ணும் சசிவர்ணம் சதுர்புஜம் பிரசன்னவதனம் ஜாயே சர்வ விக்னோபசாந்தயே யஸ்யத்வரத வக்ராத்யா பாரிஷத்யா பரஷ்யதம் விக்னம் நிக்னந்த சததம் விஸ்வக்சேனம் தமாஸ்ரயே व्यासं वसिष्ठ नप्तारं शक्तेः पौत्रमकल्मषं पराशरात्मजं वन्दे सुखदातं तपोनिधिं व्यासाय विष्णुरूपाय व्यासरूपाय विष्णवे नमो वै ब्रह्मनिधये वासिष्ठाय नमो नमः कविकाराय शुद्धाय नित्याय परमात्मने सदैकरूपरूपाय विष्णवे सर्वजिष्णवे यस्य स्मरणमात्रेण जन्मसंसारबन्धनात् विमुच्यते नमस्तस्मै विष्णवे प्रभविष्णवे ओं नमो विष्णवे प्रभविष्णवे श्रीवैशम्पायन उवाच श्रुत्वा धर्मान् शेषेण पावनानि च सर्वशः युधिष्ठिरशान्तनवं पुनरेवाभ्यभाषत युधिष्ठिर उवाच किमेकं दैवतं लोके किं वाप्येकं परायणं स्तुवन्तः कं कमर्चन्तः प्राप्नुयोर्मानवाः शुभं को धर्मः सर्वधर्माणां भवतः परमो मतः किं जपन्मुच्यते जन्तर्जन्म संसारबन्धनात् भीष्म उवाच जगत्प्रभुं देवदेवमनन्तं पुरुषोत्तमं स्तुवन्नाम सहस्रेण पुरुषस्ततोत्थितः तमेव चार्चयन् नित्यं भक्त्या पुरुषमव्ययं ध्यायं स्तुवन्नमस्यंश्च यतमानस्तमेव च अनादिनिधनं विष्णुं सर्वलोकमहेश्वरं लोकाध्यक्षं स्तुवन्नित्यं सर्वदुःखादिको भवेत् ब्रह्मण्यं सर्वधर्मज्ञं लोकानां कीर्तिवर्धनं लोकनाथं महद्भूतं सर्वभूतभवोद्भवम् एष मे सर्वधर्माणां धर्मोऽधिगतमो मतः यद्भक्त्या पुण्डरीकाक्षं स्तवैरर्चेन्नरस्तदा परमञ्यो महत्तेजः परमञ्यो महत्तपः परमञ्यो महद्ब्रह्म परमञ्जः परायणं पवित्राणां पवित्रं यो मङ्गलानां च मङ्गलं दैवतं देवतानां च भूतानां यो व्ययः पिता यतः सर्वाणि भूतानि भवन्त्यादियुगागमे यस्मिंश्च प्रलयं यान्ति पुनरेव युगक्षये तस्य लोकप्रधानस्य जगन्नाथस्य भूपते विष्णोर्नाम सहस्रं मे शृणु पापभयापहं यानि नामानि गुणानि विख्यातानि महात्मनः ऋषिभिः परिगीतानि तानि वक्ष्यामि भूतये ऋषिर्नाम्नां सहस्रस्य वेदव्यासो महामुनिः छन्दोऽनुष्टुप् तथा देवो भगवान् देवकीसुतः अमृतांशोद्भवो बीजं शक्तिर्देवकीनन्दनः त्रिसामाहृतयं तस्य शान्त्यर्थे विनियुज्यते विष्णुं जिष्णुं महाविष्णुं प्रभविष्णुं महेश्वरम् अनेकरूपदैत्यान्तं नमामि पुरुषोत्तमम् अस्य श्रीविष्णोर्दिव्यसहस्रनाम स्तोत्र महामन्त्रस्य वेदव्यासो भगवान् ऋषिः अनुष्टुप् छन्दः अमृतांशोद्भव बीजं शक्तिर्देवकीनन्दनः देवकीनन्दन सृष्टेति शक्तिः उद्भवः क्षोभणो देवकीति परमो मन्त्रः शङ्खपुरनन्दकी चक्रीति जलं प्रोक्षिते काकधन्वागदाधरगित्यस्त्रं रथाङ्गपाणिरक्षोभ्यगिति नेत्रं त्रिसामासामकः सामेति कवचम् आनन्दं परब्रह्मेति योनिः सुदर्शनः कालगिति दिग्बन्धः विश्वरूपगिति ध्यानं महाविष्णुप्रीत्यर्थे सहस्रनामपारायणे विनियोगः ध्यानं क्षीरोदन्नत्प्रदेशे शुचिमुनिविरसत्सैकते मौक्तिकानां मालाकृत्तासनस्तस्फटिकमणिनिभैर्मुक्तिकैर्मण्डिताङ्गः शुभ्रैरभ्रैरदभ्रैरुपदवर्जितैर्मुक्तपीयूषवर्षैः आनन्दीनः पुनीयादलिर्निगदा शङ्खपाणिर्मुकुन्दः भूपादो यस्य नाभिर्विकेतुसुवर्णश्चन्द्रसूर्यौ जनेत्रे कर्णावासा शिरोद्युर्मुखविदग्नो यस्य वास्तेयमुक्तिः अन्तस्तं यस्य विश्वं सुरनरखग भो भोगि गन्धर्वदैत्यैः चित्रं रम्यतेदं त्रिभुवनवपुषं विष्णुमीशं नमामि ओं नमो भगवते वासुदेवाय शान्ताकारं भुजगशयनं पद्मनाभं सुरेशं विश्वाधारं गगनसदृशं मेघवर्णं शुभाङ्गं लक्ष्मीकान्तं कमलनयं योगी विद्यानगं वन्दे विष्णुं भवभयनं सर्वलोकनाथं मेघश्यामं पीतकोशे श्रीवत्सांगं कौस्तुभोद्भासितांगं पुण्योपेतुं पुण्डरीकायिताक्षं विष्णुं वन्दे सर्वलोकैकनाथं सशङ्खचक्रं सकरीटकुण्डलं सपीतवस्त्रं हारवक्षस्थलशोभिकौस्तुभं चतुर्भुजं छायायां पारिजातस्य हेमसिंहासनोपरि आसीनं अम्बुजश्यामम् आयताक्षमालङ्कृतं चन्द्राननं चतुर्बाहु श्रीवत्साङ्कितवक्षसं रुक्मिणी सत्यभामाभ्यां सहितं कृष्णमाश्रये ओं विश्वस्मै नमः विश्वं विष्णुर्विषट्कार भव्यभवत्प्रभुः भूतकृद्भूतभूतात्मा भूतभावनः परमात्मा च मुक्तानां परमागतिः अव्ययः पुरुषः साक्षी क्षेत्रज्ञोऽक्षर एव च योगो योगविदां नेता प्रधानपुरुषेश्वरः नारसिंहवपुः श्रीमान् केशवः पुरुषोत्तमः भूतादिर्निधिरव्ययः शम्भवो भावनो भर्ता प्रभव प्रभुरीश्वरः स्वयंभूः शम्भुरादित्य पुष्कराक्षो महास्तुनः अनादिनिधनो धाता विधाता धातुरुत्तमः अप्रमेयो ऋषिकेश पद्मनाभो परप्रभुः विश्वकर्मा मनुष्टविष्टस्थिरो ध्रुवः अग्राह्यशाश्वतकृष्णोत्पत्ताक्षप्रदर्शनः प्रभूतत्रिगुब्धाम पवित्रमङ्गलं परम् ईशानः प्राणद प्राणो ज्येष्ठ श्रेष्ठ प्रजापतिः हिरण्यगर्भो भूगर्भो माधवो मधुसूदनः ఈశ్వరో విక్రమే సన్వి మేధావి విక్రమ క్రమ అనుత్తమో దురాదర్శ కృతజ్ఞాత్మవాన్ அந்த படத்துக்கு நான் கிழசு நீ அந்த படத்துக்கு वसुर्वसुमनासत्य समात्मा संविदस्तमः अमोघ पुण्डरीकाक्षो वृषकर्मा वृषाकृतिः उग्रो बहुचिरावभ्रुर्विषयोनुश्रुतिश्रवाः अमृतशासनस्ताणुर्वरारोहो महातपाः सर्वगः सर्वविद्वानुर्विश्वक्सेनो जनार्दनः वेदो वेदविदव्यङ्गो वेदाङ्गो वेदवित्कविः लोकाध्यक्षस्तुराध्यक्षो धर्माध्यक्षः कृताकृतः चतुरात्मा चतुर्व्यूहः चतुर्दंष्ट्रः चतुर्भुजः भाविष्टभोजनं भोक्ता सहिष्णुर्जगदादिजः अनघोविजयो जेता विष्णुयो पुनर्वसो उपेन्द्रो वामन प्रांशुरमोघश्रुतिरूर्जितः अतीन्द्र संग्रह वेद्यो वैद्य सदा योगी वीरः माधवो मधुः अतीन्द्रियो महामायो महोत्साहो महाबलः महाबुद्धिर्महावीर्यो महाशक्तिर्महाद्युतिः अनिर्देश्य वपु श्रीमान् मे आत्मा महादृधृक् महेश्वासो महीभर्ता श्रीनिवासः सताङ्गतिः अनिरुद्धस्फुरानन्दो गोविन्दो गोविदाम्पतिः मरीचिर्दमनोहं सुपर्णोभजगोत्तमः हिरण्यनाभस्तुतपाः पद्मनाभ प्रजापतिः अमृत्यु सर्वदृक्सिंह संधाता संधिमान स्थिरः अजो दुर्वर्षण शास्ता विशुद्धात्मा सुरारिः गुरुर्गुरुतमोधाम सत्य सत्य पराक्रमः मुषोरमुषस्रग्वी वातुतिरुदारधीः अग्रणीर्ब्राह्मणे श्रीमान् न्यायो नेता समीरणः सहस्रमूर्धा विश्वात्मा सहस्राक्ष सहस्रपात् आवर्तनो निवृत्तात्मा संवृत संप्रमर्दनः अह संवर्तको वह्निरनिरोधरणीधरः सुप्रसाद प्रसन्नात्मा विश्वधृक् विश्वभुक् विभुः सत्कर्ता सत्कृत साधुर्जन्धुर्नारायणो नरः असंख्येयो प्रमेयात्मा विशिष्ट शिष्टकृच्छतिः सिद्धार्थ सिद्ध संकल्प सिद्धिद सिद्धिसाधनः वृषाही वृषभो विष्णुर्वृषपर्वा वृषोदरः वर्धनो वर्धमानश्च विविक्त श्रुतिसागरः सुभुजो दुर्धरो वाग्मी महेन्द्रो वसुदो वसुः नैकरूपो बृहद्रूपश्च विष्टः प्रकाशनः ओजस्तेजोद्युतिधरः प्रकाशात्मा प्रतापनः वृद्धस्पष्टाक्षरो मन्त्रश्चन्द्रांश भास्करद्युतिः अमृतांशोद्भवो भानुशशबिन्दुसुरेश्वरः औषधं जगदस्येतु सत्यधर्म पराक्रमः भूतभव्य भवन्नाथ पवनः पावनो नलः कामः कामकृत्कान्तः कामः कामप्रद प्रभुः युगादिकृत्युगावर्तो नैकमायो महाशनः अदृश्यो व्यक्तरूपश्च सहस्रजिदनन्दजित् इष्टो विशिष्टशिष्टेष्टशिखण्डी निहुषो वृषः विश्वबाहुर्महीधरः अच्युत प्रजित प्राणः प्राणदो वासवानुजः अपान्निधिर्धिष्ठारमप्रमत्तप्रतिष्ठितः स्कन्दस्कन्दधरोधर्यो वरदो वायुवाहनः वासुदेवो बृहद्भानुराजदेवः पुरन्दरः अशोकस्तारणस्तारः शूरः शौर्यजनेश्वरः अनुकूलशतावर्त पद्मी पद्मनिभेक्षणः पद्मनाभोरविन्दाक्ष पद्मगर्भशरीरभृत् महर्धनिरुद्धो वृद्धात्मा महाक्षो गरुडध्वजः अतुलशरभो भीम समयज्ञो हविर्हरिः सर्वलक्षणलक्षण्यो लक्ष्मीवान् समितिञ्जयः दुष्टरोहितो मार्गो हेतुर्दामोदरस्वः महीधरो महाभागो वेगवानमिताशनः उद्भवः क्षोभणो देव श्रीगर्भ परमेश्वरः करणं कर्ता विकर्ता गहनो गुहः व्यवसायो व्यवस्थान संस्थान स्थानदो ध्रुवः परर्धि परपट्ट तुष्ट पुष्ट शुभेक्षणः रामो विराम नयो नयोर्यः वीरशक्तिमतां श्रेष्ठो धर्मो धर्मविदुत्तमः वैकुण्ठ पुरुष प्राण प्राणदः प्रथम पृथुः हिरण्यगर्भ शत्रुघ्नो व्याप्तो वायुरथोक्षितः ऋतु सुदर्शनः काल परमेष्ठी परिग्रहः उग्र संवत्सरो दक्षो विश्रामो विश्वदक्षिणः विस्तारस्तावरस्ताणुः प्रमाणं बीजमव्ययम् अर्थो नर्थो महाकोशो महाभोगो महाधनः अनुवृन्नस्तु विष्टो भूर्धर्मयूपो महामखः नक्षत्रनेवर नक्षत्री क्षमः क्षामः समेहनः यज्ञयुज्यो महेज्यश्च क्रतुस्तत्रं सदाङ्गतिः सर्वदर्शी विमुक्तात्मा सर्वज्ञो ज्ञानमुत्तमं सुबुधस्तुमुखस्तूक्ष्म सुघोषस्तु गतस्तु कृते मनोहरो जितक्रोधो वीरबाहुर्विदारणः स्वावनस्वशो व्यापी नैकात्मा नैककर्मकृते वत्सरो वत्सलो वत्सीरत्नगर्भोधनेश्वरः धर्मगुद्धर्मगुर्धर्मी सत्कर्मक्षरम् अविज्ञाता सहस्रांशर्विधाता कृतलक्षणः नभस्तिनेमि सत्त्वस्य सिंहो भूतमहेश्वरः आदिदेवो महादेवो देवेशो देवभृद्गुरुः उत्तरो गोपतिर्गोप्ता ज्ञानगम्यः पुरातनः शरीरभूतवृद्धोक्ता कपीन्द्रो भूरिदक्षिणः सोमपोमृतपस्सोम पुरुषित्पुरुषोत्तमः विनयो जगत्सत्यसन्धो दाशार्हः साद्वताम्पतिः मुकुन्दो मुतविक्रमः अम्भोनिधिरनन्तात्मा महोदिधिशयोऽन्तकः अजो महार्हः स्वाभाव्योजिता मित्रप्रमोदनः आनन्दोनन्दनोनन्द सत्यधर्मा त्रिविक्रमः महर्षि कपिलाचार्य कृतज्ञोमेदिनीपतिः त्रिपदतीर्थशाध्यक्षो महासंघः कृतान्तकृते महावराहो गोविन्द सुषेणः कनकाङ्गदी गुह्यो गभीरो गहनो गुप्तश्चक्रगदाधरः वेधास्वाङ्गोचित कृष्णो दृढः सङ्कर्षणोच्युतः वरुणो वारुणो वृक्ष पुष्कराक्षो महामनाः भगवान् भगः नन्दीवनमालीहलायुधः ज्योतिरादित्य सहिष्णुगतिसत्तमः सुसन्वाखण्ड परशुर्धारणो द्रविणप्रदः द्विस्पृक्सर्वदृग्व्यासो वाचस्पदर्यो निजः तसामासामगस्सामनिर्वाणं भेडिदं भिषके सन्न्यासकृच्छमशान्तो निष्ठा शान्तिः परायणं शुभाङ्गशान्तिदसृष्टा कुमुदः कुवलेशयः गोहितो गोपतिर्गोप्ता वृषभाक्षो वृषप्रियः अनुवर्ती निवृत्तात्मा संक्षेप्ता क्षेमकृच्छिवः श्रीवत्सवक्षा श्रीवास श्रीपति श्रीमतांबरः श्रीध श्रीश श्रीनिवास श्रीनिधि श्रीविभावनः श्रीधर श्रीकर श्रेय श्रीमान् लोकत्रयाश्रयः सत्कीर्तिश्चन्न संजयः उदीर्न सर्वदचक्षुरणीश शाश्वतस्थिरः भूषयो भूषणो भूतर्विशोकशोकनाशनः अर्चिष्मादच्युतः कुम्भो विशुद्धात्मा विशोधनः अनिरुद्धो प्रदर्थ प्रद्युम्नो मदविक्रमः कालनेमिनिः वीरः शूरः शौर्यजनेश्वरः त्रिलोकात्मा त्रिलोकेश केशवः केशिहा हरिः कामदेवः कामपालः कामीकान्तः कृतागमः अनिर्देश्यव परविष्णुर्वीरोऽनन्तो धनञ्जयः ब्रह्मण्यो ब्रह्मकृद्ब्रह्मा ब्रह्म ब्रह्म विवर्धनः ब्राह्मण प्रिय महाक्रमो महाकर्मा महातेजा महोरगः महाकृतुर्महायज्ञो महायज्ञो महाहविः स्तव्यस्तव प्रिय स्तोत्रं स्तुतिस्तोतारण प्रिय पूर्ण पूरयिदापुण्य पुण्यकीर्तिर्नामयः मनोजवस्तीर्थकरो वसुरेता वसुप्रदः वसुप्रदो वासुदेवो वसुर्वसुमना हविः सद्गति सत्कृति सत्ता सद्भूति सत्परायणः शूरसेनो विदुश्रेष्ठ सन्निवास सुयामुनः भूता वासो वासुदेव सर्वासु नलयोरलः दर्पः दर्पदो दृप्तो दुर्धरोथा पराजितः विश्वमूर्तिर्महामूर्तिर्दीप्तमूर्तिरमूर्तिमान् अनेकमूर्तिरव्यक्तशतमूर्तिशताननः एकोनैकस्सवः किं यत्तत्पदमनुत्तमं लोकबन्धुर्लोकनाथो माधवो भक्तवत्सलः सुवर्णवर्णो हेमाङ्गो वराङ्गश्चन्दनाङ्गदी वीरः विषमशून्यो पिताशीरजलश्चलः अमानीमानदो मान्यो सुमेधामेत जोधन्य सत्यमेधाधराधरः तेजो वृषोद्युतिधर सर्वशस्त्रभृताम्बरः प्रग्रहो निग्रहो व्यग्रो निगशृङ्गो गदाग्रजः चतुर्मूर्तिः चतुर्बाहुः चतुर्व्यूहः चतुर्गतिः चतुरात्मा चतुर्भावः चतुर्वेदविदेकपात् समावर्तो निवृत्तात्मा दुर्जयो दुरुतिक्रमः दुर्लभो दुर्गमो दुर्गो दुरावासो दुरारिः शुभाङ्गो लोकसारङ्ग सुतन्तुवर्धनः इन्द्रकर्मा महाकर्मा कृतकर्मा कृतागमः उद्भवः सुन्दर सुन्दो रत्ननाभः सुलोचनः अर्को वाचित निःशृङ्गी जयन्त सर्वविद्ययी सुवर्णबिन्दलक्षोभ्यः सर्वभागीश्वरेश्वरः महाकृतो महागर्तो महाभूतो महानिधिः कुमुदः कुन्दरः कुन्दः पर्जन्यः पावनो नलः अमृताशोऽमृतवपुः सर्वज्ञः सर्वतोमुखः सुलभः सुवृतः सिद्धः शत्रुर्यच्छत्रुतापनः नग्रोधो दुम्बरोऽश्वत्थश्चाणूरान्ध्रनिषूदनः सहस्रार्चितजिह्वः सप्तैधा सप्तवाहनः अमूर्तिरनघोचिन्त्यो भजगर्भयनाशनः अणुर्बृहत्कृशस्तूलो गुणभर्निर्गुणो महान् अधृतस्तुधृतस्वास्य प्राग्वं शोभंशवर्धनः भारभर्त्यतिदो योगी योगीश सर्वकामदः आश्रमश्रमणः क्षाम सुपर्णो वायुवाहनः धनुर्धरो धनुर्वेदो दण्डो दमगितातमः अपराजितः सर्वतो नियन्ता नियमो यमः सत्त्वमान्तात्विक सत्य सत्यधर्मपरायणः अभिप्राय प्रियार्होर्ह प्रियगत्प्रीतिवर्धनः विहाय जगदर्ज्योतिषुर्जगृतभुक्बुभुः रविर्विलोचनः सूर्यस्य विदारविलोचनः अनन्तोहुतभुक्भोक्ता सकदोनेकजोग्रजः अनिर्विण्णसदामऋषि लोकाधिष्ठानमद्भुतः सनातनः कपिलः कपिलप्रियः स्वस्ति 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 स्वस्तिभुक् स्वस्ति दक्षिणः आरौद्रकुण्डलीचक्री विक्रम योजितशासनः शब्दाधिगशब्ददः सिचर सर्वदीकरः अक्रूरप्यशरोदक्षो दक्षिणः क्षमणाम्बरः विद्वत्तमो वीतभय पुण्यश्रवणकीर्तनः उत्तारणो दुष्कृतिः पुण्यो दुःस्वप्ननाशनः वीरारक्षणसन्तो जीवनपर्यवस्थितः अनन्तरूपो अनन्तश्रीदितमन्युर्भयापः चतुरश्लोकभीरात्मा विदिशो व्यादिशोदिचः अनादिर्भूर्भुवो लक्ष्मी सुवीरोर्चिराङ्गदः जननो जनजन्मादिर्भीमो भीमपराक्रमः आधारनलयोधाता पुष्पः प्रजागरः ऊर्ध्वगस्तत्पथाचारः प्राणदः प्रणवः प्रणः प्रमाणं प्राणनलयः प्राणभृत् प्राणजीवनः तत्त्वं तत्त्वविदेकात्मा जन्ममृत्युजरादिगः भूर्भवत्सुत्तरुस्तारस्तपिता प्रपितामहः यज्ञो यज्ञपतिर्यज्वा यज्ञाङ्गो यज्ञवाहनः यज्ञभृत्यज्ञकृत्यज्ञ यज्ञभुग्यज्ञसाधनः यज्ञान्तकृत्यज्ञयुह्यमन्नमन्नादयेव च आत्मयोनिस्वयञ्जातो वैकानः सामगायिनः देवकीनन्दनसृष्टाक्षतीशः पापनाशनः शङ्खपुर्नन्दिकीचक्रीशार्गधन्वागदाधरः रथाङ्गपाणरक्षोभ्यः सर्वप्रहरणायुधः सर्वप्रहरणायुध वो नमः इति वनमालिकदीशाङ्गी शङ्की चक्री जनंतकी श्रीमान नारायणो विष्णुर्वासुदेवोभिरक्षतु वनमालिकदीशार्गी शंकी चक्री जनंतकी श्रीमान नारायणो विष्णुर्वासुदेवोभिरक्षतु वनमाली तीशार्गी शंकी चक्री जनंदकी श्रीमान नारायणो विष्णुर्वासुदेवोभिरक्षतु वासुदेवोभिरक्षत्वोन्नमयति इति संकीर्तिनैकस्य केशवस्य महात्मनः नाम्नां सहस्रं दिव्यानाम् अशेषेण प्रकीर्तितं यैदं शृणुयात् नित्यं यश्चाप्यपरिकीर्तियेति नाशमं प्राप्नुयात् किञ्चित् सोमुत्रेह च मानवः वेदान्तको ब्राह्मणस्यात् क्षत्रियो विदिकी भवेत् वैश्योधनसमृद्धस्यात् शूद्रसुखमवाप्नुयात् धर्मार्थी प्राप्नुयात् धर्ममर्थार्थी चार्थमप्नुयात् कामानवाप्नुयात् कामी प्रजार्थी चाप्नुयात् प्रजाः भक्तिमान् यस्तोत्थाय शुचिस्तत्कृतमानसः सहस्रं वासुदेवस्य नाम्नामेतत् प्रकीर्तियेत् यशः प्राप्नोति विपुलं याति प्राधान्यमेव च अचलां श्रियमाप्नोति श्रेयः प्राप्नोत्यनुत्तमं न भयं क्वचिदाप्नोति वीर्यं तेजस्वी विन्दति भवत्यरोगो द्युतिमान् बलरूपगुणान्वितः रोगार्तो मुच्यते रोगात् बन्धो मुच्येत बन्धनात् भयान् मुच्येत भीतस्तु मुच्येतापन्न आपदः दुर्गान्नितितरत्यास पुरुषः पुरुषोत्तमं स्तुवन्नाम सहस्रेण नित्यं भक्तिसमन्वितः वासुदेवाश्रियोमर्त्यो वासुदेवपरायणः सर्वपापविशुद्धात्मा याति ब्रह्म सनातनं न वासुदेव भक्तानां शुभं विद्यते क्वचित् जन्म मृत्युजराव्याधि भयन्नैवोपजायते इमं स्तवमधीयान श्रद्धा भक्ति समन्वितः युज्येतात्मसु भक्षान्ति स्त्रीस्मृतिकीर्तिभिः न क्रोधो न च मात्सर्यं न लोभो न शुभामतिः भवन्ति कृतपुण्यानां भक्तानां पुरुषोत्तमे द्यौसचन्द्रार्क नक्षत्राखन्ति शोभूर्महोदधिः वासुदेवस्य वीर्येण विधृतानि महात्मनः ससुरासुरगन्धर्वं सयक्षोरगराक्षसं जगद्वशे वर्ततेदं कृष्णस्य सचराचरम् इन्द्रियाणि मनोबुद्धि सत्त्वं तेजोबलं धृतिः वासुदेवात्मकान्याहुः क्षेत्र गमानामाचार प्रथमं परिकल्पते आचार प्रभवो धर्मो धर्मस्य प्रभुरच्युतः ऋषयपितरो देवा महाभूतानि धातवः जङ्गमाजङ्गमञ्चेदं जगन्नारायणोद्भवं योगो ज्ञानं तथा साङ्ख्यं विद्या शिल्पादिकर्म च वेदाशास्त्राणि विज्ञानमेतत् सर्वं जनार्दनात् एको विष्णुर्महद्भूतं पृथक् भूतान्यनेकशः त्रीन् लोकान् व्याप्य भूतात्मा भुङ्क्ते विश्वभोगव्ययः इमं स्तवं भगवतो विष्णोर्व्यासेन कीर्तितम् पठे दिगिच्छेत् पुरुषश्रेयः प्राप्तुं सुखानि च विश्वेश्वरमजं देवं जगतः प्रभमव्ययम् भजन्ति ये पुष्कराक्षं न ते यान्ति पराभवं न ते यान्ति पराभवोन्नमयति अर्जुनमुवाच पद्मपत्रविशालाक्ष पद्मनाभसुरोत्तम भक्तानामनुरक्तानां त्राता भवजनार्दन श्रीभगवानुवाच यो मां नाम सहस्रेण स्तोतु विच्छितपाण्डवः सोऽहमेकेन श्लोकेन स्तुतयेन संशयोन्नमयति व्यासमुवाच वासनाद्वासुदेवस्य वासितुं भुवनत्रयम् सर्वभूतनिवासोऽसि वासुदेवनमोऽस्ते वासुदेवनमोऽस्तो नमयति पार्वत्युवाच केनोपायेन रघुना विष्णोर्नाम सहस्रकम् पठ्यते पण्डितैर्नित्यं श्रोतुमिच्छाम्यहं प्रभो ईश्वर उवाच श्रीराम राम रामेति रमे रामे मनोरमे सहस्रनाम तत्तुल्यं राम नाम वरानने श्रीराम राम रामेति रमे रामे मनोरमे सहस्रनाम तत्तुल्यं राम नाम वरानने श्रीराम राम रामेति रमे रामे मनोरमे सहस्रनाम तत्तुल्यं राम नाम वरानने श्रीराम नाम वरान्नवो नमयति ब्रह्मोवाच नमोऽस्त्वनन्ताय सहस्रमूर्तये सहस्रपादाक्षि शिरोर्बाहवे सहस्रनाम्ने पुरुषाय शाश्वते सहस्रकोटिजुगधारणे नमः सहस्रकोटिजुगधारण वो नमयति सञ्जय उवाच यत्र योगेश्वर कृष्णो यत्र पार्थो धनुर्धरः तत्र श्रीविजयोभूतिर्ध्रुवा नीतिर्मतिर्मम श्रीभगवानुवाच अनन्याश्चिन्तयन्तो मां ये जनाः पर्युपासते तेषां नित्याभियुक्तानां योगक्षेमं वहाम्यहं परित्राणाय साधूनां विनाशाय चतुष्टां धर्मसंस्थापनार्थाय सम्भवामि युगे युगे आत्माभिन्नाशजलाच्चभीताः घोरेषु व्याधिषु वर्तमानाः सङ्कीर्त्यनारायण शब्दमात्रं मुक्तिदुःखास्तिनो भवन्ति आर्तावशिन्नाशिथिलाच्चभीताः घोरेषु व्याधिषु वर्तमानाः संगीत नारायण शब्द मात्र मुक्त दुःखासिनो भवन्ति आर्तावशन्नाशितलाच्चभीताः घोरेषु व्याधिषु वर्तमानाः संगीत नारायण शब्द मात्र मुक्त दुःखासिनो भवन्ति आपदामुपहर्तारं दातारं सर्वसम्पदां लोकाभिरामं श्रीरामं भूयो भूयो नमाम्यहम् आर्तानाम् आर्तिहन्तारं भीतानां भीतिनाशनं दुरितां कालदण्डन्तं रामचन्द्रं नमाम्यहम् आपदामुपहर्तारं दातारं सर्वसम्पदां लोकाभिरामं श्रीरामं भूयो भूयो नमाम्यहम् आर्तानाम् आर्तिहन्तारं भीतानां भीतिनाशनं दुषतां कालदण्डन्तं रामचन्द्रं नमाम्यहम् आपदामुपहर्तारं दातारं सर्वसम्पदां लोकाभिरामं श्रीरामं आर्तानामार्तिहन्तारं भीतानां भीतिनाशनं दुषतां कालदण्डन्तं रामचन्द्रं नमाम्यहम् नमः कोदण्डहस्ताय सन्देहिकृतचलाय च खण्डिताखिल दैत्याय रामायापनिवारणे रामाय रामभद्राय रामचन्द्राय वेधसे रघुनाथाय नाथाय सीताय पदये नमः कृतप्रकृतश्चैव पार्षदश्च महाबलौ आकर्णपूर्ण धन्वानौ रक्षेतां रामलक्ष्मणौ सन्नद्धकवची खड्गी चापबाणधरो युव गच्छन् ममाकृतो नित्यं राम पातु च लक्ष्मणः अच्युतानन्द गोविन्द नामोच्चारण भेषजात् नश्यन्ति सकला रोगाः सत्यं सत्यं वदाम्यहम् अच्युतानन्द गोविन्द नामोच्चारण भेषजात् नश्यन्ति सकला रोगाः सत्यं सत्यं वदाम्यहम् अच्युतानन्द गोविन्द नामोच्चारण भेषजात् नश्यन्ति सकला रोगाः सत्यं सत्यं वदाम्यहम् सत्यं सत्यं पुनः उद्धृत्य भुजमुच्यते वेदाच्छास्त्रं परं नास्तिदेवं केशवात् परं शरीरे जर्जरे भूते व्याधिग्रस्ते कलेवरे औषधं जाह्नवीतोऽयं वैद्यो नारायणो हरिः आलोड्य सर्वशास्त्राणि विचारित पुनः इदमेकं तु निष्पन्नं ध्येयो नारायणस्तदा कायेन वाचा मनसेन्द्रियैर्वा बुद्ध्यात्मना वा प्रकृते स्वभावात् करोमि यद्यत् सकलं परस्मै नारायणायेति समर्पयामि. अधुना धन्वंतरी अष्टोत्तरम காது கொடுத்து கேளுங்க, எல்லாரும் திருப்பி சொல்லுங்க, உட்கார்ந்த இடத்துல இருந்து திருப்பி சொல்லலாம். அச்ச தன்வந்திரி அஷ்டோத்திர நாமாவளி ஸ்தோத்திர பிராரம்ப. ஓம் அப்பா பூணு படுங்கோ, அந்த ஹோமம் சாப்பிடுறதா இருந்தாலும் பண்ணிக்கோ. ஓம் ஸ்ரீ தன்வந்தரயே நம. ஓம் ஆதிதேவாய நம. ஓம் சுராசுரவந்திதாய நம. ஓம் வயஸ்தாபகாய நம. ஓம் சர்வாமயத்வம்சகாய நம. ஓம் பயாபகாய நம. ஓம் மிருத்யுஞ்சயாய நம. ஓம் விவிதௌஷதாத்ரே நம. ओम सर्वेश्वराय नमः. ओम शंखचक्राय नमः. ओम अमृतकलशहस्ताय नमः. ओम शल्यतंत्र विशारदाय नमः. ओम दिव्यौषधधराय नमः. ओम करुणामृतसागराय नमः. ओम सुखकराय नमः. ओम शस्त्रक्रिया कुशलाय नमः. ओम श्रीधराय नमः. ओम निरीहाय नमः. ओम शुभदाय नमः. ओम महादयाळवे नमः. ओम सांगासुत वेदवेद्याय नमः. ओम भिषक्तमाय नमः. ओम प्राणदाय नमः. ओम विद्वद्वराय नमः. ओम आर्तत्राणपरायणाय नमः. ओम आयुर्वेद प्रचारकाय नमः. ओम अष्टांग योग निपुणाय नमः. ओम जगदुद्धारकाय नमः. ओम अनुत्तमाय नमः. ओम सर्वज्ञाय नमः. ओम विष्णवे नमः. ओम समानाधिकवर्जिताय नमः. ओम सर्वप्राणी सुहृदे नमः. ओम सर्वमंगलकराय नमः. ओम सर्वार्थदात्रे नमः. ओम महामेधाविने नमः. ओम महामेधाविने नमः. ओम अमृतमयाय नमः. ओम सत्यसंधाय नमः. ओम आश्रितजवत्सलाय नमः. ओम अमृताशयाय नमः. ओम अमृतवपुषे नमः. ओम प्राणनिलयाय नमः. ओम पुंडरीकाक्षाय नमः. ओम प्राणजीवनाय नमः. ओम जन्ममृत्युजराजीताय नमः. ओम सद्गतिप्रदाय नमः. ओम महोत्साहाय नमः. ओम समस्तभक्तसुखदात्रे नमः. ओम सहिष्णवे नमः. ओम सिद्धाय नमः. ओम क्षमात्मने नमः. ओम वैद्यरत्नाय नमः. ओम अमृत्यवे नमः. ओम महागुरवे नमः. ओम अमृतांशोद्भवाय नमः. ओम क्षेमकृते नमः. ओम वंशवर्धनाय नमः. ओम वीतभयाय नमः. ओम प्राणप्रदे नमः. ओम क्षीराब्धितनयाय नमः. ओम चंद्रसहोदराय नमः. ओम सर्वलोकैकवन्दिताय नमः. ओम परब्रह्मणे नमः. ओम यज्ञभोक्त्रे नमः. ओम पुण्यश्लोकाय नमः. ओम पूज्यपादाय नमः. ओम सनातनतमाय नमः. ओम स्वस्तिदाय नमः. ओम दीर्घायुष्कारकाय नमः. ओम पुराण पुरुषोत्तमाय नमः. ओम अमर प्रभवे नमः. ओम अमृताय नमः. ओम नारायणाय नमः. ओम औषधाय नमः. ओम सर्वानुकूलाय नमः. ओम शोकनाशनाय नमः. ओम लोकबंधवे नमः. ओम नानारोगार्तिभञ्जनाय नमः. ओम प्रजानां जीवहेतवे नमः. ओम प्रजारक्षणदीक्षिताय नमः. ओम शुक्लवाससे नमः. ओम पुरुषार्थप्रदाय नमः. ओम प्रशांतात्मने नमः. ओम भक्त सर्वार्थ साधकाय नमः. ओम भोग भोग्य प्रदात्रे नमः. ओम महेश्वर्यदायकाय नमः. ओम लोकशल्यहर्त्रे नमः. ओम चतुर्भुजाय नमः. ओम नवरत्न विभूषिताय नमः. ओम निस्सी महिम्ने नमः. ओम कोविदानाहंपतये नमः. ओम दिवोदासाय नमः. ओम प्राणाचार्याय नमः. ओम विषङ्मणये नमः. ओम त्रैलोक्यनाथाय नमः. ओम भक्ति गम्याय नमः. ओम तेजोनिधये नमः. ओम कालकालाय नमः. ओम परमार्थगुरवे नमः. ओम जगदानन्ददायकाय नमः. ओम आदिवैद्याय नमः. ओम रंगनिलयाय नमः. ओम सर्वजनसेविताय नमः. ओम लक्ष्मीपतये नमः. ओम सर्वलोकरक्षकाय नमः. ओम कावेरी स्नानसन्तुष्टाय नमः. ओम सर्वाभीष्टप्रदायकाय नमः. ओम श्री धन्वन्तरये नमः. ओम नमो भगवते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामेव विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमः. ओम सपरिवाराय धन्वन्तरये नमः. नानाविधानि परिमलपत्र पुष्पाणि समर्पयामि. ओम सहस्रशीर्षा पुरुषः सहस्राक्ष सहस्रपात् सभूमिं विश्वतो कृत्वा अत्यतिष्ठद्दशाङ्गुलं पुरुष एवेदकं सर्वं यद्भूतं यच्च भव्यं उतामृतत्वस्येषानः यदन्नेनातिरोहति एतावानस्य महिमा अतो ज्यायागश्च पूरुषः पादोऽस्य विश्वाभूतानि त्रिपादस्यामृतं दिवि त्रिपादोद्भवोदयत्पुरुषः पादोऽस्येह भवात् पुनः ततो विश्वं विक्रामत् शासनानसने अभि तस्मात् विराड जायत विराजो अधिपूरुषः स जातो अत्यरिच्यत पश्चात् भूमिमथो पुरः यत्पुरुषेण हविषा देवा यज्ञमतन्वत वसन्तो अस्यासीदाज्यं ग्रीष्म युध्म शरद्धविः सप्तास्यासन् परिधयः त्रिसप्त समिधः कृताः देवायज्ञन्तन्वानाः अभद्रन् पुरुषं पशुं तं यज्ञं बर्हिषि प्रोक्षन् पुरुषं जातमकृतः तेन देवा अयजन्त साध्यार्षयश्चये तस्मात् यज्ञात् सर्वभूतः संभृतं पृषदाज्यं अशोकस्तागश्चक्रे वायव्यान् आरण्यान् ग्राम्याश्चये तस्मात् यज्ञात् सर्वभूतः ऋचस्सामान् जज्ञिरे छन्दागं च जज्ञिरे तस्मात् यजुस्तस्मात् अजायत तस्मादश्वा अजायन्त एके चोभयादतः गावोः जज्ञिरे तस्मात् जाता अजावयः यत्पुरुषं यदिधुः कथिता व्यकल्पयन् मुखज्ञमस्य कौ बाहु काबूरूपादावुच्येते ब्राह्मणोऽस्य मुखमासीत् बाहुराजन्यः कृतः ऊरोदस्य यद्वैश्यः पद्भ्यागं शूद्रो अजायत चन्द्रमा मनसो जातः चक्षोः सूर्यो अजायत मुखादिन्द्रश्चाग्निश्च प्राणाद्वायुरजायत नाभ्या आसीदन्तरिक्षं शीर्ष्णोद्यौ समवर्तत जाम्बूनिर्दिशश्रोत्रात् तथा लोकागमकल्पयन् वेदाहमेतं पुरुषं महान्तम् आदित्यवर्णन्तमसस्तु पारे सर्वाणि रूपाणि विचित्य धीरः नामानि कृत्वाभिवदने यदास्ते धाता पुरस्ताद्यमुदा जहार शक्रः प्रविद्वान् प्रतिष्ठितस्रः तमेवं विद्वान् अमृत इह भवति नान्यः पन्था अयनाय विद्यते यज्ञेन यज्ञमयजन्त देवाः तानि धर्माणि प्रथमान्यासन् ते हनाकं महिमानः सजन्ते यत्र पूर्वे साध्याः सन्ति देवाः अद्भ्यः सम्भूतप्रसर्गीरसाश्च विश्वकर्मणः समवर्ततादि तस्य त्वष्टाविदद्रूपमेति तत्पुरुषस्य विश्वमाजारमग्रे वेदा इति मुडिटं वेदाहमेतं पुरुषं महान्तम् आदित्यवर्णं तमसः परस्तात् तमेवं विद्वान् अमृत इह भवति नान्यः पन्था विद्यते यनाय प्रजापतिश्चरति गर्भे अन्तः अजायमानो बहुधा विदायते तस्य धीराः परिजानन्ति योनिं मरीचीनां पदमिच्छन्ति वेधसः यो देवेभ्य आदपति यो देवानां पुरोहितः पूर्वो यो देवेभ्यो जातः नमो ऋचाय ब्राह्मये ऋचं ब्राह्मं जनयन्तः देवाग्रे तदब्रुवन् यस्त्वैवं ब्राह्मणो विद्यात् तस्य देवा असन्वशे ह्रीश्चते लक्ष्मीश्च पत्न्यौ अहोरात्रे पार्श्वे नक्षत्राणि रूपम् अश्विनौ व्यात्तम् इष्टं मनिषाण अमुं मनिषाण सर्वं मनिषाण सहस्रशीर्षं देवं विश्वाक्षं विश्वशम्भुवं विश्वनारायणं देवमक्षरं परमं पदं विश्वतः परमान् नित्यं विश्वनारायणगं हरिं विश्वमेवेदं पुरुषस्तद्विश्वमुपजीवति पतिं विश्वस्यात्मेश्वरगं शाश्वतगं शिवमच्युतं नारायणं महाज्ञेयं विश्वात्मानं परायणं नारायणपरो ज्योतिरात्मा नारायणपरः नारायणपरं ब्रह्मसत्त्वं नारायणपरः नारायणपरोऽध्याता ध्यानं नारायणपरः यच्चिकिञ्चिज्जगत् सर्वं दृश्यते श्रूयतेऽपि वा अन्तर्बहिश्च तत्सर्वं व्याप्य नारायणस्थितः अनन्तमव्यजं कविगुं समुद्रेऽन्तं विश्वशम्भुवं पद्मकोशप्रतीकाशकं हृदयं चाप्यधोमुखम् अधोनुष्ट्यापितस्यान्तेनाभ्यामुपरि तिष्ठति ज्वालमालाकुलं भाति विश्वस्यायतनं महत् सन्ततकं शिलाभिस्त्वलम्बत्याकोशसन्निभं तस्यान्ते सुशिरगं सूक्ष्मं तस्मिन् सर्वं प्रतिष्ठितं तस्य मध्ये महानग्निर्विश्वार्चिर्विश्वतोमुखः स्वग्रभुक्भुजं तिष्ठन्नाहारमजरः कविः तिर्यगूर्ध्वमधशायी रश्मियः सत्यसन्तता सन्तापयति स्मं देहमापादतलमस्तकः तस्य मध्ये वह्निशिखा अणीयो ऊर्ध्वा व्यवस्थितः नीरतोऽगितमध्यस्थाः विद्युल्लेखेव भास्वर नीवारशूकवत्तन्वी पीताभास्वत्यणोपमा तस्याः शिखाया मध्ये परमात्मा व्यवस्थितः स ब्रह्म स शिव स हरिस्सेन्द्र सोऽक्षर परमस्वराट् पृथगं सत्यं परं ब्रह्मपुरुषं कृष्णपिङ्गलम् उद्धरेतं विरूपाक्षं विश्वरूपाय वै नमो नमः नारायणाय विद्महे वासुदेवाय धीमहि तन्नो विष्णु प्रचोदयात् विष्णोर्नुकं वीर्याणि प्रवोचं यः पार्थिवानि विममे रजागं सयो अस्कभागिदुत्तरगं तथस्थं विचक्रमाणस्त्रेधोरुगायो विष्णोरराटमद विष्णो पृष्ठपद विष्णो श्नप्त्रे स्थो विष्णो स्यूरद विष्णो ध्रुवमसि वैष्णवमद विष्णवे त्वा ओम जातवेदसे सुनवाम सोममराति यतो निदहाति वेदः सरपरिषदिति दुर्गान् विश्वा नावेव सिन्धुं दुरितात्यग्निः तामग्निवर्णान् तपसा ज्वलन्तीं वैरोजनीं कर्मफलेषु जुष्टां दुर्गां देवीं शरणमहं प्रपद्ये सुतरसतरसे नमः अग्ने त्वं पारयानव्यो अस्मान् स्वस्तिभिरति दुर्गान् विश्वा पूश्च मर्चैव हुलान् ब्रुवी भवातोकायतनयागसिंयोः विश्वानिनो दुर्गः जातवेदस्सिन्धुन्ननावादुरितादिपर्षि अग्ने अत्रिवन्मनसाग्रनानोऽस्माकं बोध्यविता तनूनां प्रतनादितकं सहमानमुग्रमग्निगुंहुवेम परमात्तधस्तात् सरपरिषदिति दुर्गाण विश्वाक्षामद्देवो अतिदुरितात्यग्निः प्रत्नोषिकमेड्यो अध्वरेषु धनाच्यहो तानव्यच्च सत्सि स्वाञ्चाग्नेतनमुं पिप्रयस्वास्मभ्यं च शोभगमायति स्व वो भर्जिष्ठुर्मयि जोनुषिक्तन्तवेन्द्रविष्णोरणसञ्चरेम नागस्य पृष्ठमपि संवसारो वैष्णवीं लोक इहमादयन्तां कात्यायनाय विद्महे कन्याकुमारी धीमहि तन्नो दुर्गी प्रचोदयात् हिरण्यवर्णां हरणीं सुवर्णरजतस्रजां चन्द्रां हिरण्मयीं लक्ष्मीं जातवेदो महावः तां महावह जातवेदो लक्ष्मीमनपगामिनीं यस्यां हिरण्यं विन्दे जङ्गामश्वं पुरुषानहम् अश्वपूर्वामृतमध्यां हस्तिनादप्रबोधिनीं श्रियं देवीमुपक्वये श्रीर्मा देवीर्जुषतां कांसोस्मितां हिरण्यप्राकारामार्द्रां ज्वलन्तीं तृप्तां तर्पयन्तीं पद्मे स्थितां पद्मवर्णान्तां मिहोपक्वये श्रियं चन्द्रां प्रभासां यशसा ज्वलन्तीं श्रियं लोके देवजुष्टामुदारां तां पद्मिनीमीं चरणमहं प्रपद्ये अलक्ष्मीर्मे निश्चितां त्वां वृणे आदित्यवर्णे तपसोऽधि जातो वनस्पतिस्तव वृक्षोऽथ बिल्वः तस्य फलानि तपसानुदन्तु मायान्तरायाश्च बाह्या अलक्ष्मीः उपैतु मां देवतः कीर्तिश्च मणिना सह प्रादुर्भूतोऽस्मि राष्ट्रेऽस्मिन् कीर्तिवर्धिन्ति धातु मे क्षुत्पिपासामलां ज्येष्ठामलक्ष्मीर्नाशयाम्यहम् अभूतमसमृद्धिं च सर्वान्यन्नुतु मे गृहात् गन्धद्वारां दुराधर्षान् नित्यपुष्टाङ्करीषिणीम् ईश्वरीं सर्वभूतानां तामिहोपक्वये श्रियं मनसः काममाकूतिं वाचः सत्यमशीमहि पशूनागं रूपमन्यस्तमहि श्रीयतां यशः गर्दमेन प्रजाभूतामहि सम्भव गर्दमा श्रियं वासिक मे कुले मातरं पद्ममालिनीम् आपसृजन्तु स्निग्धानचिक्लीतवसमे गृहे यच देवीं मातरकं श्रियं वासिक मे कुले आर्द्रां पुष्करणीं पुष्टिं सुवर्णां हेममालिनीं सूर्यां हिरण्मयीं लक्ष्मीं जातवेदो महावः आर्द्रां यःकरणीं इष्टिं पिङ्गळां पद्ममालिनीं चन्द्रां हिरण्मयीं लक्ष्मीं जातवेदो महावः तां महावह जातवेदो लक्ष्मीमनपगामिनीं यस्यां हिरण्यं प्रभूतङ्गावो दास्योश्वान् विन्देयं पुरुषानहं महादेवी च विद्महे विष्णुपत्न्यै च धीमहि तन्नो लक्ष्मी प्रचोदयात् भूमिर्भूम्नाद्यौर्वरिणान्तरिक्षं महित्वा उपस्थे ते देव्यदि ते अग्निमन्नादमन्नाद्याजादधे आयङ्गौ प्रश्निरक्रमे दशनन्मातरं पुनः पितरं च प्रयन्सुवः त्रिगुंशद्धाम विराजति वाक्पतङ्गाकिश्रिये प्रत्यस्य वहद्युभिः अस्य प्राणादुपारत्यन्तश्चरतिरोचना यक्षन्महिषस्वः यत्वा क्रुद्धः परो वपमन्युनागदवर्त्या स्वकल्पमग्ने दत्तवपनस्तो दीपयामसि यत्येवन्युपरोक्तस्य पृथिवीमनुदध्वसे आदित्या विश्वेतद्देवावसमश्च समाभरन् मनो ज्योतिर्जुषतामाद्यं विच्छिन्नं यज्ञकं समिमं दधातु बृहद्भुजस्तनुता विमन्नो विश्वे देवा ह्यमादयन्तां सप्तते अग्ने समिधः सप्तजिह्वा सप्तर्षयः सप्तधाम प्रियाणि सप्तहोत्रा सप्तधात्वा यजन्ति सप्तयो नीरापणस्वाघृतेन पुनरोर्जानिवृत्तस्व पुनरग्निगिषायुष पुनर्न पाहि विश्वतः सहरय्यानिवृत्तस्वाग्नेर्बिन्वस्पुधारय विश्वप्सनिया विश्वतस्परि लेखस्तलेखस्वलेखस्तेन आदित्या आद्यञ्जुषाणावियन्तु केतस्तकेतस्सुकेतस्तेन आदित्या आद्यञ्जुषाणावियन्तु विवस्वागम् अतिथिर्देवज्योतिस्तेन आदित्या वाङ्कुड कैल तेन आदित्या आद्यञ्जुषाणावियन्तु आदित्यन् ऋग्वेद कैमरा पास कैमरा और पकड़ திருப்பிப்பா தம்பி தம்பி கேமரா அவர் பக்கம் திருப்பு இந்த பக்கம் திருப்பு
ओम या ओषधी पूर्वा जाता देवेभ्यस्त्रियुगं पुरा मनौनु बभ्रूणामहं शतं धामानि सप्त च शतं वो अम्बधामानि सहस्रमुतवोरुहा अधा शतक्रत्वो यूयमिमं मे अगदं कृता ओषधी प्रतिमोदध्वं पुष्पवती प्रसूवरी अश्वा इव सजित्वरीर्वीरुधः पारयिष्ण्वा ओषधीरिति मातरस्तद्वो देवीरुपब्रुवे സനേയമശ്വംഗാം വാസ ആത്മാനന്തവ പൂരുഷാ അശ്വത്ഥേവോ നിഷദനം പർണേവോ വസതിഷ്കൃതാ ഗോഭാജ ഇൽ കിലാസഥയൽ സനവഥ പൂരുഷം യത്രൗഷധീ സമഗ്മതരാജാനഃ സമിതാവിവാ വിപ്രസ്സ ഉച്യത്തെ ഭിഷഗ്രക്ഷോഹാമീവ ചാതനാ അശ്വാവതീം സോമാവതീമൂർജയന്തീമുദോജസം ആവിത്സി സർവാ ഓഷധീരസ്മാ അരിഷ്ടതാതയേ ഉച്ഛുഷ്മാ ഓഷധീനാംഗാവോ ഗോഷ്ഠാദിവേരത്തെ ധനം സനിഷ്യന്തീനാമാത്മാനന്തവ പൂരുഷാ ഇഷ്കൃതിർനാമവോ മാതാഥോ യൂയം സ്ഥനിഷ്കൃതി സീരാഃ പതത്രിണീ സ്ഥനയദാമയതി നിഷ്കൃതാ അതിവിശ്വാഃ പരിഷ്ഠാസ്തേന ഇവ വ്രജമാക്രമൂ ഓഷധീഃ പ്രാചുച്യവുര്യൽ കിഞ്ച തന്നോരപാ യദി മാ വാജയന്നഹമോഷധീർഹസ്ത ആദധേ ആത്മായക്ഷ്മസ്യ നശ്യതി പുരാ ജീവഗൃഭോ യഥാ യസ്യ ഔഷധീഃ പ്രസർപ്പഥാംഗമംഗം പരുഷ്പരൂ തതോ യക്ഷ്മം വിബാധധ്വ ഉഗ്രോ മധ്യമശീരിവാ സാകं യക്ഷ്മ പ്രപത ചാഷേണ കികിദീവിനാ സാകം വാതസ്യ ധ്രാജ്യാ സാകം നശ്യ നിഹാകയാ അന്യാവോ അന്യാമവത്വന്യാന്യസ്യാ ഉപാവതാ താഃ സർവാഃ സംവിദാനാ ഇദം മേ പ്രാവതാവചാ യാഃ ഫലിനീര്യാ അഫലാ അപുഷ്പായാശ്ച പുഷ്പിണീ ബൃഹസ്പതി പ്രസൂതാസ്താനോ മുഞ്ചന്ത്വം ഹസാ മുഞ്ചന്തു മാശപഥ്യാദഥോ വരുണ്യാദുതാ അഥോ യമസ്യ പഡ്ബീശാൽ സർവസ്മാദ്ദേവ കിൽബിഷാൽ അവപതന്തിരവദന്തി വ ഓഷധയസ്പരീ യഞ്ജീവമശ്നവാമഹൈ ന സരിഷ്യാതി പൂരുഷാ യാ ഓഷധീഃ സോമരാജ്ഞീർബഹ്വീഃ ശതവിചക്ഷണാ താസാം ത്വമസ്യുത്തമാരं കാമായ സംഹൃദേ യാ ഓഷധീഃ സോമരാജ്ഞീർവിഷ്ഠിതാഃ പൃഥിവീമനു ബൃഹസ്പതി പ്രസൂതാ അസ്യൈ സന്തത്തവീര്യം മാവോരിഷൽ ഖനിതായസ്മൈ ചാഹം ഖനാമി വാ ദ്വിപച്ചതുഷ്പദസ്മാകം സർപ്പമസ്ത്വനാതുരം യാശ്ചേദമുപശൃണ്വന്തി യാശ്ച ദൂരം പരാഗതാഃ സർവാഃ സംഗത്യ വീരുധോസ്യൈ സന്തത്തവീര്യം ഓഷധയഃ സംവദന്തെ സോമേന സഹ രാജ്ഞാ തസ്മൈ കൃണോതി ബ്രാഹ്മണസ്തം രാജൻ പാരയാമസി തമുത്തമാസ്യോഷധേ തവ വൃക്ഷാ ഉപസ്തയാ ഉപസ്ഥിരസ്തു സോസ്മാകं യോ അസ്മ അഭിദാസതി. ആയുസ്സുത്തമം ആയുസ് मुञ्चामि त्वा हविषा जीवनायकमज्ञातयक्ष्मादुतराजयक्ष्माल् ग्राहिर्जग्राह यदि वै तदेनन्तस्या इन्द्राग्नि प्रमुक्तमेनम् यदि क्षितायुर्यदि वा परेतो यदि मृत्योरन्तिकन्नीत एवा तमाहरामि निरृतेरुपस्थादस्पार्शमेनं शतशारदाया सहस्राक्षेण शतशारदेन शतायुषा हविषाहार्षमेनम् शतं यथेमं शरदो न यातीन्द्रो विश्वस्य दुरितस्य पारम् शतं जीव शरदो वर्धमानः शतं हेमन्तान् शतमु वसन्तान् शतमिन्द्राग्नि सविता बृहस्पतिः शतायुषा हविषेमं पुनर्दूः आहार्षन्त्वा विदन्त्वा पुनरागाः पुनर्नवाः सर्पांग सर्पन्ते चक्षुः सर्पमायुश्च ते विदम् अक्षीभ्यान्ते नासिकाभ्यां कर्णाभ्यां चुबुकादधी यक्ष्मं शीर्षण्यं मस्तिष्काज्जिह्वाया विवृहामि ते ग्रीवाभ्यस्त उष्णिहाभ्याः कीकसाभ्यो अनूक्याल् यक्ष्मन्दोषण्यामंसाभ्यां बाहुभ्यां विवृहामि ते आन्त्रेभ्यस्ते गुदाभ्यो वनिष्ठोर्हृदयादधी यक्ष्मं मतस्नाभ्यां यक्नः प्लाशिभ्यो विवृहामि ते ऊरुभ्यान्ते अष्ठीवद्भ्यां पार्ष्णिभ्यां प्रपदाभ्यां यक्ष्मं श्रोणिभ्यां भासदाद्भंससो विवृहामि ते मेहनाद्वनं करणाल्लोमभ्यस्ते नखेभ्यः यक्ष्मं सर्वस्मादात्मनस्तमिदं विवृहामि ते अङ्गादङ्गाल्लोम्नो लोम्नो जातं पर्पणि पर्पणि यक्ष्मं सर्वस्मादात्मनस्तमिदं विवृहामि ते
இப்ப பூர்ணாவதி நடக்க போறது. பூர்ணாவதி முடிஞ்சு தீபாராதனை முடிஞ்சோன்னா எல்லாரும் வரிசையா இந்த துளசியை கையில் எடுத்துட்டு வந்து சுவாமிக்கு போட்டுவிட்டு நமஸ்காரம் பண்ணிட்டு வெயிட் பண்ணினா அப்புறம் பிரசாதம் வாங்கிட்டு வரலாம். இந்த ப்ரோக்ராம் இதோட முடியும். மேக்ஸிமம் எல்லாத்துக்கும் சேர்த்து ஒரு 5 to 7 நிமிஷம் ஆகும். பூர்ணாகுதி ஆக போறது. எல்லாரும் சாவதானமா இங்கேயே பார்த்துக்கணும்னு பிரார்த்தனை பண்ணிக்கணும். எல்லா மன பிரார்த்தனைகளும் இப்ப செலுத்த வேண்டிய நேரம் இது. சக்கரவர்த்தி சார் அங்க 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 போறோமா?
देवादिवेद्य निरवज्य गुणैकवेद्य तेजोदिहृद्य मघवाद्यमराभिवेद्य संसारसागरतरे नृहरे मुरारे धन्वन्तरे तव पदे शरणं प्रपद्ये धन्वन्तरे तव पदे शरणं प्रपद्ये रोगातिरेकशमनक्षमदेवदेव देवासुरेन्द्रनुतपादमहानुभावा भावाभिगम्य मुनिराज्यनता शरण्य धन्वन्तरे तव पदे शरणं प्रपद्ये धन्वन्तरे तव पदे शरणं प्रपद्ये त्वत्पादपङ्कजरजः पटलानुषङ्गात् दूरात् प्रधावति रजो बहुजन्मसक्तम् तस्मादुपेन्द्र किमतः परमत्र चित्तम् धन्वन्तरे तव पदे शरणौ प्रपद्ये धन्वन्तरे तव पदे शरणं प्रपद्ये क्षीराम्बुद परमपावनताङ्गतोऽभूत् ते जन्मनैव नहि कल्मककामगोभ्यां व्याधीन्महीतलभवान् परिहर्तुमासीः धन्वन्तरे तव पदे शरणं प्रपद्ये धन्वन्तरे तव पदे शरणं प्रपद्ये लक्ष्मी तवाङ्घ्रिजलजं येते प्रियेण वक्त्राम्बुजातमुपयाति सरस्वती च ब्रह्मादयश्च मरुतस्तव देहभागाः धन्वन्तरे तव पदे शरणं प्रपद्ये धन्वन्तरे तव पदे शरणं प्रपद्ये आदिधन्वन्तरे तुभ्यं शान्तगम्भीरतेजसे ओजसे सर्वदेवानाम् आदिवैद्याय मङ्गलम् आदिवैद्याय मङ्गलम् आदिवैद्याय मङ्गलम्
நான் வாங்கி வந்திருந்தாருன்னா கேட்கலாம். எல்லாரும் உட்கார்ந்தா போய் கலசம் தலைக்கிறது சௌகரியமா இருக்கும். பின்னாடி சம்பாரம் ஏற்பாடு பண்ணிருக்கேன். அது முதல்ல கொண்டு வச்சுக்கோ. ஏதாவது தட்டில் வெத்தலை போக கூட யாருக்கு சார் ஹேண்ட் ஓவர் பண்ணுங்க. லாஸ்டா இருக்காரு. லாஸ்டாரு எஸ்எஸ் சாரு ஏவோ நீங்க ஒவ்வொரு நெல்லிக்காய் ஒவ்வொரு டிப்ல போடணும். ஒவ்வொரு கிலோ நெல்லிக்காய்
Check. Hello.
Namasabhaye, Shri Gurubhyo Nama, pranams to one and all present here, a very warm welcome to all. Today, the very special day, our college is celebrating Sri Dhanvanthari Jayanthi as 5th National Ayurveda Day 2020. I heartily welcome all of you here. Our humble pranams to His Holiness Sri Shankara Vijayendra Saraswati Swamigal, with the blessings of His Holiness Sri Shankara Vijayendra Saraswati Swamigal, on behalf of Sri Jayendra Saraswati Ayurveda College and Hospital, Department of Ayurveda of Sri Chandrasekharendra Saraswati Vishwamahavidyalayam, would like to invite Honorable Vice Chancellor Professor S.V. Raghavan Sir, Registrar Sir, FO Sir, EC team members, Principal in charge Professor Dr. Chittaranjan Das Sir, AO Sir, MC team, all the teaching and non-teaching staff, PG scholars and internees of Sri Jayendra Saraswati Ayurveda College and Hospital for this program. Now, I request Dr. S. Swaminathan Sir to deliver the welcome address.
Om Shri Gurubhyo Namaha. Bhadram Karnebhiki Shrunuyama Devaha. Bhadram Pashyema Akshabiryajatraha. Dhirai Rangai Stuštuvagam Shastanopihim. Vyashema Devahitam Yadayuhu. Swastina Indro Vruddhasravaha. Swastina Pusha Vishwavetaha. Swastina Starksho Arishtanemihim. Swastino Bragaspatir Dadadhu. Om Shanti Shanti Shanti. This was the Veda mantra chanted in the Vedokta Kalaha by the Rishis in order to avoid Adhyatmika, Adi Bhautika, Adi Daivika rogas. This comes in Sandhya Vandanam daily in the morning. And so, it is my pleasure to invite all those who have assembled here on this wonderful Sri Dhanvanthari Jayanti Day, and we are all here to receive the blessings of Acharyas, of the Bhagavan, and this is the first of its kind in this college. And so, it is my duty to welcome all of you on this wonderful day, and I continue the address at a later period because our beloved Dr. Somit Kumar, the student of our college, is there ready now to address all of us. So I welcome Dr. Somit Kumar on a virtual mode to talk with all of us. Thank you.
Sir, can you kindly unmute your audio and you can start the session, sir.
If it's possible that I can share the screen, please. Can I be given rights to share my screen, please?
Sir, sir, you can share your screen, sir.
Shall I start? So, respected dignitaries, respected Principal Dr. Chittaranjan Das sir, Dr. Swaminathan sir, Dr. Venugopalan sir and all my gurus who have taught me in the great institution, and it's a real privilege that I'm able to share few thoughts on COVID-19, and that too with inspiration of a divine soul who just left us, Krishna Kumarji. So on the occasion of Dhanvanthari Jayanthi, first we pay our homage to his divine soul and also seeks blessings from Lord Dhanvanthari. And I'm going to share our experiences. So I'm not going to share what we hypothesize about COVID-19 or what we think about, but what we are going to discuss is what we have done for COVID-19. So at this outset, I would like to really introduce you to the team who worked behind this whole project, which we did at Stanley Medical College, Chennai. And I would like to thank each and every team member who were part of this project and working together on the front line. And especially, we also have a representative and alumni of Sri Jayendra Saraswati Ayurveda College, apart from me, Tarkesh, who was working every day with us, lending the healing hand to the patient. So there are a lot of discussion around what Ayurveda can do in COVID-19. And I think Ayush, different institutions and different individuals have successfully been treating COVID-19 with different level of severity and with different outcomes and with different advantages. So I'm not going to go detail into that, but we are going to talk about what we did specifically in management of COVID-19. The first criticism we as an Ayurvedic fraternity basically come across is 80% of the COVID-19 cases are self-limiting. So if 80% are self-limiting, whether you treat or you do not treat, you don't get many objective parameters of efficacy of Ayurveda intervention. So we wanted to be very sure that whatever patient we treat first should be in a category where disease is not self-limiting. And second, there should be a proper control, that we should be able to compare as to whether our treatment was advantageous, better, or certain value was added to the patient health care or not. So that's why we chose a topic of type 2 diabetes, which is one of the high risk group where a necessary hospitalization is there in event of a COVID-19 infection. And then what we did was we added Ayurveda intervention into the existing therapy. So when you talk about under the legal provisions in Tamil Nadu, you need to add on or integrate your therapy because they have a high risk, and as per ICMR guideline, they have to be treated. So there were two arms, one arm who received only the allopathic therapy and the other arm which received allopathy and Ayurveda therapy together. Now, if you look through the whole pathogenesis of COVID-19, there are two basic phases. The first is the viral phase, and the second is called as host inflammatory phase. So the first phase where you see first 7 days is the viral phase, where viral replication is mostly predominant, associated with mild symptoms of fever, sometimes not, dry cough, diarrhea, and headache. Seems to be very mild symptom of flu. But then what we see is this is a most important phase from an Ayurvedic perspective. If you go through the whole management of Jwara in Ayurveda, Jwara has been divided into two main phases. The first 7 days is first called as Ama phase or Ama Jwara. And then second phase is Pachimana Jwara, and then Jirna Jwara or Sannipatika Jwara or whatever it can become. Now, in COVID, what we have from our studies seeing that the first 7 days of management is very important, because if you give an Ayurvedic therapy as an add-on also, later when the patient is already past 7 to 8 days of his symptoms, and if he's in a high risk group, there can be limited response. But if you start early, you can save the patient from having a complication of COVID-19. So the thumb rule, what we saw from our evidence is start early, start with the Amajora Chikitsa, Tikta Pachana, but at the same time choose therapies which are Deepana Pachana, of course, Anulomana, and second important thing is Shopahara therapy has to be done. So the second phase, when it crosses 7 days, it basically becomes a host inflammatory phase where it starts showing the symptoms of shortness of breath, hypoxia, and in due course of time, it the whole inflammation consolidates into a fluid-filled consolidation viral pneumonia, which is called as ARDS, which leads to then shock, septic shocks, cardiac failure, and then you have a host of other complications leading to death. Now, what we were doing in our study. So what we wanted to basically target is how can we prevent people getting into a acute complication which happens in, according to Jwara pathology, after Amajwara phase. If Amajwara phase is not properly managed, then it becomes Dhatu Gata, and Dhatu Gata Jwara leads to a lot of complication. So one of the major timeline what we see in COVID management is, this is as per Lancet, one of the most coveted journal, that on an average, first 7 days, people do not get admitted, those who are high risk patients. Basically, they come to hospital only on 7th day when the symptoms of dyspnea, acute respiratory distress, which sets between 8th day to 11th day, which they come to the hospital. So it is very important that if you are a high risk group, if you have a mild symptom, also start in taking some intervention. Otherwise, it can lead to the complication. So now, based on this, what happens in the first 7 days then? So one important thing is what was also rational behind choosing diabetics as one of the inclusion criteria for our study. So it is understood very well in modern literature also that type 2 diabetes is a high risk group which has more disease mortality and fatality. So people die more, likelihood of death in type 2 diabetic cases are more, and likelihood for getting into ICU also, it is more. So we wanted to see that whether through our intervention, whether we can reverse that, can we reduce the number of patients into ICU and a severe form of disease being a high risk group patients. Then why Ayurvedically also it was very important, because we know Krimi likes Kleda, and as per Ayurveda, in Prameha, Kleda is a major dushya. Now, there are enough evidence that people with Kleda background and Prameha associated with disease like hypertension and other cardiac involvement, they have higher fatality or they get into high risk group and death is high. So that's why we chose those people with these comorbidities. So in our study, we were taking only those people who were essentially type 2 diabetic, not well controlled sugar levels, with associated almost 50% people had hypertension, some 3 to 5% people were also having a mild form of asthma and other diseases. So we started our intervention based on this whole Ayurvedic thought process of ama phase with Sannipatika Jwara background. Of course, it was not just Vata Kapha as we basically discussed. It was a combination of all the doshas, and we did dosa dusha vichara and then customized our therapy based on what were the clinical phenotypes. Now, in Charaka, if you look at, there are two chapters. One is Rajakshma and then it's Sosha. Now, why did they talk about Sosha as separate chapter? Now, Sosha is a pathology which is a continuation of Shotha. Now, when you have a predominance of Kleda in your system, whenever a krimi enters into system, it starts creating Vidaha. And this Vidaha turns into Shopha. And then the Shopha creates lot of Ama Visha. And this Ama Visha slowly starts creating the process of Kotha. Kotha, that means sepsis, and Sosha, the tissue necrosis. Now, this whole thought process we had basically taken behind the treatment methodology. So the first phase, we tried to reduce Kledahara, Amahara, Tiktapachana, Jwara Dravyas, but at the same time, seeing that it attacks basically lungs and heart. So we also chose a combination which had Hridya, Tiktapachana, Deepana Pasana, Anulomana, Aushadha. So we chose Panchatikta Kakshayam, which had Guduchi, Kantakari, Pushkar Moolam, Shunthi, Kirata Tiktam. So what happens is Pushkar Moolam is also very good for Parshashula and basically very good for Urha Pradesha when you have a inflammation or Shopha. So this was a major treatment protocol which was for the Ama phase, and then we went to the Pachamana phase, or when they have already Shopha CT consolidation is there, then we add Bharangyadi Kashayam, which was Dashmulam. Now in Shopha, what happens is Dashmula is a very important choice of combination because it's one of the best Shophara, Tridoshahara drug. Now, this was a Ayurvedic thought process, but then what prompted us to do this is because from modern molecular biology, we wanted to also understand how this disease progresses and becomes fatal. So if you look at the modern microbiology as well as modern molecular biology concepts, there are very important attributes to it. So I just wanted to very shortly explain you, when the virus reaches your alveolus, it starts creating a fight between your neutrophils. Now, what are neutrophils? They are part of your innate immune cells. So when the virus enters your alveolus and cell, it starts fighting the virus, the neutrophils, and then starts secreting so many cytokines. Cytokines are proteins. And these cytokines then starts exuding lot of protein-rich fluid. So what happens is IL-6 is a marker of a acute autoimmune response to something which is toxic or something which is not suitable for your human homeostasis. So when the IL-6 is increasing, and that too, it increases many diseases, even diabetic complication, it increases, in cancer, it increases. But here, this increase is potentiated by a external or exogenous called Agantuja Nidana, that is the COVID-19 virus. And if you are able to modulate, I'm not saying we have to suppress, modulate this response, then likelihood of this protein-rich fluid which is getting accumulated as a response to virus reduces. Now, why this is important? The moment this protein-rich fluid fills the alveolus, what it does, it stops the process of air exchange into the blood capillaries. And that's why all of a sudden on 7th or 8th day after your first symptom, you get into the ICU with hypoxia, less oxygen saturation. Now, if you would have been able to modulate this IL-6 response right from the first day when you got mild symptoms, you would not have landed in a state where your lungs would have been filled with these fluid. Now, for this, what kind of intervention we should give? And that's where we took Panchatikta Kashayam and Bharangyadi Kashayam as the main intervention which we gave in the AMA phase. And then we studied whether in the first 7 days, whether it can modulate IL-6. Why? Because if you can modulate or balance this IL-6 secretion in the patient, there is less likelihood to get the complication of these hypoxia and sepsis, which can happen later. So that's why what we took was, we took almost 54 patients finished the study, and basically they all were RT-PCR positive, 18 to 75 years of age between. They were all type 2 diabetes. And then SpO2 was not less than 94 at the baseline. Of course, during the course of therapy, they can go less also, but at the time of intervention, starting your research, you should, both the groups, both the control group as well as an Ayurveda experimental group, their oxygen saturation was up to 94. Now, exclusion criteria, any other comorbidity which had IL-6 can also increase because of that, like your cardiovascular disease, active renal diseases, HIV, pregnant woman, malignancy, pulmonary disease. These all were excluded. Also, in Ayurveda group, nobody was supposed to be given steroids, remdesivir or tocilizumab, which is an IL-6 modulator. So Ayurveda group had only the azithromycin as one of the antibiotics and multivitamins. So if you look at almost an average age of both the group were very alike. So average age of Ayurveda group with allopathy was 54 years, and average for the allopathic group was 55 years. If you look at the baseline, were they really diabetic? Yes, they were diabetic. Average HbA1c at the time when we started the study and started treating them, an average HbA1c was 10.2 for the Ayurveda group and 9.44 for the allopathic group. If you look at the whole symptomatology, so we are talking about a lot of symptomatology. So fever, of course, was one of the major symptoms. Of course, up to 50 to 60% people had fever at the time of induction, where we started them in study. But many of them, people also had a previous history. So people who come on 4th day or 5th day in our study, they didn't show fever symptoms, but they show a history of symptoms, because fever is very early. Once they cross 4th, 5th day, they start talking about more cough and breathlessness. So of course, there were shortness of breath, sore throat. Other important characteristics, specifically for Chennai population, what we found was headache and irritability and general weakness. Now, and nausea and diarrhea. Now, there were a group with gastrointestinal symptoms. There were a group with a neurological symptom. So we had a stark 2 basic group with the corona positive cases with diabetes. Now, what kind of medications we gave? Now, we had, as I told you, one was neurological predominant symptomatology with COVID and gastrointestinal. So gastrointestinal, we basically dealt with more with Indukantam Kashayam and Vilvadi Gulika. So that was one of the best, along with Panchatikta Kashayam, if they come in early phase, like before 4th day of the onset of symptom. But if they come on 5th or 6th day, then you need to basically start directly with Bharangyadi Kashayam, because it's a Bharangyadi Kashayam is an excellent combination with Tridoshaja Sannipatika Jwara, where you have also components of Panchatiktakam as well as Dashmulam and other Deepana Pachana Anulomana Dravyas. And then one important combination along with it, what we have given with breathlessness, of course, Swasanandam and Gorochunadi Gulika. Gorochunadi Gulika seems to be an excellent combination with Sanipatika Jara, with all the muscular, neuro psychological symptoms of COVID. So it was a great revelation of importance of Gorochunadi Gulika. And if it is more Pitta predominant, then Swarmuktadi Gulika. So these two were major. So right now we are getting a lot of post-COVID tiredness, headache, pain in the body. That is where we continue Bharangyadi with Gorochunadi or Swarmuktadi. There, Yograj Gulu and other things doesn't work well. So because it's more hot, Ushna, of course. Now, as I was telling you, is our first aim of our intervention was, can we prevent this inflammatory cytokine storm by 7th day of the onset of the disease? So what we did was, we calculated their IL-6 at the baseline, at the midpoint, that is 7th day, and at the 15th day. If you look at allopathy plus Ayurveda arm, where you see both the group had similar kind of baselines. So that means they were statistically comparable. And then we started therapy, the add-on therapy with Ayurveda. You see within 7 days, there is statistical reduction, almost double the time the IL-6 activity reduced within 7 days when we added Ayurveda therapy. And the add-on allopathic therapy, what I would like to say, was only azithromycin with the multivitamins. Now, the other group received remdesivir, cortisols, tocilizumab, and the other antibiotics as prescribed by them. Now, why this is important, that you have a statistical difference between the IL-6 modulation within 7 days and to the allopathic group, because if we are able to modulate within 7 days IL-6 storm or inflammatory cytokine storm, the probability of the patient becoming severe or requiring ICU or ventilator becomes reduced. So this is what is very important. This data is very important because it gives you an insight that possibly Ayurvedic therapy with, of course, the sample size was 49, that is 24 cases in Ayurveda group, which completed with all the baseline, midpoint, and endpoint data, had a significant change in the IL-6 markers. Now, as I told you, this IL-6 is produced in your body because of the fight between your innate immunity, that is, the cell is called as neutrophils. So your own immune system starts fighting against it. Now, when the virus comes in your body, neutrophils become active, and then it starts secreting IL-6. And because of this fight, a lot of water and other protein-rich food start secreting in the lungs, creating the viral pneumonia. Now, if IL-6 is reducing, is it because of steroids, which can also reduce? But in this case, allopathic group also had steroids, but it did not reduce to a level what Ayurvedic group had. Now, we were quite surprised, and it was totally unexpected to see that neutrophils modulation also happened. Now, what it means that your hypersensitive response, because the high risk group shows a very hypersensitive response neutrophil count. That's why we say NLR ratio. Please, as Ayurvedic physician, when a patient comes, I don't see first whether he's COVID positive or negative. I just see neutrophil versus lymphocyte ratio. And if this NLR value is more than 3, he's a high risk group. More than 4, likelihood he'll get into ICU. 5, very severe critical stage it can go. So if the neutrophils are very high and lymphocyte is very depressed, that shows the acute autoimmune response. So what strikingly, we saw in our data at the end of 15th day that neutrophil modulation was happening. Now, so it proves that the fight between the virus and the your own immune cells was subdued. But then you will say maybe virus replication will increase, because in steroid we are saying that the same thing can happen and increase the viral load. But surprisingly, the other fact I will tell you is lymphocytic activity. Now, lymphocytes are basic cells which eat these viruses. So innate immune response by neutrophil fights the virus, but lymphocytes eat the virus by phagocytosis, that it starts eating the viral protein and cells. If you look at that, there is a continuous surge of lymphocytes in the Ayurveda group. But in allopathic group, in spite of all the drugs, whether it was remdesivir or steroid, of course, steroid is known to suppress the lymphocytic activity, it has a flat curve. That means it did not improve the phagocytic activity. Now, is it my hypothesis? No, we got another empirical proof. Now, another inflammatory marker which we were seeing was C-reactive protein. Now, C-reactive protein, generally we know that is a measure of inflammation. Now, what is it to do with the viral disease? Now, you showed that IL-6 is reducing. So what generally happens in rheumatology or general autoimmune disease, if your C-reactive protein is reducing, IL-6 is also reducing. Or rather we say, first IL-6 reduces, C-reactive protein reduces. But you see, it is opposite in here. Here, Ayurveda group, the C-reactive protein reduces very fast within 7 days, but IL-6 reduces in 7 days, but C-reactive protein does not reduce significantly. Rather, the allopathic response is much fast and better. Now, is it that Ayurveda has failed here? No. The answer is into a research which has been doing, a lot of research has been done is C-reactive protein mediate phagocytosis. Now, as I told you, when the lymphocytic count increases and there is active phagocytosis, that your own immune system is eating up the viral protein, that time you don't want your C-reactive protein to be down. That means your Agni, your heat should be there in the dhatus in order to fight out or digest those ama, which is done by the visha, ama visha, which is produced by viral proteins. So that's why suddenly reducing C-reactive protein by strong anti-inflammatory drugs is not very advisable. That's why steroid leads to, of course, it reduces C-reactive protein, but increases the viral replication. Now, if this theory, what we are talking about is true, then it should reflect on the viral load. Now, did it had an effect on the viral load? We saw that effect also on viral load. Now, if you look at the people who became swab negative by between 10th to 14th day, more than 60% people, almost around 60% people in Ayurveda became negative, swab negative within 10th to 14th day. But in allopathic group, only 45%, like almost 15% difference. Similarly, people who became negative more than 14 days, also we have a difference of 15%. That means what is happening is within 7 days, it not only prevents you from getting into a preventing inflammatory cytokine storm, but also activates your own immune mechanism to continue having this phagocytosis and then create an early viral clearance. Now, this is a documented evidence. Now, if you look at other parameters, so we have a lot of inflammatory markers. One other inflammatory marker is ferritin. So ferritin is a very important inflammatory marker in combination of when there is high inflammation, your hemoglobin breaks much faster and then your ferritin level increases. So did we able to improve that inflammatory response in the hemoglobin inflammation? Also, we did a similar kind of, or rather better inflammatory response, and that's why we can see a lot of if you talk about dhatu basic, I'm not correlating rakta dhatu with blood, but see in the whole management of COVID, rasa rakta has a major role. Now rakta, why? Because pupusa is rakta phena prasadajaha according to Sushruta. So a strong inflammation in rakta dhatu at the structural level in lungs is very important. So that's why you can't just treat rasa, though jwara is rasa pradhana vyadhi. We have done even a analysis of srotodushti for all dhatus, and we have found out a strong srotodushti of annavaha srotas, rasavaha srotas, and raktavaha srotas. And people who were very severe went up to majjavaha srotodushti lakshanas. So people who are having a deeper dhatu srotodushti lakshanas, they had a longer time to improve, or certain cases they took even longer to symptomatically improve, both biochemically as well as symptomatically. So this is very empirically documented that, see, please don't just see from a vata kapha perspective COVID. You have to go dhatugata, and you have to modulate your therapy according to the lakshanas. If you see other parameters of inflammation, D-dimer, prothrombin, LDH, all the levels, we had a very similar kind of response to the allopathic. Then, was it safe? So what we found out, we did for all the patient renal profile and liver profile test, we found out that there was no evidence of any toxicity from Ayurveda add-on therapy. If you look at serum creatinine, it kept on improving. Urea, it was almost flat. SGOT, SGPT response. Now see, SGOT, SGPT is not only a marker for liver enzymes, but also marker for cardiac muscles as well as other muscles. If there is a muscular necrosis, that is any destruction in the muscles, maybe skeletal, any cardiac muscles, or even the muscles of the body, like in the thighs or whatever, wherever there is destruction, the SGOT increases. In fact, if you look at in Ayurveda group, we got patients with high degeneration of muscle and initial level, little higher SGO2 level. Now with our therapy, we could even reduce it significantly, in fact, in this case. But in allopathic group, it again, in between, it increased because they had a lot of maybe liver toxic drugs, and then slowly it improved. But still, it was baseline to endpoint, it was the same. But in Ayurveda group, we kept on improving the liver function. Similarly, in SGPT, of course, again, see, there is a stark improvement in the Ayurveda group. Then ALP response, also stark improvement in the Ayurveda group. In allopathy group, again, the most flat. In sugar levels, of course, you will find a lot of new diabetic because of the COVID-19 infections. Even if you're not diabetic, you had a COVID infection, there is high chance many people with having a family history or a high metabolic profile may get a higher chance of why? Because molecularly, the IL-6 also elevates in type 2 and also in this COVID. So that's why, diabetes and COVID became a very strong comorbidity, strong high risk groups, and or fat, when you have a overweight and all these things, you have to be very careful in management. And what we have seen this, in spite of, in our group, there was no insulin given because there was no steroid allowed in our group. So most of them were not given then insulin. In spite of that, the allopathic group, almost everybody got insulin, we could, maintain a fair amount of sugar level also through our, though we didn't had rights to use other drug, because see, another basic limitation of our study was we were only prescribed to, we were allowed to give only 14 drugs, which are basically Sannipatika Jwara. But since it was Tikta Pachana Dravya, of course, it is also good for Prameha. But still, with our own intervention, we could almost give the same amount of the glycemic control as that of with insulin also people, because most of the allopathic group people, the insulin become a must if you are given steroids, because being diabetic, you give steroids, your sugar level goes high. Now, what were our initial reflections? So first of all, as I told you, IL-6, it's a very important information which we'll have to keep on repeating and also sharing with our colleagues, is that start early in COVID. When you are high risk group, please don't ignore the first few days of symptom, because I have seen many patients taking paracetamol for 1 or 2 days. They become asymptomatic suddenly on 7th and 8th day. Their oxygen saturation goes down, in ICU, dead. I have, in my own experience, 3 people I have seen high risk group dying because they ignored the initial first few days of the symptom. Don't do that, because this is study specifically says that if you want to modulate IL-6 modulation, at least you require on an average 8 days of therapy to become COVID negative. Now, why I say this? Because I have a data towards this. If you look at swab negativity, so what we did was we calculated the day we started Ayurveda therapy, and after starting Ayurveda therapy, how many days later they became COVID negative. So what we saw, it was 7.9 days on an average. But if you would have only been on allopathy, then it would have been 9 days. So 1 day earlier you have become COVID negative. But then again, one important input what we have got, that it takes at least 7 days for us to modulate us inflammatory cytokine storm. So if you have to avoid your admission with acute dyspnea and acute respiratory syndrome, which happens between 8th day to 11th day, you have to start chikitsa on the first day of symptom itself. Or even if you are asymptomatic and you have got swab positive, start your ama jwara chikitsa. So this is one very important message which we have got through our research, and we have been now sharing with all our colleagues. Second, integrative therapy shows earlier viral clearance. Third, very important thing is neutrophil modulation happens with Ayurvedic therapy, which is very difficult in a conventional medicine, because when you suppress lymphocyte, you increase the viral load. But in Ayurveda is such a unique individualized approach that you can do both together. And that is what Ayurveda is great about, and we need to do. So we are trying to include more and more patients with this approach, increase the sample size as much as possible. There is no evidence of toxicity and safety in terms of any liver or kidney function. So an add-on therapy can also be good for high-risk patient. So since we were only dealing with high-risk patient, not disease kind of a patient with a low-risk group, or 80%, as I told you, is self-limiting. So 80% people, whether you treat or not treat, they will improve. But in that 20% people who are high-risk group, and especially diabetic, almost accounts to 10% of that 20% group, we can give a good intervention as an add-on therapy. So thanks to all my gurus for having given me a kind of opportunity to share our research experiences. Now, why I'm sharing is because it was always very openly many data, but yes, of course, there are now peer reviewing going on, and there are statistical analysis, which are deep statistical analysis already on. Soon it will be published. The thing is, Krishkumarji always believed in open source. He wanted to share whatever information we get through our research to everybody, so that all of us can strategize. Second thing is, there was no patency, no patent and proprietary medicine used in this. It was basically a classical Ayurveda medicine, which is across everywhere in this India. So this is first few things which I wanted to discuss with you. Thank you, and I wish you all a very happy Ayurveda day, and we hope Ayurveda will again reach the pinnacle of world order.
Now, I request Dr. S. Swaminathan sir to deliver speech. Thank you, sir. Thank you, Somit sir.
Respected audience, I am here on behalf of our Honorable Vice Chancellor to give a special address sent by our Professor, Dr. S.V. Raghavan, Vice Chancellor from Australia, Sri Chandrasekharandra Saraswati Vishwa Mahavidyalaya. Sir has sent us a good message, which I am reading it in front of all of you. Sri Gurubhyo Namaha. Pranams to His Holiness Sri Shankara Vijayendra Saraswati Swami Ji Maharaj of Sri Kanchi Kamakoti Peetham. I am happy to be in your midst electronically to share my salutations to Lord Dhanvanthari Swami, who is none other than the Parabrahman Sriman Narayanan himself. Om Namo Bhagavate Vasudevaya Dhanvantaraye Amrita Kalasha Hastaye Sarva Amaya Nashanaye Trailokya Nathayam Sri Mahavishnave Namaha. In Bhagavad Gita, Bhagavan Sri Krishna says, I will be there in every yuga to make sure that dharma is maintained. The birth of Bhagavan is not to do to karma, but to serve a purpose. There are 10 such popular avatars that everyone is aware of. However, there are other avatars where one can say a limited purpose for the lack of choice of a better word. One such is the avatar of Swami Dhanvantari, Narayana Swarupam. The express purpose of Dhanvantari avatar is to preach Ayurveda for the well-being of everyone. We are gathered together to praise our Lord Dhanvantari for having bestowed upon us the unique body of knowledge called Ayurveda. Anantakoti Namaskarams to Dhanvantari Bhagavan. Dhanvantari Bhagavan has given to this world Ayurveda in 2 main forms and 8 divisions. In modern medicine related parlance, they are internal medicine and surgery, while internal medicine is an upanga of Rigveda, the surgery is an upanga of Atharva Veda. The emphasis in Ayurveda is more on living as a healthy human being rather than fixing a problem arising out of any type of living. Ayurveda is therefore a long lasting solution with an accompaniment called disciplined life. We, as academics, know that discipline, dedication, and passion are required to succeed in any venture to reach any goal. If the goal is to have healthy life, one has to dedicate oneself to the passionate pursuit of self-discipline. The methodology is laid out clearly and unambiguously in Ayurveda. Being the Vice Chancellor of the prestigious Sri Chandrasekharendra Saraswati Vishwa Mahavidyalaya, I would like to propose two possible actions as a resolution by all of us before Dhanvanthari Bhagavan. They are: number one, in SCSVMV, we teach the basic principles and practice of Ayurveda to all students of the university. I repeat, in SCSVMB, we teach the basic principles and practices of Ayurveda to all students of the university. In SCSVMB, we hold an annual international conference to protect, preserve, defend, and propagate the Ayurvedic tradition. I earnestly hope that the faculty and students of SCSVMB, including the Ayurveda department, concur with me on these two resolutions. Om Namo Bhagavate Vasudevaya. Jai Hind. Thank you.
Thank you, sir. Now, I request the principal in charge of SJS Ayurveda College, Professor Dr. Chittaranjan Das, sir, to proceed over the function.
Savaya Namaha. My heartfelt pranam to His Holiness Sri Shankara Vijayendra Saraswati Swamigal, respected Honorable Vice Chancellor Professor Dr. S.B. Raghavan sir, Honorable Registrar Professor Dr. Srinivasulu sir, respected Finance Officer Ramakrishnan sir, EC member of SCS BMB, Administrative Officer Mr. Sankaran Narayan sir, MC team member of Sri Jayendra Saraswati Ayurveda College, my dear colleagues, staff, and students friend, ladies and gentlemen. Today, we are all gathered here to celebrate Dhanvanthari Jayanthi. As all we know, Lord Dhanvanthari, who have brought this immortal science to this mundane world during Khirasagara Manthanam. Later, Lord Brahma transferred to Daksha Prajapati, followed by Lord Indra and other disciples of Ayurveda. Ayush department took initiation for celebration of Dhanvanthari Jayanti every year. In this year, nationwide, we are celebrating 5th Ayurveda Day with the theme Ayurveda for COVID-19 pandemic. In the eve of Dhanvanthari Jayanti, Ayurveda College and Hospital, Department of Ayurveda SCS BMB, with collaboration with Vishwa Parishad Tamil Nadu chapter, has celebrated Dhanvanthari Saptaha by keeping online webinar from 6/11/2020 to 12/11/2020, where renowned scholars of Ayurveda have gave their lecture. Student and other fraternity of Ayurveda also benefited out of it. On 6th, Dr. Banita has delivered lecture on integration of modern and Ayurvedic technique in female infertility. On 7th, Dr. Murthy has presented Rasayan in present era with special reference to its Madhya properties. On 9th, Raja Ravi Kiran has given the lecture on valuable gunshot remedies and tips from Rasasastra for Ayurvedic private practice. On 9th, Dr. Santi has delivered differential diagnosis and treatment protocols in treating of a Grahani IBS. 10th, Dr. P.K. Sahu, he has delivered lecture on dosage of hormomineral drugs in children and described in Ayurveda with a special reference to current pediatric practice. On 11th, Dr. Balamurugan, he has delivered variety of Pinda Taila mentioned in classics. On 12th, Professor Sripati Acharya, he has delivered the lecture Management of Cirrhosis of Liver in Ayurveda. In this occasion, I can share few points about this today's theme, Ayurveda for COVID-19 pandemic. As all we know that is a novel coronavirus is an infectious disease caused by newly discovered coronavirus, and most of the people infected with the COVID-19 and the COVID-19 virus experience mild to moderate respiratory illness and recovered without any special treatment. The only old people and those who are having other comorbid conditions like cardiovascular diseases, diabetic mellitus, respiratory diseases, cancers, they are likely to develop more serious illness. The latest research reveals 60% of people affected with the lung diseases, 29% people are suffering from kidney diseases, 26% people are suffering from heart diseases, 10% are from liver diseases. So if we see, the new research says that the people having O group, O type of a blood group, they are least contact with the coronavirus. And their risk of developing serious symptoms is minimal. And also it is noticed that the organ failure also very minimal in case of O type. At the same time, it has been noted that A and AB group didn't have a longer hospital stay, but they remain in ICU for more days. So in this regard, my personal opinion, I can say, as we know that there is a protein which is available in our body, or you can say in a RBC, that is a glycophorin A. So glycophorin A is responsible for dividation of the blood group or identification of the blood group. My personal opinion says that the type quality of the glycophorin A available for the blood group A is something different, which have more affinity towards the coronavirus. When coronavirus, which is a lipid base, and if you see the RBC, the outer and the inner layer is also lipid, middle layer is protein. So it is easier to adhere to the RBC, and they are breaking the RBC. Once RBC is getting broken, so heme and globin, that means the protein will be released. Because of the huge amount of protein is released, so what happened? There may be chances of kidney failure. And another thing, whenever the excessive amount of the RBC is broken, protein is released, and that lumpness will be available in the blood, they may block the minute channel where there may be chance of a heart attack. So if you see all the things, my personal opinion says only the fatal symptoms is available in case of blood group A and AB because of this thing. This is my personal opinion. And you know, in case of coronavirus patient or the COVID patient, most common symptoms what we are observing, that is fever, dry cough and tiredness. Very common. Very less common is body ache, body pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and sometimes we may see rashes in the skin. If we'll go for the serious problem, so difficulty in breathing, shortness of breath, chest pain, increase of blood pressure, loss of speech, or loss of movement. That is very rarely we are seeing. So it has been observed that 98% of the patient need not require any special treatment, no need to go to hospital. That can be managed in home itself. Only 2% of the patient requires special care and we have to admit in the hospital. And as you know, it is a very common, and WHO already have emphasis on that prevention aspect. That is we have to wash hand regularly with soap and water or alcohol based hand rub. Then we have to maintain the social distancing. Then avoid touching face, mouth, eye, nose without proper cleaning of the hand. Then we have to cover our mouth and nose while we are coughing or sneezing. We have to avoid smoking and other activities which can weaken the lungs. Always we have to practice physical distance by avoiding unnecessarily travel, and we have to stay away from the group. And as far as the management part is concerned in the COVID patient, so first and foremost treatment, that means management is we have to adopt Langhana therapy. As per my knowledge, we can say whenever we go for Langhana therapy, so there will be pacification of a besetted dosa and enhancement of Agni. Whatever the food will consume, it will be digested properly and there will be Dhatu Samyata. And Rogostu dosa Vaisamam, dosa Samyam Arogata. Rogostu dosa Vaisamam, dosa Samyam Arogata. Suppose if dosa is in homogeneous state, always you will be in healthy condition because automatically it will increase the immunity power. Then another one, regularly we can go for practice of gargling, either with the hot water or with the Triphala Kasayam. Whenever we will do that, coronavirus, chance of entering of a coronavirus to the body will be minimal. Then we can go for Nasya. Whenever we will take Nasya, always we will try to use Kottu Taila, which is having Kottu and Usna nature. Such type of Taila we can take as a Nasyam. My sincere request to all of you, if you don't have any type of a Taila with you, you can take Sarsapa Taila, you can take as a Nasyam. That is the best. The research says and the data says in West Bengal, people are less sufferer of COVID-19 because all the police people, they are using Sarsapa Tailam in their nostril and they are consuming Sarsapa Taila. So not a single, what I can say, policeman got affected with the COVID-19. That is the latest information. And we can provide different type of compounds, compound drugs or ecomolecular medicines which is available in our science, like Rasasindra we can give, Lakshmi Vilas Ras we can give, Tulasi, Trikotu, black pepper, Talisapatradi Churna, Syotajorari Churna, Chavanpras, Agastha Rasayana, then Godanti Vasma, Sringha Vasma, then Haridra Marichadi Layam. Like different type of drugs are available depending upon the situation and symptoms, condition of the patient, we can take it. So whenever we'll take all type of things which can improve the or boosting the immunity power, so that we'll be far from the corona patient. That means a virus. So these are the few points what I would like to share. Already I have shared. Then another thing I'm going to share with you people on behalf of a Vice Chancellor, Sir, EC committee member, MC committee of member of SJS SCH, I take the privilege to announce that Honorable Vice Chancellor, he has approved of Rs 4,000 rupees as stipend for PG scholar for non-clinical subject and 5,000 rupees for clinical subject like Kai Chikitsa, Panchakarma, Salya and Prasuti Tantra. So this is a good news. Already we got the approval and it is going to be implemented very soon. Thank you. Thank you all.
Thank you, sir. Now let us move on teachers' presentation. First, I invite Professor Dr. Pradeep Kumar Moharana, sir, to present paper.
Om Dhanvanthari Namaha. Respected principal, respected seniors, my dear colleagues and my juniors, and my dear students from PG faculty and UG faculty. So today I'm going to tell about what Ayurveda tells and what Ayurveda can do in relation to or in response to COVID-19. See, before going to tell about the COVID-19, I'm telling that this COVID-19 is not present in our Samhita, either Charaka, Susruta or Bhagavata. It is a contagious disease like the outbreak of Spanish flu in 1918 and the outbreak of coronavirus in December 2019. The difference is that the Spanish flu was limited and it was continued for 1.5 to 2 years. But we do not know when the coronavirus is going to end, whether there will be a vaccination or not. That is also a question mark. Whether there is a permanent remedy for coronavirus, that is also a question mark. But in relation to that, there are many theories, like there are some medicines, antiviral medicines, produced by the Pfizer, Ranbaxy and Glenmark. But to how much they are having efficacy, or the Ayurveda, the 5,000-year-old science, which can compete with the modern tablet or modern injections or not, that is also a question mark. Now, before going to tell you about the COVID-19, I'm going to share that there are two factors. One is virulence, another one is strain. So in virulence means it is the pathogen's ability to infect the host, and the strain means it is a subtype of the particular organism. So how much? See, in the beginning, the strain was Wuhan strain because it was outbreak from Wuhan. But later, it became Tamil Nadu, it became Orissa, it became Kerala. Different strains have come. Now the thing is that which strain is more harmful and which strain is less harmful? Nobody knows. Whether the drug is having a role in the management of COVID-19, yes or not, or whether the immunity is acting itself and the persons are getting relief from COVID-19, that is also a question mark. See, next. This is the exact picture of the coronavirus because different spikes will be there. That's why it is called as coronavirus. Okay, next. Okay. So before I'm telling you the 2019 outbreak of coronavirus, there are 4 strains, particularly the beta coronavirus, delta coronavirus, gamma coronavirus, and alpha coronavirus, which was reported early. But the first case of coronavirus, particularly in the birds and mammals, it was reported in a journal called as Nature in 1968. So the first case of the human infection was reported in 1968 by 2 scientists, and later it was published in the one of the best journal, that is called as the Nature. Okay. Next. See, I'm telling you yesterday data. The total coronavirus cases in India is about 86,84,039. Out of that, the death has occurred 1,28,165, and recovered is about 92 to 93%. See, when particularly in the March, in the lockdown started in the March 24th and 25th, the first case was reported in Kerala, that is in December or January last week. Okay, then slowly it is spread to other areas. Next. Okay. So what exactly it does? See, the majority of the viral infections, they will be affecting mostly 2 or 3. That is, the first one is respiratory system, the second one is GI system, and the next one is the nervous system. These 3. So you see, those particularly with coronavirus are dying due to the lung infection. And sometimes there is a chances of myocardial infarction, and sometimes there are chances of intravascular coagulation and DIVC, disseminated intravascular coagulation, and the death occurs. So that's why the exact cause of death nobody knows. The exact medicine which can act for COVID-19 nobody knows. The exact pathogenesis, how it happens. Now we are wearing the mask. Whether this mask is protecting or not, that is also a question mark. See, I am telling you, in the month of June, when the government of India announced only flight occupancy will be 50%, but exactly after 1 month, they have allowed. Means what? Means they thought that this social distancing will be having a major role, but I don't think this social distance. It is the particular, the immunity of the person that is only standing. I am telling you, this mask we are, because everybody is wearing, we are also subject to wear, and we have to wear, because otherwise if you are affected, then you will be telling you are not using mask, that's why you are affected. Okay. So there are a number of factors are there. Still it is not clear. Nobody knows what exactly how it does. So it will take a minimum another 3 to 4 years to come to a conclusion how it happens, how what is the best medicine. But when you compare from Ayurveda point of view, it is particularly the Susruta Nidhanasthana Kushtha chapter, that is 5th chapter, the sloka number 33 and 34. That is Prasangat Gatra Sansparsat Nishwasat Sahabhajana Sahasayasana Chabi Vastramalya Anulepanat Kushtha Jvarastha Sosatsa Netrabi Sandhyavacha Upasargya Rogas. So the word Upasargya Roga was mentioned only in the Susruta Nidhanasthana Kushtha chapter. Okay. When you come to the Charaka Samhita, there are particularly in the Vivida Sita Vidya, there are 28th chapter, there are 2 slokas. Vyadi Kshamottama Nama Vyadi Vala Virodhitam Vyadi Utpadak Pratibandhagatvam iti jabat. Another one, Nacha Sarvani Sarirani Vyadi Kshamotte Samarthani Bhavanti. Another one, that is Samamansa Pramanastu Samasangano Naraha Drudendriya Vikaranam Balena Vivyoda Kit Pipasa Atapasa Sita Vyam Sansa Samapakta Samajara Samamansa Chayamataha. So like that. So there are different slokas, but whether this the Charaka in Charaka Samhita, in particularly in the Vivida Sita Vidya, there are 2 types of body they have mentioned. One is Vyadhi Saha, another one is Vyadhi Asaha. Okay, so which can withstand with the bacteria or viral infection, that is called Vyadhi Saha Purusa. Vyadhi Asaha means those will be producing symptoms and those will be manifesting symptoms. They are called as Vyadhi Asaha Purusa. Next. So this everybody knows the symptoms and other things. The transmission and the incubation period is 2 to 14 days. Next. Okay. See, this is very important. I am telling you, about 80% of the people recover from the disease without any treatment also. Only 2 to 3% will be, 2 to 3% of the patients will be requiring the hospitalization. And out of that, 1% definitely it will be going to ICU, and out of that, there will be 0.5 to 0.7% deaths occur. Next. Okay. So this is what is the reference from Charaka Chikitsa 28 chapter. Vyadhi Saha and Vyadhi Asaha. That is Sarirani cha ati sthula, ati krusanyan, Vishtamansa Sunita Astini Durbalani, Satmya Ahara Chittani, Alpani, Alpa Sattva, Bhavanti Vyadhi Sahani, Viparitani Punar Vyadhi Sahani. Next. This is very important. Antibiotics, because it is a virus. Okay, so virus does not have its own life cycle. It requires a host. So whatever the medicines we are giving, whether it is virucidal or virostatic, nobody knows. Okay, and how it is acting also nobody knows. Because the antibiotics particularly which is acting against the bacteria, that is either it is a bactericidal or it should be a bacteriostatic. So whenever you are treating for coronavirus, it should be a virucidal or virostatic. Okay. Next. Next. Okay. So these are the, you can divide the whole corona patients into 4 groups. Those who are having asymptomatic, you can do with some normal medicines like Chabanpras, Brahmarasayana, Amruta Balataka. And those who are asymptomatic, particularly the Sanjeevani Vati, Chitrakadi Vati. Next one. With mild COVID-19 symptoms can be treated with Pipali Rasayana, Talisadi, Yasti, Madi, Sitobaladi. But moderate to severe COVID-19 symptoms, you require a definite line of treatment, that is Lago Basanta Malati, Sanjeevani Vati, Trivivana Kirtirasa, Bruhotavata Jintamani, Mrutyunjaya, Siddha Makardhaja. So these are the medicines. See, I'm telling you, knowingly or unknowingly, I have come across with 4 COVID-19 patients. Okay, in this last 5-7 months, unknowingly or unknowingly. What I have given, I told the 3 things. You take sufficient amount of food, sufficient sleep, and don't take any diet which will cause you disturbance in the GI tract. Okay, and remember, the immunity cannot be boosted or immunity cannot be improved within a fortnight. Okay, so whatever the things you are going to give, it has to act for a longer time. So if the person who are particularly the immunity wise he was okay, means definitely he can come back. Okay, next. Next. Already. Next. So this is, I'm very much thankful to the organizers for giving an opportunity to share my views. And today I'm standing before you on the 5th National Ayurveda Day. And this is the theme for this is COVID-19 and Ayurveda treatment. So I'm very much thankful to all of you. Thank you.
Thank you, sir. Now, I request Dr. Sriman Narayanan, sir, to present his paper.
Namaskaram to all, and Shri Gurubhyo Namaha. So on behalf of Dhanvanthari Jayanthi, I wish everybody happy and safe and a healthy, happy Dhanvanthari Jayanthi. So I would like to thank the organizers and the principal for giving me this opportunity. So today I would like to talk on mental health and COVID-19, impact of mental health on COVID-19. So everybody are using phones. So when we call our dear ones, first we listen to one caller tune. Can you just go to the first slide? We have to fight with the disease, not with the person who is suffering from COVID-19. It's very important. So we see our neighbors, when we see the banner outside the home, we try to stay away from them. We don't even try to communicate with them. So that kind of discrimination is there in the society right now. Okay, so that discrimination will have an impact on the mind also. Okay, people are in fear. So when the lockdown came, many people were doing hoarding, like they're stocking all the groceries, essentials. They were running to all the supermarkets, keeping all the items for their family. So many people were worried because they were unable to move to their native places. So that all these are creating some kind of a disequilibrium. Okay. Next. So this is the impact what we have because of a pandemic. So people get anxious, people develop depression, people develop stress, people develop insomnia, people develop even suicidal tendencies. The total death, what we are seeing right now, it is very less when compared to a death reported due to suicide, because this is, the statistics are a bit misleading.
Okay, the death what we are seeing right now is not the actual numbers, but the mental illness has a greater toll on the present society. So the statistics says almost 88% people suffer with anxiety. That is COVID related anxiety. Okay, and then job loss. That's very common right now. Because of losing job, many people even end their life. Many companies lay off. They don't pay the salaries. So that causes lots of stress in the employee. Okay. Next slide. So when we see the global scenario, almost 13.7% of mental illness, people suffer with mental illness in India alone. Okay. And there was a recent study conducted after this COVID-19 with people with serious mental illness. On 139 patients, they had carried out the study, and in that almost 40% of the patient never knew that the present pandemic is in place. It means that people are not aware that the pandemic situation is happening right now. Okay, so people get less connectivity with the psychiatrists, primary physicians. That is also there. So what people say, they go for telepsychiatry. They are not able to meet their primary physician. So that is also a problem right now. So the awareness about mental illness is slowly picking up. So this year's mental health theme for 2020 is increase the infrastructure and investment in mental health. Okay. So next slide, fast. Yes. Coming to the Ayurvedic part, so Manasika Swastha is very important. So we have to adopt all the Yama Niyamas, follow the yogic practices, and bring in self control. That is very important. So we are not, whatever we do, we have created this virus, so we have to pay the price for that. So we need to develop resilience. So we need to be calm, and we need to be united. We need to follow the protocols laid by the government, and together we can win the disease. And we have to follow the dinacharya. That is very important. So everybody complain we don't have time. Now we have sufficient time to do our daily works. So let's develop that attitude of taking care of self. Many people neglect the self. It's very important. And respecting the elders, that is very important. Okay. In Achar Rasayana, we need to pay. It's about social health. Social well-being is also very important, because humans are social animals. So social health is very important. Next slide. Yes. This is for prevention. A person who is indulging in Nitya Hitahara Vihara Sevi, that is, who indulges in wholesome diet, will never succumb to any type of mental illness. And who develops passion and is very compassionate and who is polite will never suffer from any sort of mental illness. And we know this particular pandemic is because of Prajnaparada. Okay. Prajnaparada is the resultant of all the sufferings. So that is the major cause which we need to be preventing. Next slide. Yes. When you talk about well-being, we know about physical well-being, mental well-being. So we have other aspects like emotional well-being, sensory well-being, and digital well-being. Digital well-being is very important. So when we are increasing our on-screen time, that also leads to lots of psychological problems. I get patients, I get usually students who are using the social media for a long time, and they're getting some kind of depression. They're getting into depression because of too much of on-screen time. Okay. So digital well-being and spiritual well-being I want to highlight here. So spiritual well-being, there is one recent study. If we indulge in weekly, if we indulge at least once in a week, if we indulge in some kind of spiritual activity, our lifespan increases by 7 years. Okay, that is the power of spirituality. So in spirituality, when we can talk about the mantra chikitsa and the mass prayers that has an impact on the well-being of the people. Sensory health. To take care of the sensory health, we need to take care of all the five senses. For eyes, we can use the Netra Kriya Kalpas. For nose, Nasya. For ear, Karnapurna. And for tongue, we can use the Kavala Gandusha. And for skin, daily Abhyanga is useful. Next. Physical exercise is a very good antidepressant. So the Harvard mental health letter says it is helpful, inexpensive, and insufficiently used treatment for variety of psychiatric disorders. So we need to adapt exercise in our daily routine. That is very, very important in the present pandemic. Next. So these are the do's and don'ts. Like the more we think positive, so we'll attract more positiveness. So let's spread happiness and love, and let's stop spreading rumors, and let's spend more time with the family members, and together we will win this disease. Next. I thank the principal and the AO sir for giving me this opportunity, and all the senior faculties for patiently listening to my speech. Thank you. Yeah.
Thank you, sir. Now I request Dr. Hariom Sri sir to deliver speech.
Hello. Namami Dhanvanthari Madidevam Surasurir Vandita Pada Padmam Loke Jara Rugbhaya Mrityunasham Dhatarimisham Vividaushadina. Namaste to all. Respected Principal Sir, dear faculty members of Sri Jayendra Saraswati Ayurveda College, my dear internees and students, and all those who have gathered here for this wonderful occasion of the 5th National Ayurveda Day, and also been celebrated as the Sri Dhanvanthari Jayanthi. So on this occasion, I would like to start my speech. So before that, I would like to say that it's really an immense pleasure to get the blessings from His Holiness Sri Shankara Vijayendra Saraswati Swamigal, and also get a special address from our Honorable Vice Chancellor of Sri Chandrasekharendra Saraswati Vishwa Mahavidyalaya, Dr. S.V. Raghavan sir, and also get a wonderful speech by our special guest, Dr. Somit Kumar sir, the research founder of AVP. So herein, I'm gonna share my personal experience of treating the COVID-19 cases, and also would like to share some of my points which I have taken, and on behalf of which I have treated the patients by renowned Ayurvedic physician across India. So on introductory part, I guess everybody would have got an introduction of COVID-19. So it is a family of viruses that is SARS-CoV-2. That is the severe acute respiratory syndrome, coronavirus 2. And this is commonly called as the COVID-19. That is the coronavirus disease 2019. It is a pandemic, which means a disease that affects a large number of population, crossing the international boundaries, considered to be comparable in Ayurveda as Janapada Dhvamsam. So symptoms of COVID-19, as we all know that, like fever, sore throat, dry cough, breathlessness, body ache, then in some condition like loss of taste and diarrhea also can be seen. So based on the common symptoms, the COVID-19 can be categorized as, in Ayurveda, as a Kapha Vata Jwaram or Vata Kapha Jwaram. Based on the Avastha, it varies between the two forms of cases based on its observation. Both Vata and Kapha being Shita in nature, so it is seen that the treatment should be done as Ushna or hot in potency by the nature of drugs which we are going to give them. As Agni is hampered in this condition, the first line of treatment is to restore the activity of Agni. So the aims of management of COVID-19. So first one is the breaking the chain. That is the social distancing, which we all know right now, which we are doing. Followed by the enhancing the body immunity for individual. So by giving in Ayurvedic perspective, we can say that as giving the Rasayana Dravya, etc. Then identifying the infection. So which sort of infection it has caused, on which the system which was affected. And also timely medicated. So at right time, the medication should be given. So in the prevention aspect, what we can do? Starting by Dinacharya. So that is the daily regimen. Then Ritucharya. Based on the seasonal conditions, we can give appropriate medicines. Then comes Roganutpadaniya, followed by the Rasayana. Then Ojas. So Vyadhi Shamatvam, that should be seen. So we have to increase the Ojas of the patient. So that is done by two procedures. That is Vyadhi Bala Virodhitvam. That is to fight the disease. And secondly is the Vyadhi Utpadaka Pratibandhatvam. That is to prevent the entry of disease into the body. The general measures, I guess everybody would have known that, like be hygienic, wash hands, etc. Avoid handshake and contact, wearing of masks and gloves, etc. And especially we have to see that the that is ear, nose, and eyes should be avoided with any sort of touching. So then next goes to the diet. So it should be taken as Lagu Bhojanam and avoiding of Guru, Madura, and Ati Amla and Ati Katu Dravyas. Intake of Ushna Jala Sevanam. Then foods containing like Shigru, Karavela, Patola, Kapita, Dadima, Leshuna, etc. can be taken. Then need to have adequate amount of sleep, which is the major thing. Now getting into the Dinacharya aspect. So Dinacharya, as we all know that, Brahma Muhurte Uttishtet. That is the first main concept. Then Gandusham. So Gandusham with coconut oil daily can be done. So it will enable the prevention of entry of viruses into the body. So next followed by the Kavalam with any of the drugs like Triphala, Haridra, Sandava, Shuddha Tankana, and also honey with water can be done. There is a shloka in Ashtangardhya for lubrication, that is Anutailam Tato Nasyam Tato Gandusha Dharanam. So this is one of the main concept of prevention of entry of diseases to through any of the ear, nose, etc. Way. And Nasyam with Anutailam. So that is Pratimasha Nasyam. Instead of Anutailam, we can also give like coconut oil, etc. Then Abhyangam, one of the main concept, that is Shiraha Shravana Padeshu Tam Visheshena Shilet. So in that, Acharya Vagbhata has also mainly said that Shiraha Shravana. So that is the entry of any sort of viruses through ear or any sort of through any part of the head, etc. So can be avoided by using the Abhyangam. Then Dhupana with Aparaja Dhuma. So that is one of the important drugs. Then for immunity enhancing, we can do like Chavanaprasha, Draksha Avaleha, Indukanta Grida, Aravinda Asavam, Haridra Khandam, Agastya Rasayanam, Kushmanda Rasayanam, etc. Then as per Ayush protocol, the single drugs which will enable the Dhatu Poshana and also as a boost the immunity like Guduchi, Amla, Ashwagandha, Tulasi, Haridra, etc. Then now getting into the based on common symptom wise. So I'll just represent with few of the cases. So along with the symptoms which were seen. So like one of the common symptoms is rhinorrhea, that is the Pratishaya. So as per Ayush protocol, the medicines that can be given or the treatment basis like Haridra Khanda can be given, followed by the Lakshmi Lasras, Thalisadi Vataka. Then there is one Dhumapana, that is the Shatavadi Dhumapana, or can be done as Rasnadi Dhumapana if Shatavadi is not available. Then one Rasayana is that, Pipili Rasayana. In that, you can see in Charaka Chikitsa, Pipili Rasayana has been taken as Traikarika Pipili Rasayana. That is, Pipili Churna Bhavana with ghee given thrice, that is 2 grams with ghee can be taken. Then in Nasa Anaha, that is nasal congestion cases. So Indukanta Gridam is one of the effective one, followed by Dhumapana with Rasnadi or Shatavadi. Then Shirovasti in chronic cases can be done, like with the application of Balatailam, etc. Then Nasya, which in Nasya we can manage with the any sort of Vata Prakopa condition in nasal congestion. So in that we can give like Shirabala 101, which cures congestion of treatment by in Vata condition. Then the next main thing is the smell affliction, that is the Agrahatva. That is the loss of smell. So to be treated in line of Apinasa or Dushta Pinasa condition. So there is this shloka from Sushruta Uttarasthanam, Nishwasa Uchwasa, Dorgandhya Tadha, Gandhana Na Veticha. So in that line of treatment that can be given is started from Snehapana, that is like given in the Indukanda Girdam. Then followed by the Swedanam. Then steam inhalation, which is done. So in steam inhalation, we can see that along with Haridra, the Haridra and Sendava in water can be given together and do it as a steam. And in this steam inhalation, we can take it as, so the inhalation through nose and exhalation through nose, that can be done as 10 times. Inhalation through nose and exhalation through mouth, again 10 times. Then inhalation through mouth and exhalation through mouth. So again 10 times. So this 30 times if taken daily will have a good effect. Followed by Chardana and Shramsana, that is Vamana Virechana in severe cases. Then Tikshna, Laghu food can be given. Only if the patient feels hungry can be taken with Laghu Bhojanam. The next condition is the sore throat, or we can also say that Swara Sada in that condition, like Dhumapana with Panchangi Dhumavarti. So that is one reference. So and Panchangi Dhumavarti, the ingredients like Ingudi, Kinihi, Danti, Surala, Suradaru, etc. can be taken. But some of the ingredients may not be available. So instead of Panchangi Dhumavarti, we can give with Rasnadi Churna as Dhumavarti. Then Gandusha with Trifla Kashayam or Fanta of Yashti Madhu. Then Vyoshadi Vadakam. Then Khadradi or Lavangadi Vati can be taken. Then Tambula Swarasam can be taken after the food intake. Then there is one reference of in Ashtanga Hridayam, that is Yashti Madhura Payasam, which will have a good effect. That is, it is actually a processing of Yashti Madhu with milk along with any sort of Madhura Rasa. So that is considered to be the Yashti Madhura Payasam. So that have a good effect on any sort of sore throat condition. Next, of any sort of respiratory distress along with fever, which is commonly seen, like we can give like Elaganadi Kashayam or Amrutotra Kashayam. Then along with that, Karpuradi Tailam for external application. Then Talisadi Churna or Trikatu Churnam. Then Amrtarishtam. Then there is one severe condition, that is headache, which is commonly seen in COVID cases, which we can see in the initial state. So Shirashulam, so which will be mostly of Vata Vikara in COVID-19 cases. So in that condition, we can give it Devadarvadi Kashayam or Dashmula Katatra Kashayam. If the patient is not diabetic, the Dashmula Katatra Kashayam can be given along with Makshika, that is honey. Then Godanti Basma with honey, ghee or hot milk can be taken. Then Asana Vilvadi Tailam, it is one of the important formulation in headache and all. As the Falashruti of Asana Vilvadi Tailam is Nayana Karna Shiro Hitam Uttamam. As it is not only mentioned in Shiro Roga, it is also mentioned in Nayana Karna Shiro Hitam Uttam. Then Shadbindu Tailam, which will commonly have a good effect in Nasya, along with Shirabala 101. Then Rasnadi or Kachoradi Lepa Churna can be applied along with milk or hot water. Then Patyaksha Dhatradi Kashan can also be taken internally. And in rare conditions, there is the symptoms of conjunctivitis. In that, we can give this Elanir Kornba for external application also. So with this, I would like to conclude my speech. So as there is no longer duration in it. So the clinical exposure which I got is based on the many research articles which I have gone through, and many of the cases based on my own personal experience, I have done all these cases. So it has given a good result as well. So and in this occasion of Ayurveda Day, we should all take a pledge that to make Ayurveda an integral part of my daily life and thereby enable good health and well-being for myself, my family, my community in harmony with nature. So thanking you all for this wonderful occasion of Sri Dhanvanthari Jayanthi, and to gather here along with the family of Sri Jayendra Saraswati Ayurveda College. Jai Ayurveda, Jai Dhanvanthari. Namaste.
Thank you, sir. Now I request Dr. Industry Madam to deliver paper.
Good afternoon, one and all. Om Gurubhyo Namaha. Om Namo Bhagavate Vasudevaya Dhanvantraya Namaha. So, today's presenting topic is Samprapti or for COVID-19. So, this is a concept review topic. So, this may have many lacunas in it. I would like to thank the principal sir and the organizers for giving me this opportunity on this dais. Continuing with this topic, I will jump start to the main point itself. Okay. Now let's see a review on bioscience showing the etiopathogenesis of the COVID-19, where you can see the main culprit is the coronavirus, which is also called as the severe acute respiratory syndrome coronavirus 2. So what happens is that the coronavirus has a special type of surface glycoprotein, which is also called as spike, which attaches to an enzyme called as angiotensin converting enzyme 2. So this enzyme is present in most of the organs, that is on top of the or surface of the alveoli type 2 in our lungs. Then we have the same enzymes on top of the cells of arteries, neurons, heart, kidney and intestine. So what happens is that once it attaches to the cells, that is the host cells, it starts a reaction called as a special or systemic hyperinflammation. Now this inflammation leads to many systemic diseases and ultimately leading to multi-organ failure. Next slide. So based on Ayurvedic science, we are going in a different direction. So we observe the lakshanas first and then we conclude what is happening inside our body. So when you review the lakshanas, I've taken a case study from February 20th, which included 55,000 cases. So from this study, we can see that 98% of the case occupants or the patients had a fever as a main symptom. Or jwara, and the remaining symptoms included kasa, glani, angamarda, shwasa, kandashosha, shirograha, shita, vami, shavadu, pradishyaya and aruji. So remember these symptoms. So coming to the samprapti, you have seen that 98% of the patients showed jwara as the main symptom. So it is clinically, we can adopt the samprapti of the jwara itself. So if you take the Jwara Samprapti, first comes the Nidana, then which leads to the Dosha Prakopa, which settles inside the Amashaya, causing Ama, which obstructs the Rasa Vahat Srotas, which again suppress and dislodges the Jadrakni from its sthana, sthana being the Grahani. The suppressed and dislodged Jadrakni further is driven into the extremities by the Srotas, to spread throughout the body. In meantime, it is causing jwalana, that is obstruction to the parts which is touched by it. Next. So we will see the Samprapti Kadaga one by one. First the Nidana. Here it is a coronavirus. So we can safely say it is as the Agantuja Nidana, which is the type known as the Abhishanga Nidana. When we take the Purva Rupa, since it is an Agantuja Nidana, usually the manifestation of disease is very fast. So the appreciation of the Purva Rupa is not much there. So next coming to the Rupa, since it is an Agantuja Vyadhi, the simultaneous visheshan of the Tridosha is occurring. So it is a Sannipadacha type. And this Sannipadacha type, when it is not properly treated, it will lead to many complications. Next slide. So coming to the doshas, individual doshas, when we consider Vayu, we can see there is a visheshan of a prana, udana and vyana Vayu. When we take the pitta, there is visheshan of the sadhaka pitta and pachaka pitta. And the main role of a vitiated pitta is to create or cause santapa, which is nothing but the jwara. Next, kapha. Kapha is the avalambaka kapha. This is all chosen because the Vyakti sthana of the main disease is in the urasthana, and the kapha mainly causes the rodha of the various channels. Now, since this is Sannipadaja, next, Sannipadaja, Avarna concept can be adopted here. So, if you consider the Avarna, here we can see mainly the Pranavayu is affected. So, the Pranavayu gets occluded by the vitiated kapha, which produces symptoms such as Sada, Sandra, Aruji, Vami, Stivana, Shavadu, Nishwasa, Uchwasa, Sangraha. So these symptoms you can correlate with the symptoms I've already shown in the other slide. So next is Avarna by the Pranavayu on the Udanavayu, where we can see symptoms such as Pradishyaya, Shirograha, Hridroga, Mukashosha. These are all symptoms which is occurring. Next is the Pranavayu again, occluding the Jnanavayu, where we can see the symptoms that is Sarvendriya Shunyatva, loss of sensation. Next. If you take the dhatu, the main dhatu which is affected is the Rasavaha dhatu. Rasadhatu. So the symptoms of a Rasa Pradoshaja Vyadhi can be adopted here. That is the Ashraddha, Aruji, Asya Vairasyam, Arasatnyada, then Jwarastamaha. That is the main symptom is Jwara itself. And furthermore, it will lead to the Pandutvam of the Shariram. The malas which is affected is the Shweta and the Purisha. The srotas mainly affected is the Pranavaha srotas, which creates symptoms such as the Adisrishtam, Adibalam, Kubidam, Alpalpam, Abhikshanam, and Sa Shabdam and Shulam of the Shwasa. Again, Rasava srotas is also becoming vitiated here. Next, the complications which is arising in this disease, according to bioscience, they have told it as a multi-system failure is considered. So both the tracts, that is the upper respiratory tract and the lower respiratory tract, then CNS, that is the central nervous system, the GI tract, gastrointestinal tract, the cardiovascular system, and the renal system. So there is a multifactorial system failure is there. So according to them, the emergency symptoms, that is needing emergency treatment, includes symptoms such as breathing difficulties, persistent chest pain, sudden confusion, difficulty in walking, bluish face and lips. So the symptoms which ultimately lead to the death of the patients include pneumonia, acute respiratory distress syndrome, sepsis, septic shock, and kidney failure. Now coming to Ayurvedic part, the Upadrava Vyadhis, which is created due to untreated Avarna condition, leads to Hridroga, Vidradi, Pliha, Gulma, and Adhisara, ultimately leading to the Karma, Ojo, Bala, Varna, Nasha, and leading to Mrityu. So this was a small concept review topic. I hope you have got something from here. Thank you again. Thank you for the dais, sir.
Thank you, ma'am. Now I request Professor Dr. G.R.R. Chakravarti sir to speak few words.
Sabhaya Namaha. Principal sir, my elders, my colleagues, and my dear students, internees. I stood before you to share my experience regarding the treatment of COVID-19 because I myself had COVID-19 in the month of August. So myself and my family members, in the span of around 40 days, all the family members had been affected with COVID-19. And we had an understanding. Now, myself, my Mrs. Aish doctor, my son, here only he was the student, Sai, and we came to a conclusion and we started treatment with Trikatu and Rajani Churnam. And side by side, Amruta Arishta with Pepal Yasava. What is the ratification? Trikatu and Rajani will definitely cure the Amavastha. Pipal Yasava not only for GIT, it will take care of respiratory system also. Kafasthana. First of all, we have understood that COVID-19 is the Kapavata Jwara. But a standard protocol, it is very difficult to stick on. Basing upon the lifestyle of the person and food habits and other things may influence the health. We have treated around 20 families. Each family 4 to 5 members, around 20 families we have treated, stamped COVID-19, proved positive, only with Ayurvedic medicines. That is my experience, and I am very confident that we can cure COVID-19, but I cannot say without any scientific evidence. In the sense, so-called scientific evidence, they have got some other protocol which may not be suitable for our Ayurvedic principles. Some other adjuvant medicines I have used, Tiktarasa Pradhana Dravyas like Nimba, Bhunimba, Swarshya Chiraita, that is Mahatiktaka, and such other drugs, extract has been also given. Observing day to day symptomatology and other signs. Some people had fever for about 20 days. Some people only 7 days fever. On 4th day, some people had got relieved of fever. But various manifestations are there. So in this scenario, I had experience with the various different manifestations of COVID-19 without using not even a paracetamol. Without using not even a paracetamol tablet. So this is my observation, and if scientific background we produce, we can establish, but it is not possible to have a definite protocol. This is the line of medicine, or these are the package of medicine. Like that we cannot stick on. Why? Because variability is there. Purusham Vikshya. Definitely it will hold a good. We have seen a person having chest CT scoring around 11. Scoring 11, by seeing that pulmonologist will say immediately you join in the hospital, in corporate hospitals and other things. Very safely he came out of the state. So this was my experience. If you know it for certain Ayurvedic principles, we can do the things, but provided our own principles are to be followed. Thank you very much for giving me this opportunity, for the organizers. Thank you very much.
Thank you, sir. I thank all our teachers for giving valuable information with us. With this, we are concluding our first session of today's celebration. The second section comprising the paper presentation competition for PG scholars of our college. It will continue after lunch break. I request all you to have lunch which kept outside. And everyone please come by 2 o'clock. Thank you. Hello. Hello. Namaste. Good afternoon to 100 present here. Now we are moving to the second session of Sri Dhanvanthari Jayanthi. Here we are going to the paper presentation competition by PG scholars. I'll call the judges. I request Dr. Reddy sir. I request Dr. Raut sir, and I request Dr. Rana sir for the judgment.
Check, check. Hello. Check.
Here, from 5 departments, candidates are participating. For each department, 15 minutes are allowed. Now, first I call Department of Kaya Chikitsa.
Namaste to one and all present here. Thanks to the institution and principal, sir, for giving such an opportunity to make a presentation on this eve of Dhanvanthari Jayanti. So I'm going to do my presentation on the topic Ayurveda in COVID-19. So here is the introduction about the COVID-19. That is, the coronavirus, a large family of virus that causes illness ranging from common cold even to the severe illness. It can cause due to either MERS coronavirus, that is the Middle East Respiratory Syndrome coronavirus, or either severe acute respiratory syndrome coronavirus. In Latin, the word corona means crown. That's why the disease got named as coronavirus. The coronavirus are zoonotic in nature. That means they get transmitted between the animals and the human beings. International Committee on Taxonomy of Virus have announced the SARS coronavirus 2 as a new virus on 11th February 2020. COVID-19 is a new strain of coronavirus which got first emerged in the seafood market of Wuhan city in China in the late 2019. The disease has now spread to more than 214 countries worldwide. WHO, under international health regulations, has declared this outbreak as an public health emergency of international concern on 30th January 2020. Subsequently, the WHO has declared COVID-19 as a pandemic on 11th March 2020. The incubation period of this disease can vary from 2 to 14 days. Now let us see how this virus affects our body. As we all know, the virus start entering to our body either through nose, eyes or mouth. It travels down from the upper respiratory tract to the lungs and then alveoli. Here in this picture, when we see about the healthy alveoli, we can see there is a capillary wall inside which red blood cells are present. There are two types of alveolar cells, that is type 1 and type 2. Also, the surfactant are empty. Here, the normal gaseous exchange take place. When the alveoli get infected by the SARS-CoV-2 virus, the virus has a structure like spike protein. That's why it's got the name as corona. There is an envelope protein membrane protein, and nucleoplasmid. Then in the moderate infection, we can see that vasodilation starts occurring, due to which there is increase in the permeability. Macrophages starts growing, inflammatory signals are seen, and due to which the surfactant get reduced and the type 2 alveolar cells get infected. Here there is reduction in the gaseous exchange, and in the severe cases, the fluid gets completely filled. There is debris of protein and cellular. Formation of scar tissues can be seen, and the surfactant gets fully lost. So here the hindrance of gaseous exchange take place. Next, when we come across the symptom of coronavirus, initially we can see dry cough, fever, and then followed by muscle or body aches, vomiting or diarrhea, or loss of taste and smell. Modes of transmission from the infected individual, either it can transmit through the droplets, that is through airborne. The droplets can transfer either through direct contact or indirect contact, that is via the touching of the surface. In Ayurveda classics, Acharya Charaka has already narrated about this concept about the pandemic in Janapadodvamsha. Here, Janapada means large population and Udvamsha means destruction. So the cause factor, adharma, pragya, pradha, it's caused the contribution to the destruction of principles of nature, that is Vayu, Jala and Desha. Hence, the factor of Janapadodvamsha are similar to that we have seen in COVID pandemic. It can also be grouped under the class of Agantuja Jwara, where we can see Bhuta Abhisangaja, which is mentioned in the Jwara Adhyaya. Acharya Sushruta has also mentioned about the Apasargika Vyadhi in his context, which is similar to the concept of COVID. That is Prasangat, Gatra Sparshat, Vastra, Sa Bhojanat, Sa Shayyat, Sa Asanat, Malya and Lepa. Here when we see the Samprapti, due to the adharma which is followed by the people, it causes Vaigunya of Vayu, Jala, Desha and Ritu. due to which there is Vaishamya of Shita, Ushna, Varsha, Ritu. And also due to which the dosha Vaishamyam in human beings takes place, mainly the Vata Kapha, which leads to Ojokshaya. It causes either due to Ahara, Vihara or Ritu vitiation. And here, due to Vaigunya of Aushadhi, there is Ojokshaya. Agnimandya takes place and formation of ama is there, which leads to the development of rogam like COVID-19. When we see from Ayurveda perspective, according to the symptom, we can classify it as under, we can correlate with the Vata Kapha dominant Sanipata Jwara. Here, when we see the symptoms from Sanipata Jwara and symptoms of COVID-19, which can be made similar, like here, Sheetakam, Alasyam, Tandra, Parvanak Ruk, Shirograha, Pratishyaya, Kasa, Shveda Pravartanam, Santapa Madhyavega, Aruchi, Shwasa Kashtata is there. And here in modern symptoms also they have correlated same. When we go through the preventive protocol, wearing face masks in heavily crowded places, while coughing or sneezing, we should use tissues or cover our mouth. We should frequently wash our hands with soap. Direct contact we should avoid with eyes, nose or mouth. We have to avoid shaking hands and avoid close contact with the infected person. And Ministry of Ayush has also mentioned a preventive protocol like Nasyam, either by sesame oil or coconut oil in both the nostrils. That is Pratimarsha Nasyam. Second, they have mentioned about Gandusha. With 1 tablespoon of sesame or coconut oil, this can be done once or twice in a day. Third, they have mentioned about the steam inhalation with fresh mint leaves or ajwain once in a day. And lastly, lavanga churnam with honey can be taken 3 times a day. These are the home remedies mentioned by the Ministry of Ayush, which can be followed. The preventive medications and measures which can be used are like Chavanprasha Legium, Agastya Rasayanam, Guduchi Sattva, Lakshmi Vilasaras, Shitopaladi Churnam, Haridra Kandam. And the measures which we can follow are Dinacharya, Ratricharya, Ritucharya, Shadvritam, Ashtavida Ahara Visheshayatanam, and also Nidana Parivarjana, which is the main important thing. When we go through the management, mainly Vata Kapha Sanipata Jwara is considered. So, in mild illness, we can give Vyagradi Kashayam, Sudarshana Churna Kalpam, Trikatu Churnam, Amrita Arishtam, Tribhuna Kirtiras, Sanjeevni Vati. In moderate illness, the same medication can be increased with the dose. Severe illness, Dashamula Katutraya Kashayam, Sudarshana Churna Kalpam, Amrita Arishtam, Swasakuta Ras, Jayamangala Ras can be given. What are the do's and don'ts we have to follow? Based on the Amavastha, diet management should be done. If there is no Agni, better to go with the Langana therapy. After the person gains mild or moderate Agni, Kanji, Yavagu should be given. Once the patient regain normal Agni, normal diet without oil and spice food can be given. To pacify Vata dosha, intake of Snehanam can be done with Pachana Deepana Dravya like ginger by examining the Amavastha and Agni. Panchakola can be added and boiled with the water which can be used as paniyam. Shadanga paniyam can be given to the pitta predominant persons. We should avoid Guru Shita Ruksha Ahara, Viruddha Ahara, Ati Vyayama, Diva Swapnam, Snanam and Shita Jalapanam. Thank you.
Hello, check. What is the significance of Vata Kapha Jwara in corona?
I have correlated with the symptoms, sir. The 13 types of Sannipata Jwara, in that
Is it same? The corona and Vata Kapha Jwara both are same?
not same, but the symptoms more or less we can correlate. Not all the symptoms.
But you have not told anything about immunity aspect. Okay, thank you.
Thank you, sir.
Thank you. Now I call from Department of Prasudi Tandra Eva Striroga.
Om Dhanvanthari Namaga. A warm good afternoon to one and all present here. Myself K. Tilagavadi, Department of Prasudhyana and Sri Roga, first year PG. So the topic given for today's National Ayurveda Day is Ayurveda for COVID-19. And I am going to present on a topic, role of Swastavrita in Janapadodvamsa. Next, first starting with the introduction to the Janapadodvamsa. Janapadodvamsa consists of two words, Janapata and Udvamsa. Janapada means large population and Dvamsa means destruction. So hence, the disease which produces demolition or destruction of the large population. Shushruta Samhita and Charaka Samhita explains about communicable diseases. In the chapter Aupasargika Rogas of Shushruta Nidanasthana, chapter 5, and in Janapadodvamsa Adhyaya of Charaka Samhita Vimanasthana, chapter 5. Sorry, chapter 3. So the outbreak is a sudden spread of the disease within a short period to a large population. Now comes to the slide, why and how this Janapadodvamsa happens. So whether it is developed by the incidence of a single disease, in spite of individuals food differ from one another in their Prakriti, Ahara, Bala, Satmya, Sattva and Vaya, the Charaka told the sloga, Samanyas tat Vaigunyat, Samana Kala, Samana Linga, Vyadyo api Vartanat, Janapadodvamsam Yanti. It means although the community differs with the respect to the Prakriti, there are Samana Karanas like Samanya Kala and Samanya Linga. This leads to the Janapadodvamsa. So the Samanya Karanas mentioned by the Charaka is Tatyada Vayu Udaka Desha Kala iti. Means the impairment of the Vayu, then impairment of the Jala, then impairment of the Desha and then Kala. The most important one is the impairment of the Kala. In these orders only the impairment takes place. Then moving to the Nidana, Janapadodvamsa, there are two Nidanas like Sadharana and Asadharana. Sadharana is the affecting the Bahujana by which the vitiating the Vayu, Jala, Desha and Kala. Next Asadharana, it is the Pradipurusha Niyama by doing the Adharma, then Abhishaba, Shastra Prabhava and Prajnaparada. Then this is the image showing the preceding order of the impairment which takes place in the Janapadodvamsa. Like first impairment of the Vayu, then it leads to the impairment of the Jala, then impairment of the Desha and Kala. In this, the impairment of the Jala is more important than the Vayu, then impairment of the Desha is more important than the Jala, then the most important one, the impairment of the Kala. Next, coming to the Chigitsa, which is the most important one. Esham na mrityu samanyam nacha karmanam karmam panjavidam tesham beshajam param uchyade. The Chigitsa mentioned by the Charaka Vimana is the Panjavida Karmasa, which are Nasya, Vasti, and so on. Then Rasayana therapy and Manasika Chigitsas like Satya Bude, Bude Daya, Bali, Danam, Devadarchada, Mantra, Satvritam, Shivanam, and Brahmacharya Upasevanam, Jitatmanam, and Dharmikam. Next, coming to the Swastavrita introduction, the word Swastavrita contains three words like Swa, Sta, and Vrita. Swa means one's own, Sta means staying, and Vrita means regiments to be followed. So the condition where all the dosha, dhatu, agni, and mala are in their normal sthana, kriya, and rupa, which is attained by following their healthy regimen, is called Swastavrita. The main aim of the Ayurveda is Swastasya Swasthya Rakshanam Adurasya Vikaram Prashamanam Cha. Hence, since health is the wealth of the human being, that health can be attained by intake of the Patya Ahara, then by doing the Vihara, and through Aushada. The main important slide is Swastavrita in Janapatodvamsa. The methods of tackling a pandemic situation is well explained and I made into tabular column. They are Ahara, Vihara, Aushada, Manasigam, and Nisarga. Aharas are intake of turmeric, ginger, and all spices. Then Navadanyas, rice, Navadanyas, mudga, then lemon, cucumber, etc. Then viharas. These viharas leads to the breaking of the chain, like not to eat in a same plate and avoid social gathering, etc. Then aushadas like kapha vadahara aushada, then jwarahara aushada, ojo vardaka aushada. Then the single aushadas like ashwagandha, vasa, maricha, gudichi. These are can be taken in as a home remedy. Then classical formulations like Chavanaprasham, Harita Kandam, Indukandam Kashayam. Then patent drugs like Ayush Kwatachurna and Ayush 64. Then Manasika factors are done by doing dhan, meditation, yoga, pranayama, then Deva Vipasya Chikitsa and Vach Chikitsa. Vach Chikitsa means it is sound therapy. Then Nisarga. Nisarga is the measures which we are done to for doing the purification of the Samanya Karanasa. Like Dupana can be done for purification of the Vayu, then Pachana for purification of the Jala, then Marjana and Shuddhi should be done for purification of the Desha, and finally Kala can be purified by using the greenhouse gases and doing reforestation. Then finally Satvrita should be adopted. Next, Swastha in COVID-19. In current scenario, the world is facing the pandemic called novel coronavirus disease, that is COVID-19, which is declared by World Health Organization, WHO. And this is the statistical updation, which is approximate one. In India, the total number of cases is 8.68 million and the total number of recovery rate is 8.11 million and the total number of death rate is 1,28,000. Hence, here comes the importance of Ayurveda in Corona. This virus causes the kapha, vada, jwara lakshanas and many lakshanas, which leads to the arogya nashana and even marana. So, this can be prevented by following the Swastavrita, that is Samadosha, Samagnischa, Samadadu, Malakriya, Prasanna Atma Indriya, Manaswasta Ityabhidiyade. I conclude with the take-home points. In 1817, cholera was developed. In 1918, Spanish flu, and in 2019, coronavirus. So, every 100 years, world is facing a new pandemic situation, and we are searching for new medicine. But years and years ago, our acharyas explained how to prevent it through Swastavrita. Hence, Hitayu can be attained through Swastavrita. These are my references and thank you.
What is the difference between Vata Kapha Jwara and Kapha Vata Jwara?
Vata kapha and kapha.
Vata Kapha Jwara. Kapha Vata Jwara.
Sir, I'm not remembering exact symptoms, sir, but it will be more predominant of kapha and this will be more predominant of vata.
Symptom wise?
Symptoms like in vata more headache will be there. In kapha more of rhinitis, pradishaya will be there.
Pitta role is not there.
Sir?
Pitta role is not there.
Pittam anubandham will be there, sir. But more of kapha vada lakshanas.
What is the difference between novel coronavirus and SARS-CoV-2?
Sir?
Novel coronavirus and SARS-CoV-2. What is the difference? Okay.
I'm not knowing, sir.
Okay, right. Okay, thank you.
Thank you, sir.
Thank you. Now I call from Department of Shalyadandram.
Good afternoon, everyone. Today I'm going to present about COVID-19 and Ayurvedic outlook. Let's begin with the structure of SARS-CoV-2. SARS-CoV-2, it belongs to the family of coronavirus. It got its name for the spikes which is present on its surfaces. SARS-CoV-2, it causes COVID-19 and it causes COVID-19, a contagious viral infection which affects basically the lungs and the throat. Okay, in the structure of the virus, there will be a genetic material which carries information which makes the virus, makes own self-reproduction. And that virus material, the genetic material is covered by the protein shell, which helps to cover the genetic material. And when the coronavirus gets afflicted, the immune system gets afflicted, the alveoli and bronchioles get inflamed by the immune responses, which leads to the fluid accumulation in the alveoli, which leads to the alveoli. Due to the fluid accumulation, the blood supply will get afflicted and oxygen supply may get reduced and it may lead to COVID pneumonia. And the patient, if the oxygen supply gets depleted, the brain will send the responses for the internal hypoxia. But in COVID condition, the patient may not get that signal, which is a signs and symptoms of COVID. The common signs and symptoms are shortness of breath, fatigue, fever is the first and foremost symptom, and cough. In serious condition, it may lead to confusion, kidney failure, persistent chest pain, etc. The US CDC classifies COVID-19 into the following categories based on the signs and symptoms: mild to moderate, severe, and critical. In mild to moderate, the symptoms will be in a starting stage to pneumonia. In severe, dyspnea, hypoxia will be there and more of lung involvement will be there. In critical, it is a complication stage with respiratory failure, shock, and multi-organ dysfunction. Okay, let's correlate with the Shatkriya Kala and Nidana Panchaka and probable pathogenesis. Sanchaya, Prakopa, and Prasara Avastha in Nidana, the incubation period can be correlated, and it further goes to Sthana Samshraya, where Purva Rupa manifests, which can be probably compared to the mild stage. And then the disease progress to Vyakti, where the Rupa manifests and the mild, moderate to severe symptoms will occur. Then and there we can find the Samprapti and Upashaya, Anupashaya can be given. And then if the Vyakti stage, the disease is left uncured, it will lead to Beda, the complications. It is a Sankramika Vyadhi and Janapadodvamsa impact of the disease will be there. Since fever is the first and foremost symptoms, it comes under the Jwara category. Agantuja and Bhuta Abhishankaja Jwara Nidana and Sannipada Dosha Vaishamya will be there. Vata Kapha Pradhana Pittanubandha Vikalpa and Rasa Rakta Dushya. Then the Shrotas involvement. In Ayurvedic perspective, the primary site of the Shrotas affliction will be in the Pranavaha Shrotas, both upper and lower respiratory tracts. The center stage of the pathological events occur in the lower respiratory tract. In certain patients, gastrointestinal system may also involve with the symptoms of Pitta and Kapha with diarrhea, nausea, vomiting. This shows the involvement of Koshta and also Annavaha Shrotas. Fever is the first and foremost symptoms. Fever indicates the Rasavaha Shrotas involvement. The respiratory symptoms like cough and dyspnea shows the Pranavaha, Udakavaha and Annavaha Shrotas involvement. The clotting of the blood seen in the several patients which indicate the Raktavaha Shrotas involvement. Then comes to the Vyadhi Kshamatva, the host factors which is used to, which fights for us. It will be depend upon the bala of the patient. The bala includes not only the Agni bala and also Dhatu bala and Deha bala. Bala of the patients is primarily depend upon the ojas. According to Vagbhata, in the treatment of Jwara, where Agni is stabilized, the balam and ojas will be increased. The strengthening of the host immunity will be the therapeutic strategy of Ayurveda. Ama formation will be there, which may lead to dosha, dushya, samurchana. In later stages, Ama may turn to Ama Visha. And in advanced stages, the disruption of immune system, which may lead to cytokine storm. But in Ayurvedic studies, they have proven that add-on medicines for Ayurveda with the ICMR guidelines, the patient shows modulating effect of interleukin-6, the cytokine, with no cytokine storm. The therapeutic protocol will be continued by Dr. Mayuka.
Good afternoon. Continuing with the treatment aspect. And as far as COVID-19 is concerned, we do not have a specific condition which we can attribute to that. So whatever treatment aspect that we are going to do will only be based on the symptomatology. So according to the Ayush guidelines that they have published for the Ayurveda practitioners, the general group can be divided into 4. Group 1 having people who are under quarantine and those also under home isolation who are not COVID positive. And healthcare workers can also be brought under this group. And this group is mostly will be receiving the preventive treatment. And group 2 will include symptomatic treatment, symptoms varying from mild, moderate to severe, and also those having comorbidities, and also those with immunocompromised conditions who are having symptoms. And this group will be receiving the symptomatic treatment. And the third group will be the vulnerable group of pregnant and lactating ladies, and also the people who come under the geriatric care. And these group will receive an integrated treatment, wherein additional treatment will be given to whatever existing line of treatment they are already having. And the fourth group is the recovery and rejuvenation will be, they'll be given recovery and rejuvenation. They've already recovered, they've already tested negative, and post-treatment restorative health care will be there. And in group 1, we can also bring in prevention in the first group, wherein the first line of treatment can be Agnivardaka, because Rogaha Sarve Api Mande Agnav. So Agnivardaka by Deepana, Pachana, Dravyas can be done. And then dinacharyas like nasya, gandusha with the base of oil can be given, wherein the viral load or the entry of the virus into the system can be brought down to a great extent. And dupana can be done, the fumigation of the place of stay, wherein dupana has found to have antimicrobial property. And pranayama can also be advised side by side because it increases the lung capacity, as well as the oxygen intake can also be better oxygen intake will be there. Nidra, and as far as Ayurveda is concerned, it is one of the Trayopastambhas. So wherein we advise that Divaswapnam and Ratri Jagram should not be there. And in the asymptomatic patients, again, Agni correction can be given. Lagu Ahara Sevana, Ushnodaka Pana can be given. Immune boosting rasayanas also can be given. And as medications, as prophylaxis, we can give Kashaya like Indukandam Kashayam with Sudarshana Gutika, Vilvadi Gutika, Chavanaprasham, etc. And group 2, more of symptomatic management depending on the condition. If Jwara is there, Amritarishtam, Amritotram, Kashayam, or one of the other medications, according to what symptoms they are exhibiting and also according to the dosha involved. Similarly, for Kasa, Shwasa, also medications like Dashmula Katatrayam, Talisadi Churnam, etc. may be given. And as Rasayana, if there is good Agni Bala, Chavanaprasham, Agastya Rasayanam also may be given. And for GI manifestations, medicines like Ushradi Kashayam, Vilvadi Gutika, etc. may be given. Group 3, the vulnerable group, again, children, pregnant women, lactating women, geriatric healthcare, and immunocompromised people who need Rasayana Chikitsa. So these are some of the medications which may be given in that group. And in group 4, where after the treatment, after testing negative, many of the patients complain of loss of appetite. So the first line of treatment, again, there will be Agnivardhaka Ahara and Agnivardhaka medicines. And once Agnivardhaka is done and Agni is optimum Agni is attained, then Dhatu Poshana can be done. There will be some kind of Dhatu Kshaya after the recovery. So Dhatu Poshana can be done. And again, Rasayana Chikitsa also can be given. Another one impact out of COVID, after COVID, is the psychological impact, wherein there are patients complaining of anxiety, depression, hallucination, psychosis. This may be because of their the social inhibitions, or there are theories which are not confirmed, but their brain inflammation causing anxiety and hallucinations, or it may also be because of the medications they are subjected to. So in such a condition, Ayurveda can play a very important role in restoring the mental health. So medications like Kalyanaka Kritam, Ashwagandha Arishtam, Mansamitra Vatakam, etc. can be given. So why Ayurveda in this pandemic? So no system of medicine has any evidence-based treatment of COVID-19 as yet. So everything is in a trial and error stage. So supplementing Ayurveda along with that, or making Ayurveda the first line of treatment, can help, because the fundamental can be applied to all range of diseases. So any disease can be brought under the purview of the three doshas. So we can take the disease, and depending upon the dosha, we can always treat the symptoms. And we have the concept of Vyadikshamatva and Janapadodvamsa that has been mentioned. So this concept can be adopted and adapted to the present times. And there are no reported side adverse effects that has been mentioned when only Ayurveda medicines are given. And we have this a great boon of having Dinacharya and Ritucharya in our texts. And if we make that as a daily regimen, that itself will help prevent the communication of the disease. And when the COVID, when the coronavirus, the symptoms and were peak in China, they had the use of their traditional Chinese medicine in their protocol. So in a similar aspect, and they also had it, some of the advice being given in Italy also. So similar line of approach can be adopted here also, wherein Ayurveda can also be equally incorporated.
And also, Charaka says, Roga epyatra nodishta bahutvat namarupatah tesham apyeta devasya doshadin vikshya bheshajam. So any disease, even if it is not already mentioned in the texts, we can always bring it under the uh, Tridosha theory, and we can treat it in that aspect. A similar mention is there also in Ashtanga Hridayam. So Ayurveda can be considered as one of the mainstream treatment in cases where it is not in a very severe condition. So these are the references, and I hope that we'd be able to wash out Corona from our lives very soon. Thank you.
Okay, thank you for a nice presentation.
Thank you, sir.
You have nicely categorized the groups, different groups. Okay, suppose a patient with the corona positive, asymptomatic, what will be the protocol?
So generally, again, our concept will be Agni related.
First
So
thing,
Agni
whether will go for treatment or not? Corona positive, asymptomatic.
Yes, sir. Some kind of supplementary medication can be given so that they don't develop the symptoms later on.
Okay, there are different tests they are doing for corona positive. Corona, different tests.
Test.
Okay, one antigen test they are doing. Another one is some sero survey is going on. Another one is some RT-PCR or something. What is RT-PCR?
I'm not sure of the full form.
Okay, what is sero survey? Something is going on. Sero survey. You have heard it, no?
Yes, sir.
What is that?
I'm not sure.
Then what is antigen test?
So to see if there is any, if the antibodies have been present in the blood, to see at any time if he's gone, if he's been exposed to the.
Okay, okay, thank you.
Go to previous slides. One by one. There one US CDC one is there. Yes. What is the full form of CDC?
Center for Disease Control.
Control or classification? Center for Disease Control or classification?
Controls.
Sure.
Yes, sir.
See. Correct. Okay, thank you.
Thank you, sir.
Thank you. Now I call from Department of Reservation.
Shivaya Namaha, Om Namo Dhanvanthari Namaha. Good afternoon, everyone. So, myself, Dr. Vijay Lakshmi from Department of RSBK. Today, we will be presenting on the topic National Clinical Management Protocol for COVID-19 in Ayurveda. So, before going into the introduction, we will see about where to find this protocol. So, just log in into Google and enter the Ministry of Ayush. In Ministry of Ayush, you will be finding a dashboard Ayush for COVID-19. In that, you will be finding some protocol called National Clinical Management Protocol for COVID-19 in Ayurveda. Then comes introduction. We all know Ayurveda is emphasized on the basic concept that is Swastasya Swasthya Rakshanam Athurasya Vikhara Prashamanam. As well as in Ojas, when comes to, it is responsible for the Vyadhi Shamatvam. Vyadhi Shamatvam is achieved by two methods, that is Vyadhi Utpadaka Pratibandakatvam, Vyadhi Bala Virodhitvam. These both will be compared under preventive measure. When it comes to this, the for COVID-19, the immune stasis is a very vital role. So it is helpful in a safeguard the disease progression. This protocol have been developed based on a three aspect. That is, first one is knowledge from Ayurveda classics, then experience from clinical practices, empirical evidences, that is experimental evidences, and emerging trends on a ongoing research. Then comes general and physical measures. First, we have to maintain social distancing, respiratory as well as a hand hygiene, wear mask. Then gargling with a warm water, which is processed with a pinch of a turmeric, that is haridra or a lavana, or a water boiled with trifala or a yashti madhu can be used for gargling. Then nasal installation, that is nasya karma, can be done with a anutaila or a shadbindu taila. Then comes steam inhalation. For steam inhalation, we have to use ajamoda or pudina or eucalyptus once in a day. Then adequate sleep and moderate physical exercise should be done. Then comes in dietary measures. You have to use a warm water regularly, or a warm water which is processed with a dhanyaka, hadraka, or a basil leaves or a cumin can be used for drinking purpose. And the food which is a balanced diet and which is warm and fresh should be used. Drink golden milk, that is the golden milk should be processed with a 150 ml of milk which is added with a half teaspoon of haridra, should be taken at night, and drink ayush kada or kvata once in a day. The remaining parts will be dealt by Dr. Vanita.
Thank you, Vijayalakshmi. Symptomatic management of COVID-19. Prophylactic care should be given for primary contact and also for the high-risk population. Medicines are ashwagandha, aqueous extracts of Tinospora cordifolia. Aqueous extracts means extract obtained from the vegetative sources by steeping it in water. The dosage was 500 mg of extract or 1 to 3 gram of powder form. It should be taken twice daily with warm water. Guduchi Ganavati. It is also called as Chamshamanavati or Gilayu Ganavati. It is the aqueous extract of Tinospora cordifolia. Dosage of 500 mg of extract or 1 to 3 gram of powder twice daily with warm water. Chamnaprasham, it should be taken 10 gram with warm water once a day. It also can be taken along with milk. For asymptomatic COVID-19 positive, for prevention of disease progression to symptomatic and severe form to improve the recovery rate, here the medicines Guduchi Ganavati can also be taken. Guduchi plus Pipali, aqueous extracts of Tinospora cordifolia and Piper longum. The dosage is 375 mg twice daily with warm water for 15 days or 1 month. OH 64 tablet should be taken 500 mg twice daily with warm water for 15 days. Clinical severity of mild COVID-19 positive. The symptomatic management should be for fever, cough, headache, tiredness, dry cough, sore throat, etc. Without evidence of breathlessness or hypoxia. The medicine should be given or Guduchi plus Pipali, OH 64 tablet should be given. Symptoms of mild COVID-19 positive. For fever with headache and body ache, Nagaradi Kashayam should be given. 20 ml of dose should be taken. For cough, Sitapladi Churnam with honey should be taken. Sitapladi Churnam is taken as 2 gram thrice daily. For sore throat, loss of taste, Vyoshadi Vadi should be taken. 1 to 2 pills should be taken. For fatigue, Shravanaprasha, 10 gram with warm water or milk once a day. For hypoxia, Vasavlega should be given 10 gram with warm water. For diarrhea, Kudaja Ganavati 500 mg to 1 gram thrice day. For breathlessness, Kanakashva should be given 10 ml with equal amount of water twice daily. Post-COVID management will be taken by Dr. Mridula.
Thank you, Dr. Vanida. I'm continuing with post-COVID management, which include in some persons developing with post-COVID complications like fibrosis, fatigue, and mental illness. Fibrosis is nothing but lung tissue becomes damaged and scarred, which may lead to shortness of breath and also dizziness, fatigue, and other symptoms like muscle aching, etc. And fatigue, which means over tiredness or sleepiness, uh, and uh, and mental illness like anxiety, stress, and other mood disorders, etc. In this case, we can give ashwagandha, chavanaprasha, and rasayana churna. Ashwagandha will be in extract form as well as in powder form. Extract means 500 mg, and in powder form means 1 to 3 gram powder twice daily with warm water for 15 days or 1 month. And Chavanaprasha, it is a best rasayana dravya which can be given in the dosage of 10 gram with warm water or milk once a day. And rasayana churna, this is a combination of 3 medicine, guduji, amalaki, and gokshura, which can be given 3 gram powder twice daily with honey for 1 month. Coming to research work done in COVID-19, already in India under Ayush department, many research work is going on regarding COVID-19. Many universities and state governments and COVID hospitals are doing this research work. The above mentioned agencies initiated various studies across the country under the guidelines of CSIR and ICMR, etc. The total number of such studies initiated by the ministry and being undertaken by premier institutions like national institutes, research councils, universities, state governments, and other collaborating hospitals. Coming to Ayush Sanjeevani app, this is very well-known app by all. This is recently launched by Government of India, which is developed by Ayush department, and which is showing assessment of the effectiveness, acceptance, and usage of different Ayush advisories brought out by the Ministry for the Prevention of COVID-19. The study showing that almost 1.5 crore Indians are using this app, which is indicating that huge popularity and wide acceptance of Ayush interventions. Coming to Ayush Padachurnam, this is a very familiar formulation which contains 4 ingredients, that is twak, lavanga, shundi, and tulasi. In this ingredients may vary with different pharmaceutical company. Like some pharmaceutical company using lavanga instead of lavanga, piper longum they are using, and this is absolutely safe ingredients, and which is Ushnavirya. There is no known adverse reaction till now, and this helps our Ushnavirya. And the ingredients of Ayushpadas are very good antioxidants as well as antiviral, and which is showing immunomodulatory properties. Like Tulasi, already research is going on. And coming to conclusion, this protocol is developed by Ayush department under the expert committees of All India Institute of Ayurveda, Delhi, and IPGTRA, NIA, and CCRA's other research organizations. This protocol is for management of mild COVID-19. In case of moderate to severe COVID-19 cases, individuals may have informed choice of treatment options, and all severe cases will be referred. By this, I am concluding my presentation. Thank you.
Thank you for the presentation, nice presentation. Suppose so many physicians, they are claiming that curing the COVID-19, okay? So whether we should encourage those people, yes or no? Are you getting my question? So many physicians, they are claiming they are curing the COVID-19. So whether we should encourage them or not? Whoever, whether it is Ayurvedic, allopathic, whoever, they are claiming they are curing the disease COVID-19, whether we should encourage them or not?
Sir, if they are doing with proper protocol, we can encourage, no, sir.
Proper protocol means what?
Like Ayurvedic protocol or else these guidelines, if they are following these guidelines, we can encourage them, no, sir.
Is it curable?
No, is it not we are not acclaiming it is
That's why my
curable.
question is whether we should encourage them, yes or no. They are
Yes,
claiming
sir.
they are curing.
Yes, sir.
If they are claiming they are curing, suppose we are encouraging them, what will the drawback? Are you getting my question? Suppose they are claiming and we are accepting them, yes, you are curing. And what will the drawback if we are encouraging them? Are you getting my point?
No, not getting your point, sir.
Suppose you are claiming that you are curing COVID-19 and I am telling yes, you are curing, or the population or the people or the public, they are telling yes, he or she is curing. If yes, then what will the problem for the society? But they are not curing the people. What will the problem?
No, sir. Don't know.
Whether you are not getting the question or you are not getting the answer.
If complete cure will not happening means some problem will come.
Now, recently, some people they claim that they are curing, but the government of India told not accepted those things. Why the government of India not accepted? What will be the consequence?
There may be adverse effect after there will be long-term adverse effect, no, sir. We have to consider that long-term adverse effect, no, sir.
Okay. Okay. Thank you.
Thank you. Thank you, sir.
Thank you. Now I call from Department of Panchakarma.
Good afternoon, one and all. Myself, Dr. Sai Trilochan from Panchakarma Department. So, regarding today's topic, that is Ayurveda in COVID-19 pandemic. COVID-19 is a disease which is caused by the virus SARS-CoV-2, also known as Wuhan virus. It is the term Wuhan virus is you can say it is a general public nomenclature. It is not a scientific term or anything. And the tests for vaccines are being conducted right now, and there are in various stages of testings, but there is no short guarantee that it will be available quickly. And one more thing is, by the time the common man gets the vaccine, it might be 2 or 3 more years. That is what the current statistics are telling us. Then one more thing which we have to see today is what our science is doing and how our science can approach it. So basically Ayurveda gives you an all-round approach. It is not only for a symptomatic person, it is also for an asymptomatic patient, and also it manages the post-treatment care. So there are various symptoms where we can see the patient is debilitated completely. So other than physiotherapy, I don't think they are giving them any other support. So there even our system of medicine can play a very good role. So and most importantly, Panchakarma can take the lead in curing, or not exactly in curing, in managing COVID-19 cases. Then therapies like Nasya, Snehapana, Kavala, Gandusha, Virechana and Vasti are very beneficial. So next I'll be going into pathogenesis of SARS-CoV-2. So till the pathogen reaches the lungs, it follows the same pathology of pneumonia. So the virus-laden droplets from an infected person enters the nose and throat of the healthy person. There what happens is the virus has lipid bilayer and it is very much receptive to uh, angiotensin converting enzyme 2. It is a cell receptor. So the virus gets attached to these receptors and enters the healthy cell. There it replicates, multiplies in number and breaks up, destroying the cell, and further goes and infects a healthy cell. So this keeps on happening and slowly the virus descends into the lungs. Once it goes into the lungs, uh, basically one thing which we have to observe is this SARS-CoV virus is highly means it is high affinity with ACE2 receptors. So any cell which has ACE2 receptors is susceptible for the attack from this virus. So once and alveoli are rich in ACE2 receptors. So once the virus goes there, then there is a huge battle taking place over there. What happens is once the immune system is triggered, the body releases your leukocytes. Once the leukocytes come and assess the situation over there, they release the chemokines. These chemokines further trigger the immune system, and a huge battle goes on over there, which finally destroys the alveoli, filling up with fluids, dead cells, etc., thereby decreasing the chance of oxygen permeability. Also, what happens here is due to this immune triggering, uh, cytokine, cytokines are also triggered, which leads to cytokine storm. What is the cytokine storm? Due to this high amount of immune triggers, huge amounts of cytokine is released into the body. Cytokines are also part of the immune system. What they do is slowly this gets transformed into autoimmune attack kind of situation. So that is the reason why this is also one of the reasons why the modern medical physicians are saying that can lead to multi-organ failures. What happens here is any organs, basically your blood vessels, heart, brain, lungs, your kidneys and liver all have this ACE2 receptors in high quantities. So once the virus enters the blood, it can go anywhere and it can destroy any of the tissues. So that is the pathophysiology for now, and my teammate Dr. Jennifer will take over the signs and symptoms. Dr. Jennifer.
So moving on to the signs and symptoms of COVID-19 infection. So here most people of the COVID experience mild to moderate symptoms. So here older people with cardiovascular disorder, respiratory illness, cancer and along with diabetes likely to develop serious illness. So there is an observational study of 1,420 patients from European Center for Disease Prevention and Control takes a survey on what are the common symptoms which can be present in the COVID. So among those patients, first was the headache. Headache was about 70.3% and anosmia was about 70.2%, and as nasal constrictions was about to be 67.8%, and rhinorrhea 60.1%, gustatory function 54.2%, sore throat 52.9%, fever 45.4%. So these were the symptoms recorded by the European Control for Disease
So another study where there was a total study of 50 patients which was being taken from the COVID confirmed patients. So here they've made an analysis what could be the possible earlier symptoms in COVID-19. So here anosmia was the first thing, and dysgeusia, that is distortion of taste, was the second symptom, and xerostomia was the third symptom. So here anosmia was tend to be 92%, and distortion of taste was about 70%, and xerostomia was about 32%. So this can give some idea of the early symptoms of COVID-19. An Ayurvedic interpretation. So Ayurveda has mentioned epidemics and pandemics under the context of Janapada Dvamsam. So Charaka has given that vitiation of Vayu, Udaka, Desha, Kala. So here Vata has been vitiated. So here when we compare to COVID illness, there is spread of the virus through the air. So considering as an airborne disease, we can correlate with Janapada Dvamsam. And Sushruta has also mentioned that Jwara as a Sankramika Roga, infectious disease, as COVID-19 has also as a symptom of fever, can be correlated. And the other signs and symptoms may be correlated with Vata Kafaja Jwara or Sannipadika Vata Kafaja Jwara or Raja Ikshma 2. And in Dhatukata Jwara Avastha, here the COVID-19 symptoms I've mentioned here, first is myalgia. So when there is myalgia, we can correlate it with the Rasadhatu involvement. And when with fever and diarrhea, we can correlate with Mamsadhatu, and with vomiting, anorexia, Meda Dhatu, and with the difficulty in breathing and cough with Maja Dhatu. So from Rasa to Meda, it's quite Sadhya. And for Maja Dhatu, it becomes this Krishna Sadhya for the physician. And here, the most highlighting point is that COVID-19 has a higher affinity towards the ACE2, that is angiotensin converting enzyme 2. So which is about 10 to 20 fold has a higher affinity. So this makes the spread of the infection easier from human to human. And there is no yet cure and vaccine being found yet, as the virus has strands for multiple mutation in a single host in a single day. So it is difficult for also the scientists to identify what type of mutation is been taking on within the virus. So also difficult to analyze and create a proper vaccine or a drug to this COVID-19, as it forms a multiple drug resistance. So what can be dealt in Ayurveda? So this part will be taken on by Dr. Kaushika, where research in COVID and Panchakarma in COVID, what can be done.
So in COVID part. So while seeing the pathogenesis of COVID virus, that is the coronavirus, has an affinity towards ACE2, that is angiotensin converting 2 enzyme, the receptors for this, and also TMR-PR-SS2, that is transmembrane protease serine 2. So while seeing the drugs which are used for inhibiting these receptors, in modern medicine, these three drugs has been used. So one is the ACE2 receptor blockers. These are the drugs which blocks the ACE2 receptors so that the coronavirus will not get affinity towards the receptors. Next is the TMPR-SS2 inhibitors, and next is the protease inhibitors. So while we see the modern drugs which is used for this, the TMPR-SS2 inhibitors has more affinity to the receptor ACE2 receptors, and thus blocking the coronavirus. So the bromhexidine, camostat, and nafamostat are the drugs which is used. So the bromhexidine, while we see the compound present is the bromhexidine, which is a derivative from the vasicin, which is derived from Adathoda vasica, that is Vasa. Next is the camostat. So camostat is a bracillin or the brasilian. This is the compound which is used. So the patranga, that is the sappa nut, Caesalpinia sappa, is a drug which is having this drug. Next is the nefamostat. So this is a drug which is prepared by Sun Pharma of Ayurveda. So the Pathala Garudi, Cocculus hirsutus is a drug which is having the nefamostat. So these are certain research works which is done. So the bromhexin, well, we see it is obtained from Vasicin, that is Arastoda vasica. This is regarding the Brazilian which is present in case of Sapanud. And the Sun Pharma testing plant based drug as potential COVID-19 treatment. So this is an Ayurvedic drug where the Cocculus hirsutus, that is the Pathala Garudi, is used as a treatment. While we see the ARB inhibitors, that is acetylcholine receptor blockers. So these are the drugs, that is Ephedra sinica, Somalata, and Salix alba jalavetasa. So these are the drugs which can be probably used as a preventive. So these are the Ekamulika dravya which is used as a preventive technique. There is another research, that is RDRP inhibitors, that is RNA dependent RNA polymerase inhibitors. So these are the protein inhibitors which is derived from the plant natural products, that is the citrus fruit. 8 citrus fruit has been taken for the study, and this compound has been generated, and it is used for the preventive aspect of the COVID-19. Next, we're moving into the Panchakarma treatment in COVID-19. So these are the aftermath of COVID-19. So the post-discharge symptoms and signs, which was seen in 219 patients, divided into ICU group and non-ICU group. So that study was based upon the psychological distress, declined health status, hypertension, fatigue, dyspnea, and what is the age of the people who are falling under this group. So while we see Ayurveda for COVID-19, certain immune boosting drugs like Tulasi, Nimba, Shigru, Ashwagandha, etc. can be used, and blood thinners like Haridra, etc. can be used. This is for maintaining the cardiovascular system. And steam inhalants, which using the Putiha, Tulasi, Lavanga, etc. can also be done. So while considering the Panchakarma, there are two aspects, that is prevention aspect and aftermath treatment. So based upon WHO classification, they have classified all the cases into 4 groups, that is target group 1, where quarantine and home isolation for non-COVID positivity. So here Kavala and Gandusha with Narikela Thailam or Tila Thailam can be done. Kavala with Ushnajala along with Haridra, Lavanam, Triphala, Eshti and Tankana. And Nasya, that is Pratimarsha Nasya along with Anuthailam, which is a Shamana Nasya. Second group, the target group with mild and severe symptoms. Here, Marshanasyam with Anuthailam, Shadbindu Thailam and Sarshapa Thailam. Any Katu Thailam which is having Ushna Tikshna property can be used. And Nadi Swedanam. And in case of Shwasa Roga, Saindavadi Thaila Abhyangam and Nadi Svedana has proven better efficacy. And Shodhanam related to any Kapha related or Pitta related, depending upon the Kapha Dosha Adikyata, certain Shodhana therapy can also be maintained. In third target group, where the vulnerable group, where the pregnant women, lactating women, children and geriatric age group are falling under. So here the Pratimarsha Nasya, Grita and Shira internal administration is given. This is as a Rasayanam, and also the other Rasayana Chikitsa can also be adopted. So target group, that is post-treatment.
1 more minute.
Okay, post-treatment protocol. So these are the symptoms where the Panchakarma has been carried over. So while we see about the Panchakarma, not only the Pancha Shodhana, but also certain Rasayana therapy and also Purva Karma like Abhyangam, Swedanam, etc. can also be adopted. Shamana Aushadhi part will be carried by Dr. Ajay.
So good afternoon to all. So for Shamana Aushadhi, first we have to go to correct the Agni, that is Pachana is done. That is we take Katu and Tikta Pachanam. For Tikta Pachanam we will take as a Gudichi, Pachanamradam, and Katu Pachanam will go for Trikatu, Panchagola, Indugandam. So in COVID patient there will be a avastha of Kapha and Pitta and also Kapha Vadam. So Kapha is Neham, Pitta is Neham, so Rukshanam is done. So Pachanam is does the Rukshanam. So hence we take as a Pachanamrada Kashayam. So why? Because in Jora Chikitsitis should start with Tikta Rasam and should end with the Madhura Rasam, Balyam and Brahmanam. So by Tikta Rasam, so Vada will increase. So in the final stage, that is the end stage, we will be selecting of Madhura Rasa is selected. Let's see about the various Kashayas and Avastha in COVID-19. So Dashamula Gadatrayam, Shadanga Kashayam and Amrudatram. So Dashamula Gadatrayam is selected because of it does clear the Shoshanam and Kaphavada Haram, because Dashamulam does the Sophagnam, we will take as a bronchitis inflammation. and Vasa having the property of Swasa Kasaharam. So Sadanga Kashayam does the Pitta Shamanam because it is called as a Shita Kashayam, and Amrodram it is mentioned as Kila Doshajam Joram. So we can use Amrodra Kashayam used in Amavasta also. So coming to Nayapayam, Vidaryadi Kashayam and Barangyadi Kashayam. So Nayapayam Kashayam. So we'll take Maduram, Katurasam and Samashita Ushnam. So Bala Shitam, Shunti Jiraka is Ushnam. So it is not a Shita Viryam, but it does Vadanulomnam we can take as exertional dyspnea. So Vidaryadi Kashayam, it is Madurarasam, Shita Viryam, just clear the Vriddhi. So it is not given in initial stage. So we can give in Vada Pradhanavastha, that is dry cough and dyspnea. And coming to Barangadi Kashayam, it is the best for intermittent fever. It is mentioned as Vishamadvara Nashanam. Next we'll see about in Jara, there will be a patient of Adisara also. So in Chakradatta, there is a separate chapter called Jara Adisara Chikitsa, where he mentioned about the Nagaradi Kashayam, Gudichadi Kashayam, that is Nagaraji Kashayam as a Sarvadisara Nashanam, and Gudichadi Kashayam in Chakradatta, it is mentioned as Jara Adisaram Shantaye. The same Gudichadi Kashayam, it is mentioned in Ashtaradayam Sutram 15, that is Pitta Sleshma Jara Chardi. We can correlate with the viral fever. So Sudrasana Churnam, Anupanam is Sita Jalam for Pitta Kapha Avastha and Ushna Jalam for Vada Kapha Avastha, because it is mentioned as Prananam Avalambanam. So coming to Sita Paladi, Talisadi, the difference is Sita Paladi is Madhura Rasam, Talisadi is Katu Rasam. Sita Paladi cannot be given in Ama Avastha because of Madhura Vipakam, Kleda Vardhanam and Ama Vardhanam. So COVID patients with the dry cough can be given. So in Talisadi, we will it is Katu Rasam and mainly given for productive cough. Okay. Thank you for. So I thank about the staffs and professors and this team for arranging us this platform for presenting about the Ayurveda for COVID in Ayurveda, National Ayurveda Day. So thank you.
This is a question for Sahit. What is RRT PCR in COVID-19? RRT PCR, not RT PCR. RRT PCR in COVID-19.
Sir, it is a type of polymerase chain reaction, sir. Antigen polymerase chain.
I'm not asking RT PCR. RRT PCR, double RT PCR.
No, sir.
Okay. What is the relation of quarantine in relation to COVID-19? Quarantine. People are using the. What is the relation quarantine or COVID-19?
Sir, that is to break the chain of propagation from propagation of the virus from one person to another, sir.
Quarantine means what?
So it is to isolation.
What is the difference between isolation and quarantine?
Sir, quarantine is like in any biological involvement is quarantine,
Okay.
sir.
Okay, leave. For Jennifer, most of the people they are advising you should use Nasya for COVID-19. Actually, Nasya when you are using the base as oil. Oil reaction is acidic in nature. COVID-19 coronavirus having a lipid membrane, and that will breaks only through alkaline medium, whereas the oil having acidic medium. And what is the rationality behind Nasya using in COVID-19? Are you getting my question?
Yeah, can you just repeat it, sir, again?
Are you getting the question?
Yes, sir. Sir, here the main reason for using oil-based Nasya is because of the bilipid layer on the covering of coronavirus. What happens is it adheres to this oil film, oil layer, and but it is not only the oil which is important, but what dravyas we are using in the oil is also important, sir. So alkaline, using those dravyas which have alkaline property according to modern science. If you use those dravyas to prepare the Nasya medication, then it will be much beneficial in using in prevention of propagation of SARS-CoV, sir.
Okay, thank you. Thank you very much for nice presentation. Thank you.
Thank you, sir.
Now, I request Dr. Moharana sir to give their conclusive reviews on paper presentation.
Respected principal, respected administrative officer, respected teachers, my dear students. So I congratulate to all the PG scholars, those who have presented well. Okay. So I'm not telling the department wise, everybody has presented well. And this presentation skill is important. See here what we are going to see, how you are presenting, what is the subject content, that only. Okay. Now, all of you have presented well. And particularly out of this, the Salya department, okay, Mayuka and Aishwarya, they have presented well manner compared to all other participants. Okay. So what I am telling you, in future also we will be conducting the series of events like this. So better it will be what I am telling, the stage phobia, the fearness to the stage, that has to come down. Okay. Still some people are having stage fear, that has to come down. So we'll be creating we will be conducting different types of symposia or seminars or talks in future. So we request your sincere cooperation in the future, all of our endeavors. Thank you.
Thank you, sir. Now I request Dr. Sriman Narayanan sir to announce the prizes for paper presentation and poster presentation. And I request Principal in charge, Professor Dr. Chitranjan Das sir, to distribute the prizes.
Good afternoon. So I'll be announcing the winners for poster. So I'll start with the third prize. Third prize goes to Harika and Mugilmati. I request our principal sir to give away the prizes. Second prize goes to Krishnan and Reshma. So this is not a race, but we need to announce the number one. Any guesses? Audience? It goes to Aditya Murli and Akshaya. A big round of applause for them. No problem, sir. We will give later. Give one certificate. And congrats to all the poster presentation participants. You all did a good job. There was one poster which was very impressive, but it didn't come in any of the categories. It was that meme video. It was very interesting. Now, time for announcing the winners for paper presentation. So, third prize goes to Department of KC, Dr. Rameshwari. Second prize goes to Department of Panchakarma. And now it's the time to announce the winners. Department of Shalya Tantra. Dr. Mayuka and Dr. Aishwarya. Thank you, sir. As I already mentioned, this is not a race. This is a event which we can work upon. Okay, so next time the other departments you can also win the prizes. Okay, so you all did a good job and very congrats to all of you, all 11 of you. Okay, thank you and over to Anaga.
Now, I request Dr. Venkata Suresh Krishna sir for vote to sign.
Har Har Shankara, Jai Jai Shankara. On the behalf of staff of Sri Jayendra Saraswati Ayurveda College and Hospital, it's my privilege to present vote of thanks on the occasion of Dhanvanthari Puja and celebration of 5th Ayurveda Day. We are lucky to have divine blessings of Sri Shankara Vijayendra Saraswati Swamigal of Sri Kanchi Kamakoti Peetam in the form of Anuraga Bhashyam. Our sincere thanks to Swamigal. Our sincere thanks to Dr. S. Venugopal sir, Sunandan sir, Dr. Chakravarti sir for successfully conducting Dhanvanthari Homam and Pujam on this occasion. Thank you, sir. I wish to express our gratitude towards Honorable Vice Chancellor Professor S.V. Raghavan sir for his thought-provoking message. Thank you, sir. My deep sense of gratitude to Dr. Somit Kumar sir for accepting our invitation and delivering the thought-provoking lecture. Thank you, sir. I thank you to Dr. Swaminathan sir for welcome address. I thank Dr. Chitranjan Das sir for presiding over the function. I also thank Dr. Pradeep Kumar Morana sir, Dr. Sriman sir, Dr. Hariom sir, Dr. Indushri madam for their valuable speech. So the PG scholars who are going to write exam in 2 days, in this busy schedule also, they have presented well. And I thank to all postgraduate students of 2019-20 batch from various departments. Thank you one and all. And we Ayurvedic students are always multi-talented and creative. So I thank to all house surgeons for their creative poster presentation. Thank you. Last but not least, I thank the MC committee, AO sir, and the person or the people who have supported this program directly and indirectly, and whomever I forgot to mention. So thank you one and all.
Thank you, sir. Now I request respected AO sir to speak few words.
Good evening, all. இது வந்து ஸ்பீச் இல்லை, கண்டினியூஷன் ஆஃப் vote of thanks. So, TVS Krishna mentioned, Dr. TVS Krishna mentioned very well, but we have to thank some more people. Without them, this event would not be happened this much successful. So, my sincere thanks to Ramakrishnan, our sincere thanks to Suresh, who last 3 days they didn't take sleep. I know very well. They didn't slept because they are in very much cautious to make it successful. This is the first time we are doing live because this just like that we have started, but we have done very well because we have received a lot of appreciation from university side. I would like to thank our IT team from university, Mr. Vinod and Vijay Priyan, Kribagaran, Sandhanam, all groundwork staff. Without them, this would not be happened. And I would like to, especially I would like to thank our coordinators who did very well organized. Please come together. Come forward, please. So they have done wonderful job. On behalf of you and management, I would like to thank all this team. Thank you all.
For national anthem, kindly raise.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाधा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you.
Happy Diwali to all.
Same team. Happy Diwali, all students, all staff. Happy Diwali.